Ladies and gentlemen, a warm welcome and a very good morning to all of you. My name is Aditya Malik, and it's an honor and a pleasure to be your host for today. BW Healthcare, an exclusive healthcare community of BW Business World, in association with Heal Foundation, is pleased to welcome all of you to celebrate Bharat Swasth Mahotsav 2022, to applaud and celebrate the efforts of India's top healthcare experts and Padma doctors. Today, you will witness healthcare experts of India as they discuss future of healthcare and challenges and celebrate the Padma awardees of the Indian healthcare system. BW Healthcare World is an exclusive BW Business World community that focuses on news and trends in the healthcare sector and emphasizes on healthcare providers, health tech, health insurance, finance, regulations, and people in healthcare. May I please request our team to play the community AV to give us a sneak peek into the world of BW Healthcare. BW Business World, led by Dr. Anurag Batra, Chairman and Editor-in-Chief, BW Business World, and founder, Exchange for Media Group, is the fastest growing business media house in the country. With a network spanning across 70 niche business communities and 8 magazines, BW Business World is proud to be entrenched in various verticals in the domestic as well as global business ecosystem. Now, may I please request our team to play the BW Legacy AV to give our audience members a glimpse of the BW Business World. Heal Foundation, founded by Dr. Swadeep Srivastav, is an advocacy group that works towards capacity building of health writers and engage important stakeholders of healthcare industry to brainstorm and design ideas for continuous improvement in healthcare space. Till date, Heal Foundation has organized 7 national health writers and editors conventions and 200 plus media workshops for the capacity building of over 1,000 health writers. Additionally, during the time of COVID, HEAL Foundation organized 150 plus stakeholder engagement webinars involving 300 plus stakeholders. Ladies and gentlemen, today's digital broadcast is being streamed live across all BW Business World and HEAL Foundation platforms, including BW Business World social media channels and on www.bwhealthcareworld.in. Well, as we flag off today's event, I encourage everybody to join in the conversation and share their learnings from the day by using the hashtag Bharat Swasth Mahotsav. Also, for today, all attendees can get a free screening of 20 plus metabolic vitals tested, including BMI, SpO2, BP, ECG, BMC, body and visceral fat, etc., on HealthPort developed by India Health Link IHL. And within 5 minutes, you can also get the digital report as well. And before we move forward, may I please request our team to show us today's events EV. Also, I take this moment to thank our partners for today. Our associate partner, Tata MD, Viatris, AliveCore India, India Health Link, Medica Bazaar, our knowledge partner, Nat Health, Healthcare Federation of India. May I please request our team to now play the partners AV. And now, without further ado, ladies and gentlemen, it's time for the opening address by our chairman and editor-in-chief, Dr. Anurag Batra. Sir was supposed to be here with us, but due to some work emergency, he'll be joining in a very short while. But he's been kind enough to send us a video of the same. Can you please have the video?
Good morning. Welcome to the first Healthcare Kumbh. I would call it a Healthcare Kumbh by BW Business World and HealthcareWorld Foundation. The BW Business World, BW Healthcare World, BW Wellbeing World, and HealthcareWorld Foundation have put this together. My congratulations to Swadeep, Rupinder, and all the colleagues who have worked in both teams to put this together. I don't have to overemphasize the value of health post-corona. I think if I need to focus on one thing, it is my health, which I am doing. But let me also say, from the business of health, health is supposed to be a service, it is. But Amazon is getting into health. That tells you that technology will impact in a big way the healthcare delivery business. Health tech has already become big. Telehealth existed for 2 decades in India, but really the acceleration in the acceptance that has happened in the last 2 years has made sure healthcare becomes more accessible for everyone. I must congratulate the Modi government for making sure a vaccine program that has really saved lives in livelihood. I remember last year when we completed 1 billion doses, there was a CNN article, 1 billion doses, but millions go without a dose. And it ticked me off, and I wrote a 2,000 word page, 2,000.
Okay, and before we move towards our keynote address, may I please request the BW and HEAL team to play the HEAL Foundation AV to give our audience members a glimpse of the HEAL Foundation.
Welcome to Bharat Swasth Mahotsav 2022. In sync with the Azadi Ka Amrit Mahotsav on the completion of 75 years of India's independence, BW Healthcare World and HEAL Foundation have organized Bharat Swasth Mahotsav to celebrate the healthcare change makers in India since independence. Bharat Swasth Mahotsav aims to bring together the entire healthcare industry to discuss the journey of healthcare in India since independence. We have segregated Bharat Swasth Mahotsav into 2 parts: Healthcare Changemakers Summit, starting in the morning, followed by Padma Doctors Congregation in the evening. Healthcare Changemakers Summit aims to bring to discussion the entire gamut of healthcare, wherein healthcare changemakers, industry health impact leaders, and experts will deliberate to present a comprehensive overview of healthcare in India. The Padma Doctors Congregation is being organized to honor the accomplished healthcare changemaker Padma awardee doctors for their humane service and innovative ideas which have brought about a drastic transformation in the healthcare landscape in India. Honorable Prime Minister Shri Narendra Modi ji has given us the vision of comprehensive healthcare under the from token to total approach. PM Ayushman Bharat Health Infrastructure Mission is the largest pan-India health infrastructure scheme that aims to provide a much-needed fillip to India's capacity to address emergent public health issues. In 75 years of independence, we have come a long way in uplifting our healthcare systems, adding various innovations to make them at par with world-class healthcare systems. But the next 25 years are very important for us as we have to become a world health leader.
Good morning. Welcome to the first healthcare boom. I would call it a healthcare boom by BW Business World and HEAL Foundation. The BW Business World, BW Healthcare World, BW Wellbeing World, and HEAL Foundation have put this together. My congratulations to Swadeep, Ravinder, and all the colleagues who have worked in both teams to put this together. I don't have to overemphasize the value of health post-corona. I think if I need to focus on one thing, it is my health, which I am doing. But let me also say, from the business of health, health is supposed to be a service. It is. But Amazon is getting into health. That tells you that technology will impact in a big way the healthcare delivery business. Health tech has already become big. Telehealth existed for 2 decades in India, but really the acceleration, the acceptance that has happened in the last 2 years has made sure healthcare becomes more accessible for everyone. I must congratulate the Modi government for making sure the vaccine program that has really saved lives and livelihood.
We need to take a pledge that while celebrating 100 years of independence, India will be the health capital of the world. Thank you.
Thank you. And now it's time to proceed towards our first keynote address on overarching responsibility of doctors in the changing healthcare dynamics post-pandemic. Ladies and gentlemen, please join me in welcoming Dr. Shahjanand Singh, National President, IMA, to deliver the same. We can be louder and warmer as an audience collectively. Thank you, sir.
Thank you very much, sir. Honorable Padma Awardee, Dr. Anurag Batra ji, Swadeep Srivastava ji. He is a very close friend of mine since long. When I was member of Medical Council of India and I was working in the IMA, at that time, Dr. Swadeep Srivastava is very close. Ravinder Singh ji, dignitaries on and off the dais, and participants. I am honored to be here to address the august gathering who have assembled here to discuss Indian healthcare. COVID pandemic has left a distinct footprint in the healthcare dynamics, not only in our country, but across the world. Such pandemic were not seen in recent past. A similar pandemic, Spanish flu, was witnessed in century ago in 1918, which affected around 500 millions people across the globe and death of all the nearly 100 millions. The present generations was not a witness to the catastrophe. The remaining epidemics and pandemics like like Asian flu, swine flu, Ebola, and AIDS made the healthcare industry and medical professionals to get equipped for similar catastrophe in future. COVID pandemic hits us like a bolt from the blue. The entire world was captured by this deadly virus in a matter of few days and brought to stand still entire development of work across the globe. At the outset, none of experts predicted that the pandemic will be continue over 2 years. India has seen 4.43 crores COVID cases in the last 2 years, with early 5.27 lakhs deaths. The effort taken by the government with the Honorable Prime Minister Shri Narendra Modi ji leading from the front of laudable. I would like to put on record the Indian Medical Association, which the entire members across the country stood firmly with the government, not only implemented and guidelines issued by the government, but also actively participating in decision making and guiding the government regarding appropriate COVID care and management. The citizen of the country will always appreciate and remember the contribution of the medical professionals, nurses and paramedical during the COVID pandemic, who served the public risking their own lives. Many a times, the healthcare workers had a remit to remain out of their houses for weeks and the months to avoid carrying infection to home. The pandemic gave a opportunity to the doctors to rebuild that trust and faith among the general public. The second wave of the COVID pandemic expressed the unprecedented of our healthcare system, both in public and private sector. The lessons learned in the first wave and the indicators left behind in different countries regarding the severity of the infections and after effects were not considered adequately and put into practice, leading to hue and cry among the public. Having said that, COVID pandemic has left us with possible impact among the healthcare delivery system in form of development in human resources management, material management, supply chain management, patients transfer management, environmental health management, nutritional management, etc. This gives us opportunity where the main manpower in the public sector and private sector would work in coordinations. In domestic manufacturers' capacity of medical equipment and consumables increased drastically to meet the unfrozen demand. The pandemic extended our ability of the entire organizations, coordinations, training capabilities, information and communication skills. The pandemic has further enhanced our responsibility to manage any such calamities and disasters with a confidence of positive outcome. A new model of healthcare delivery will seen emerging with more emphasis on public health in volunteers and preventive measures, telehealth, and dependence of digital technology. It may also be responsibility of the government as well as the private sector to increase the surge capacity of the infrastructures, including better sense, diagnostics, availability, and medicines, oxygen supply, and transportations. I am sure that the Indian healthcare in public and private sector is always prepared to face any eventuality to such magnitude in coming years. The lessons learned in the COVID pandemic in the form of COVID appropriate behavior will be routine practice among the public just as if universal precautions learned during AIDS pandemic has become a regular practice among the healthcare workers. With these few words, I would like to end the address with a positive note that the futures of the country will be safe in the hands of dedicated medical practitioners, healthcare sector innovators with the aim to achieve quality of affordable healthcare for all. I thank of organizers for inviting me and giving me the opportunity to share my thoughts. Thank you, Dr. uh, Anil Goyalji, who has come with me. He's a very active uh, leaders of the IMA. He's a treasures of IMA. He would be very soon very good. Uh, thank you very much, sir. Thank you, sir.
Thank you so much, sir. And with that, we move towards our first panel discussion on health tech in the fast lane, driving healthcare post pandemic. Please join me in welcoming our panelist for the same, Dr. Harsh Mahajan, Chairman, Mahajan Imaging Center, Padma Shri Awardee, Mr. Jitesh Mathur, CRO, Medica Bazaar, Dr. Pankaj Gupta, Digital Health Specialist, Data Scientist, Mr. Shantaram Jonalagda, Advisor, India Health Link, and the session will be moderated by Mr. Harbinder Narula, CEO, BW Healthcare World and BW Wellbeing World. Let's welcome them with a warm round of applause, ladies and gentlemen. Thank you.
Good morning, everyone. Thank you so much for joining us this morning. It's a Monday morning, and still you guys have taken out time to be here on time. So I really appreciate all of you, sirs, as well. Uh, we are living in a day and age where technology has not just made India proud for its IT, but the impact that it has been creating in the business of healthcare has transformed and brought India in the global arena. Today, we are proud that the world does not know India just for its IT, but it also knows India for the impact it is creating in the global healthcare space. But the role that IT is playing in healthcare is something that we cannot ignore. And that is the reason we chose this topic, to take understanding of all of you, to know what is the kind of impact that we are creating when it comes to healthcare. Dr. Pankaj Gupta, my first question would be to you, that the new buzzword in healthcare is AI, ML, big data. What is the biggest transformation that we are expecting to see in the healthcare industry in the near future?
Thanks for having me here. And I get the pleasure of starting this panel discussion with the first question. Um, so, lots of people talk about telemedicine and related things happening a lot in healthcare in the last couple of years. It got accelerated in terms of adoption. What we thought will happen in 10 years has happened already in the last 2 years. Um, in my perspective, there are three fundamental shifts that have happened. One, there is a technology shift. So from the erstwhile client server enterprise class, we moved into something called SMACI. SMACI being social media, mobile, analytics, artificial intelligence, cloud, and IoT. Now, this is a fundamental shift because it's a mobile first, cloud first technology which has come in. You don't design for the desktop any longer. And this has happened in healthcare. And you design for the mobile, you design for the cloud. It can also work on the desktop, but you design for the mobile and the cloud. So that's one fundamental shift. The second is a business shift. So earlier it was, a license-based model. Now you have shifted to a pay-per-use model, just like a utility. You pay for your electricity, you pay for your water, same way you pay for your software in healthcare. So that is the second fundamental shift that has happened in the pandemic in the last 2 years. And it will continue, it is going to accelerate. It's going to become, the aggregators will come into play and all that. Just like, Anurag was talking about Amazon getting into healthcare. The third one is the policy shift. Now, especially that has happened in India, Modi government has actually made the policy shift to support all of this. The National Digital Health Blueprint is fundamental premise is mobile first and a cloud first. So these are the things that have happened, and they're going to carry, the mission forward in terms of making it global. And very well said that India is poised to become a global leader in healthcare.
Absolutely. I think it's a very beautiful point that you brought in, because I've heard that in technology conferences and internet conferences, when we talk to the startups, they're talking of going mobile first. But today, I mean, if you look at the products that are displayed outside, these are all handheld devices and which give you the information in your own comfort. Dr. Mahajan, how has the business of diagnostics evolved using technology? And from the perspective of equipment we use, the analysis of data that we see, the outcomes that we can create, how has the diagnostics business changed or evolved, keeping technology in mind?
Uh, Thank you very much for that question. I must compliment, my co-panelists for putting things so succinctly, so clearly as to the shift. He's put it so well, left nothing out. And now in the diagnostics industry, uh, as doctors, we are still reluctant to call medicine as a business, even though it seems the world has come around to using that word. As a practicing radiologist, it still, rankles somewhere. But be as it may, we have to move with the world. Now, in diagnostics, technology in the last 3 decades has played a major role. If we look at lab medicine, pathology, from a pathologist actually doing the pipetting, looking at things, trying to see the color and figuring out. Today, we've reached a stage where thousands and hundreds of thousands of tests are run automatically on machines. Of course, you have to take care that all the standards are maintained, the controls are put, and one pathologist may be signing out 5,000 reports in a day, which may have been 50 or 100, even 20, 25 years ago. And these, if your controls are put, if you are maintaining standards, by and large, you would be getting accurate results. So that's a transformation which has happened because of technology in lab medicine, in pathology, where today you are able to accommodate in one center so many tests. And also because of that, pick up these samples, the hub and spoke model has really come into its own because of the march of technology. Would not have been possible otherwise. Now, if we look at radiology imaging, we were always, uh, you know, technology enabled right from the beginning. It was always digital. What has happened again is that with the expansion in the computers and the uh, uh, advancements that have occurred in that field, today we are able to do very high resolution scanning. Scans like I started doing MRI scans 35 years ago. It would take 1 hour to do one scan of a patient. And with the matrix sizes or resolution, which today, when I even think of how confidently we used to write the reports at that point of time, it was the best available at that time. But still, when you look back, you marvel at how much of a I would say risk we were taking in calling small lesions and all of that. Now, today, what I'm able to do in 15 minutes on an MRI scanner, it would have probably taken me 5 to 6 hours to scan one patient. And there's no way that even in 1 hour, a patient tends to move. So think of that. So that has enabled uh, us to diagnose illnesses, diseases, which was just not possible earlier because of advancement of computers, computing power. Each one of us carry a supercomputer of old in our pockets. And so that's the transformation. So what has happened is that our throughput has increased. Um, Also with this, today with teleradiology, telemedicine, one is able to do, in underserved parts of the world where radiologists may not be there, images can be brought very easily. And it's become very cheap also. When we started 20 years ago, those lease lines cost a packet. Today, it's become very, very cheap. So there is what has happened with technology is this democratization of healthcare, of quality healthcare that has happened. Um, of course, there has it always been this problem with the affordability in our country. And that's where I think technology, the new AI systems that are getting available will not only improve quality, not only improve turnaround times, but we hope will also reduce healthcare costs and be able to fill these specialized manpower gaps that exist not only in this country, even in England or the US. There is specialists with the advancing reach of diagnostics. The number of specialists can never keep pace, and we hope that AI will be able to help in that field. I mean, I could go on and on, but I think without technology, diagnostics would not exist as it exists today. And also with technology has come improved and better and more accurate diagnosis, and frankly, marked, marked lowering of costs, even though we may find it not affordable.
Uh, that's brilliant, Dr. Mahajan. What I hear you say is that in an industry which has always been using technology, that's been the baseline of the way it operates. The biggest challenge that we see in terms of accessibility and affordability, technology is playing a role. We are, it just reduces the dependency on people. And much as we don't like calling it a business, but it is still an industry and it has to sustain itself. By reducing the cost, it is also making it affordable for us as users end users. So
If I may just, you've touched on a very important point of not only affordability for the patient, but also viability for the
absolutely,
provider.
absolutely,
So that's one thing we cannot lose sight of, that even though we want every best technology in the world to be available, but at the same time, we should be willing to see that we are able to pay for that, even at 1/10 of what it costs in the West.
absolutely,
We are able to survive and thrive, but it should not be that we somehow kill the sector itself
absolutely,
because of the fact, especially for those who pay out of pocket, actually end up subsidizing those who come in
absolutely.
various schemes. So viability,
It's very, very
along with
important.
affordability,
Extremely,
has to be kept in mind.
absolutely, absolutely. Mr. Mathur, uh, when the technology starts playing a role that it impacts the particular industry, a lot of these startups keep coming in and they start, entering the sunshine industries. What, as per you, is the key aspect that is fueling the investor excitement that we see in health tech today?
Thank you very much for inviting me and the question. Uh, in my perspective, technology has changed a lot of methods and concepts which were used in healthcare earlier. And that means that it is able to reach much more number of people. Doctors are able to connect to their patients in a very different manner. And patients or their families are able to, receive healthcare in a very different manner. And which means that technology is enabling the entire healthcare industry to keep evolving into places, into areas where it was not there before, and also moving out of very, very high-end specialized hospitals and areas to much, different environments, settings, moving to diagnostic centers, moving to clinics, and also in some areas where it's possible, moving to homes. Uh, because of that, there is a lot of reach of healthcare which is improving, and that means that the number of people who can receive healthcare or focus on their wellness or focus on improvement of their health is really increasing. Uh, in any industry where technology is able to transform the way and make it easier to use or easier to consume, that industry will evolve and move forward. We have seen this in the past, several years back in the aviation industry. We have seen it in the banking industry in the last 15 years. Today, nobody visits a bank actually. And we are seeing a lot of this in many other sectors in industries, various other industries. And in the last 5 years, we are seeing this in the healthcare industry, where while keeping the clinician focus completely there, technology is able to really transform the way clinicians can use the technology, the patients can use the technology, and also the entire equipment providers, technology providers, and manufacturers are able to become an interface between a patient and a clinician. From an investor's perspective, the more number of people who can receive this care and get connected, on the whole concept of healthcare, the investment interest will increase, because investors or any large organizations across the world would like to focus on any industry which can cover a lot of consumers, which can connect to people, and which can focus on welfare of the society as a whole, while generating good clinical outcomes and various other technological aspects. So that is what is driving. In health tech, we have seen in the last few years, you mentioned about startup. I come from a startup myself, which is Medica Bazaar. Around 7 years back, there were hardly any companies like this. We are an aggregation platform, and we help hospitals, diagnostic centers procure equipment on online platforms. And that is something which is really becoming bigger and better and becoming usable. As we move forward, all these platforms where, where technology can play a role. Startups will, many startups will come in these, areas. And that's how investors will back them up and really promote the investments to, fuel the growth of the sector. Uh, from clinicians' perspective or from the perspective of doctors, it also brings a huge convenience and ease for hospitals, for procurement teams, for various other, clinicians. Like Dr. Mahajan, my co-panelist, just mentioned that he used to do an MRI in an hour, and now he does it in 15 minutes. Of course, technology is enabling it. Similarly, maybe he used to spend about several hours or, several days studying about equipment, technologies, while today there are aggregation platforms which can do it in minutes and help them. Similarly, many manufacturers who were for whom it was difficult to reach out to small customers, small clinics, nursing homes in tier 2 and tier 3, 4 towns, can reach out to them through aggregation platforms, online platforms, and so many other, media. Patients are buying drugs or medicines, prescription medicines online, and using this technology. And so are doctors, large hospitals, medium hospitals, and small hospitals. So, in summary, I think startups will flourish more and more because technology is evolving. We are, I think, at the tip of the iceberg in technology in healthcare, while many in the other industries it's very mature. So there'll be many more startups, many more investments, and lot of more technology coming on our way, helping the patients of globally and in India. Thank you.
You know what? With every challenge, there comes an opportunity. We've seen that in the pandemic. We've seen the startups and the founders getting excited and feeling for the first time that there is an opportunity in healthcare, because otherwise they were always struggling with this one question: can we scale the business? And what startups actually do is that they bring in two values. One is that they bring in efficiency. So sometimes you do not have to disrupt and displace something to replace with something new. You can always build efficiency in what has already been happening. And we've seen that across every aspect of healthcare. And the second thing that they do is they fill the need gap. And what we've seen technology do is that it has brought or bridged the gap between care seekers and care providers. With that, I come to the next question, Mr. Shantaram. One of the gaps that the technology is bridging is the access of healthcare to tier 2, tier 3, which means remote monitoring systems. So my question is, has digital delivery using health tech led to increase in efficiency in remote monitoring in remote areas as well? And has it brought the world closer and more accessible to healthcare services?
Thank you so much for that. And it's my honor to be a part of this panel. And thank you for Business World and Heal Health to give this opportunity. In terms of the remote monitoring, I would say absolutely. I mean, I think technology, which Pankaj also alluded to, going mobile is one of the best ways where you see remote monitoring take a big fillip in terms of moving to remote parts. And, India, if you look at, there are 2 or 3 technologies where we have leapfrogged the West. I mean, one is in terms of communication, right? I mean, we moved away from cables directly to wireless, and that has enabled, and Jio with its low cost, we are probably today one of the lowest cost wireless, your Wi-Fi providers in the world. I mean, and so that's the speed of data that we are able to provide to all the remote corners of the country. So given that we have the technology and we are mobile enabled, I think it has helped us do the remote monitoring. Of course, I come from India Health Link, and we have HPOT, a kiosk, which also helps. It's the confluence of physical and digital. In fact, we have it outside here, which I would advise all the participants here to go and take a check. In 5 minutes, you get your full checkup of 20 vital parameters. And what you see is that these kind of technologies, right, which are able to work in remote areas where you have issues with power, where you have issues with connectivity, where you have issues with local language. I mean, so you need technologies which are able to communicate in local language, which are able to connect to the Wi-Fi, which have enough and more backup built in to cross the the remoteness of these areas. I think that's where technology helps, and I think we are very much there.
So, Mr. Shantaram, you brought in a very important aspect, which usually gets ignored, that sometimes the development of technology is not just about the technology for healthcare. It is the technology around that enables that technology. For example, the access to broadband and the telecom and the access to uh, the supercomputer, as Dr. Mahajan said, in our pockets today, that has also helped where we are today. You know, uh, Dr. Mathur, I want to ask you one more question. That, do you think with the government initiatives such as Made in India and Atmanirbhar Bharat, we are back on emphasizing more towards R&D than simply importing stuff from abroad?
I think that's very true. In the pandemic, we realized that unless you had it made within your country, you just didn't have it. There were so many competing, countries for the same products, and those who can pay more were the ones who were getting it. So the lesson was learned very quickly, and I think the government has done very well. It went into action, and the industry galvanized itself. And if we talk of just the masks and the PPE kits, I remember at that time we had reached out to Medical Bazaar when the pandemic started, and N95 masks were just not available. Each and every N95 mask in this country had to be imported, and they had, they were nice enough because of our friendly relations that we got 500 of them at 500 rupees each. 500 rupees each, and we had to beg for it. From that, our exporters of garments, the textile ministry actually got into action along with the health ministry. And today we are net exporters of PPE kits and masks and all sundry such items. It's become a $1 billion industry. So, I mean, this one example, today you can buy a N95 mask for 20 rupees. And, PPE kits, which at that time were just not available. In the beginning, I remember we paid 2,000 rupees for them, even when we got them. Today, 200 rupees, and we are exporting, getting foreign exchange in. And also, please remember, our quality was very high. There were times when those that were imported from China, we could not use because of quality issues. Here, quality has been maintained. Similarly, with the, medication, and also, most importantly, the vaccines. Would we have had any access to vaccines if they were not manufactured in this country? And also, of course, the Covishield was something which was developed outside and we manufactured it. But with Covaxin, this was an indigenous vaccine, and there are so many more. So what happened with the enabling atmosphere that was created by the government, with the public and the private actually coming together? This was one time when we saw that the trust deficit that generally exists just vanished. And we were standing shoulder to shoulder, walking hand in hand, and vaccines, so many other areas. Uh, but I think these lessons we've learned from the pandemic need to be sustained, and we need to look at other areas. Not that the government didn't have a Make in India project. It was there much before that. And I can allude to one of them, which I'm a part of. This is the Make in India MRI system, which is under the Ministry of Electronics and Information Technology. And with 5 major government research institutes, last 6 years, I think we've been able to reach a stage where at least at the component level, we have it all made. Now, the magnet, which is very tough. I mean, I can tell you that Samsung 10 years ago wanted to make a MRI scanner, and about 4 years ago, they gave it up, you know. But we, I think another year and a half, we would have a product which then can be taken by the industry. So no, we should, I think, not only think small. Okay, the startups are great. They come up with new ideas, disruptive technologies, but also existing, you know, technologies which are there. Because then if something is made in India, it and if we maintain the quality, it will definitely be cheaper. And hence making healthcare more affordable. So I think the government has done well. Also, the public and the private sector and the academia, somehow where we lack is the industry and the academia coming together, as it happens in many parts of the world. Israel would not have been what it is as a leader of technology. Similarly, Germany, US, UK, unless the academia worked hand in hand with the industry. And that's where I think things still need to be improved.
That's a brilliant point. That's a brilliant point. Mr. Mathur, since you are the one who's aggregating the manufacturers, distributors, etc., and making technology or medical equipment and supplies available to the industry, what is the difference that you have seen pre-pandemic and post-pandemic when manufacturing kind of took off from frugal development to quality products being made, and then the government's initiative of Made in India and the PLI scheme? What is the shift that you are seeing, and are we really maintaining the quality?
Thank you. Uh, what we have seen is that manufacturers are investing a lot and very keen to manufacture in India. This was not there before pre-pandemic because there was an easier way out. There was imports possible, and there were hardly any government, incentives or initiatives which were promoting local manufacturing. But now, because of the PLI scheme and because of many other initiatives which have been rolled out in the last 5 years, there is a lot of focus on manufacturing in India. Your question was, is quality maintained? I think there is significant quality being maintained by manufacturers who are manufacturing in India, since they are focusing on products which are possible. Indian manufacturers are not trying to do things which are or launch products which are premature and which are not finished in quality, unlike many other countries outside India. Uh, Most of the manufacturers that we are aware of, they may be working on complex products, but they wait. They are doing the real, high quality production possibilities, doing the testing, and then only waiting to launch the products. So quality is being maintained. I think we are already at a very high quality level in syringes, in PPE kits, in masks, and as Dr. Mahajan mentioned, a lot of accessories, which includes many products which are used in hospitals. We are at a very high quality level. In equipment, in many equipment which are ECG diagnostics, defibrillation, and ventilation and patient monitoring and such kind of products, we are also at a good level of quality in India. And some of these are better than world-class global products. In high-end, very high-end products, I think there's a lot of work going on all across with various clinicians, with various government partnerships, collaborations. And in a few years from now, we should be able to have good products rolled out in those aspects also. On reliance on import, uh, especially for the basic accessories and basic products which are required, the reliance is really going down. as the day goes, because more and more manufacturers are able to produce high quality, high volumes here. On equipment, we are still relying on a lot of imports, and that is something that the whole industry, which includes the government, manufacturers, and all the clinicians, have to work together to see how we can bring up the quality of high-end equipment in India, so that our reliance on imports goes down, and then we can really get down to better pricing levels and better access level for the patients in India. Thank
So
you.
I think, that's a very proud statement. It makes me proud that, we are bridging this gap. And also, it's not just that we are able to manufacture something in India, but we are also able to match, or even in many cases better, the quality of the products that we are making accessible. And one more thing that we must also remember, that while until very just before pandemic, we were all talking about the world becoming smaller, things being accessible, कुछ भी कहीं से भी मंगा सकते हैं किसी टाइम पे. We actually saw that all kinds of transportation, etc., could come to a standstill, and that is where dependency can really be a factor which deters, the supply of products, etc. Dr. Mahajan, you want to say something?
Just one quick comment. 10, 12, 15 years ago, the slogan used to be Make in India for India. Today, the slogan is Make in India for the world. And that itself has led to this transformation. So the quality has to be of international standards. And I think the youngsters who are coming into manufacturing or med tech or any other technology, they are aware of it. The whole world is now our market.
Yeah, yeah. And the absolute reason why we are all sitting today is to discuss how can we not just be at par with the world, but how can we be the leaders in healthcare, showing the journey, showing the path to the world. Mr. Gupta, since you've been involved with the Ayushman Bharat thing and you're an advisor to them, Ayushman Bharat scheme is one of the game changers that has been introduced in India, and for many reasons. But every scheme, every policy comes and it achieves certain things, but it also misses certain things. What are the key hits and misses in your mind when it comes to Ayushman Bharat?
So you're putting me on the spot. Well, so in terms of hits, I think all the right things are in place. So the policy is there in place. And then if you look at under Ayushman Bharat, the 4 pillars, as it's called, one being the digital health mission, the second one, the PMJ, which is the health insurance or the assurance scheme, third being the health infrastructure mission, and the fourth is the health and wellness centers. If you put all of them together and they work hand in hand, then technology gets into pretty much everything that you have to do, from health insurance to the provider to the primary care. So everything across the board. So it's the same platform, technology platform that services the public sector as well as the private sector. So that's the intent, to sort of bridge the gap across the board. So that's a hit. Now, in terms of misses, I think it's not really misses, but we are taking a quantum leap forward. Now, when you take a quantum leap forward, there are bound to be capacity gaps. So we have to do capacity building. A lot of capacity building on digital health, a lot of capacity building on health insurance, a lot of capacity building on health infrastructure. Now, we don't have that kind of a education framework. We don't have that, and new education policy is in fact helping, because crossover skills will have to be built between healthcare and technology, between healthcare and insurance, and so on and so forth. So that's the very big capacity building gap that is there. The second one is in terms of the ecosystem. If you have to build the ecosystem, you have to bring the market together with the policy. They have to be accelerators. So you need to have market accelerators which will help the organizations come up to speed on the new things that are being put forth. And this will have to be not only just accelerators from perspective of putting the standards in place and things like that, but also helping in procurement, because procurement continues to be a gap. Whether you look at private sector or the public sector, I talked about mobile first and cloud first. But if you look at any tender coming out, you look at any RFP coming out, it still talks about a turnkey solution with 50 crore turnover. Where is that going to happen? And it doesn't talk about mobile first and cloud first as a requirement. So those are the things that sort of need to change across the board.
So you touched upon education as one of the things. Now, we always find that there's a gap between the healthcare, the number of healthcare providers that we need in the country versus the number of doctors passing out or the experts getting trained. What is the government doing about this? And uh, keeping in mind that the quality versus the quantity uh, challenge that we'll face.
So quantity versus quality, I think if we want to be global leaders, we need to have both. It cannot be either, and there cannot be any compromise on either. So we will have to sort of, and it's not like, we have a long runway to take off. The time is now. We already, as a country, are the sixth largest economy in the world, going to be the fourth largest economy in the world. And the time is now to sort of go to that level where we will have to have quantity and quality in the same sort of mix. So yeah, that would be my answer.
Dr. Mahajan, when uh, we are seeing a lot of foreign patients coming into India. When we go to the hospital or when we even go to your center, we see a lot of foreigners there. Uh, how has health tech and the improvement in the efficiency it has built in the healthcare system contributed to the medical tourism that we are seeing?
I think it's still not made as much of a difference in medical value travel as it has in other fields. We still remain, a broker based, if I may dare to use that word, uh, system where there are intermediaries, and okay, that may be a legitimate business for them to bring patients from one country to the other. We have attempted in the past, several groups have attempted to make it more cloud based, more accessible. Uh, but I think till the time that the governments and the embassies, they get involved, and there's been some attempt made in that direction as well, but probably the pandemic disrupted that. It will have to be to some extent at government to government level, where governments are able to say these 500 institutions in India are good, or be able to categorize them. Also, there is this feeling that the foreigners who come, even though it is very cheap, yet they end up paying much, much more. If that is 20, 30, 40% more than what an Indian would pay, I think that's fine. And as long as they know that is what they are going to pay, but sometimes it can be very different. So unless we get our act together, and technology definitely can play a major, major role, someone goes on a, website which is probably accredited by the government, maybe NABH can play a role in this. Some kind of accreditation, some kind of quality to be maintained at affordable price, which it is. We are much, much cheaper. I mean, quality healthcare we provide at 25, 30% lesser than our neighbors. Let's forget the West, or even forget, say, Thailand and other healthcare destinations. We are cheaper than Pakistan, Bangladesh, Sri Lanka, and Nepal. And the quality we provide is very high. But I think still much needs to be done in this, and this can't be done by the private sector alone. The government would have to, maybe the External Affairs Ministry, along with the the Health Ministry, would have to play a role, an enabling role. Not that they run the system, the private sector can do that, but they would need to be the enablers of bringing that system in.
Mr. Shantaram, I would take the same question with you. Uh, when you have people or patients from overseas looking at coming to India, initially it was just a phone call that they would make or try to get as much information from the brokers as Dr. Mahajan said, and then make a choice. But today technology is beyond the medical devices and the health tech. The communication, the telecommunication allows you to be in a environment which is as good as sitting next to a doctor and speak with them. How is that changing, or how do you think will that change to increase the medical tourism in India?
Yeah, I think leading from Dr. Mahajan's statement, I think one is like Dr. Mahajan said, the government needs to get in. And I think even Prime Minister Modi's address, as far as the August 15th Independence Day address was concerned, there is this increased focus on India being a destination for health tourism. Now, if you look at where we are today, technology, in fact, teleconsultation, just before COVID was 1 to 2%, okay, of consultations. Post-COVID, it's gone up to 30%. So there is a greater and greater acceptance of technology. So in fact, even Anderson Horowitz, right, the VC firm, they said that what used to happen in health tech over 10 years has been accelerated to 2 years because of COVID. So in a way, we need to thank COVID that the mindset has changed. I mean, and that's a big one. So we have, excellent talent in India. And like Dr. Mahajan said, the cost structure is unbelievable in terms of. So I know for a fact that dental implant in the US, $5,000. Here it's 50,000 rupees. I mean, where is the difference in terms of the price point, right? MRI in the US, I paid $700 for an MRI. I mean, here it's less than $100 in terms of the MRI cost. So, the fact that we are able to leverage technology to provide that kind of inputs across the world. So distances become, irrelevant in that kind of a situation. So you're able to provide the consultation, you're able to provide the pathological inputs, you're able to provide, any help that is required for the patient to kind of tide over this one through remote technologies.
Yeah, I think I completely agree with you and resonate with what you're saying, because like work from home has transformed the way everybody is working. While teleconsultations have been available for a decade, but the acceptance wasn't there. But during the pandemic, we've all got used to, getting a consultation from a doctor without actually visiting them, and rely on that. Sure, sir.
The way the session is being conducted looks to me as if you are a teacher and they are the students attempting to answer your questions. They are addressing you only, not us. Second, with the advent of this technology in Medicare, that patient-doctor relationship has bending. It is gone. The patient who considered doctor as next to God is feeling weird. Doctors are not behaving like that. They are, wherever needed or not, they are referring to the diagnostic centers. They are not touching the pulse of the patient. For what fear, I don't know, whether they don't understand to read it, or because of pandemic, they are not touching. But whether required or not, the patient is being referred to diagnostic center for investigations, rather than having that touch, rather than having that caliber.
I understand your question. Dr. Mahajan.
Let me answer that, sir. So the fact is that we are living in the age of evidence-based medicine. I mean, we have all gone to our neighborhood doctor who would give us ek lal shishi, ek hari shishi, and we would take it, and ठीक भी होते थे, नहीं भी होते थे. Our age expectancy was 36 when we got independent. We are at 70 now. Today, the problem is also with our training. When we were taught, we would touch and all of that. But then came technologies, diagnostics. Today's youngsters do touch, but we have gotten more dependent on diagnostics. You're right in that sense. However, think that if someone were to give you, touch you, feel you, hear your heart, give you medication, and you didn't get well, instantly people tend to go to the consumer court, and the consumer court give crores worth of penalties against doctors. So in evidence-based medicine, everyone, the patient included, wants to know that if you're giving me this treatment or this medicine, why? What is the evidence based on which you're giving? Show me the test. In fact, half the time patients get the tests and go to a doctor. कि ये तो करा ही लें, वो बोलेंगे. So the entire scenario has changed, sir. Today, if you were to be given medication just by touch and feel or over the phone, you would not accept it unless it's some khansi, zukam or minor thing. More than that, you would want diagnostics. And then in this era of evidence-based medicine, litigation, medicine being considered a business and a commerce, there's no escape. This is how society has evolved. This is how medicine has evolved, and we have to live with it.
I'll take a cue from that particular issue that has been raised and what you have just said. Uh, Technology and psychology are playing a role together. I mean, if you look at pandemic and what it has done, we have all become little more conscious about preventive healthcare because we realize that we need to maintain our immunity. We need to keep ourselves healthy just in case there's a challenge that comes up. My question to anyone who wishes to address is that how is technology helping us today to understand our bodies better and to ensure that we are healthier, and if there is a problem that is going to occur, we are aware of it and can handle before the the challenge comes in. Yeah, please.
Yeah, that's a great question. And I think what you've seen in terms of our technology happening is also all the variables that have come in, right? I mean, they are giving you inputs on a regular basis, and this is going to the cloud in terms of your heart rate, your BP, and there are test kits that you get at home for measuring your sugar. So the fact is that even in India, we've been so far mostly curative in our approach, right? The fact that we can be preventive, and with the fact that it definitely leads to much lower costs on the longer run, is coming in. And I think technology is a big enabler of that. Even the edgeport that we've put outside is an enabler in terms of showing the kind of diagnostics that you can take so that you are able to take action much before the disease actually strikes you. So I think the technology is a great enabler for doing this in terms of what we see today.
I think just to add to that, AI is also evolving into predictive medicine. And Dr. Mahajan will agree to this, that there are a lot of research which is happening on artificial intelligence, which can detect what is wrong, but also really predict what can happen after a few years based on the conditions today. And that would really help, evolve into preventive maintenance medicine much better than what we are today. So that's how technology is helping. Yeah.
Yeah, if I can also add to that one quickly, I see that the times is up, but technology is helping in multiple ways, especially artificial intelligence. Look at what DeepMind has done for the protein folding. That was a mystery that science was not able to solve till date. Today, DeepMind has been able to predict that protein folding for 95% of the human proteins with more than 95% accuracy. this is going to, transform the way medicine. So we are getting into a precision medicine era. And the other thing is the mRNA technology that was developed, all the kinds of vaccines that were developed, these are all bioinformatic vaccines. So it didn't go through the, traditional cycle of research. That is the reason we got it in less than a year. So, technology is not just, mobile, but, it's also playing a vital role on the other side. So I just want to add.
Dr. Majan, your last words on this?
I would just say that it's not technology for technology's sake. Technology and adoption happens only if it is useful on the ground. And we've seen that during the pandemic, and we will continue to see it as we go forward.
I remember I used to work at Google, and one of the things that we used to keep in mind is that build something which is usable and useful. And that is when the adoption will happen. With that, I thank you all for taking our time to be with us today. I think this conversation for me has been very, very useful, and I'm sure the audience would have resonated with every word that has been spoken here today. I thank you so much from the bottom of my heart, sir. Please. And before we move, can we play the IHL video? I mean, since it talks of remote monitoring. Yeah.
And that was the video by IHL. Okay, after first panel discussion, it's time to proceed with the next keynote address. And to deliver the same, ladies and gentlemen, please join me in welcoming on stage Dr. Amit Verma, founder and managing partner, Quadria Capital.
Is that a pointer or green one on top? This one here? Okay. Thank you. Can I get the slides up? It's not moving. Excellent. Good afternoon, Namaskar. My name is Amit Verma, and my job today is to talk to you through beyond the nuances of what we heard on health tech, and actually to decode it. Some of you may know I've been practicing critical care for almost 25 years, and fortunately, over the past 10 years, have had the ability to now invest in healthcare. So what's that done is given a very unique seat on both sides of the table, and sometimes it also enables us to understand each other better. I represent Quadria Capital and HealthcareWorld. Both are slightly different. Quadria is a growth private equity provider. HealthcareWorld invests in earlier stage startups, and be happy to provide you more information later. Now, I'll stay away from the macro. Most of us know it. Unfortunately, it took a COVID to explain to the world that we do not invest enough money in healthcare, period. Healthcare and education, to my mind, are core infrastructure. So while it is important to build the roads, the bridges, the airports, the connectivities, clearly for a society to succeed,
If we do not invest money in healthcare and education, society will have a problem. Now, we've been crying ourselves hoarse for the past 10 years, talking about the lack of healthcare support. As I said, unfortunately, it took a COVID to prove the point. We know the problems. It's about accessibility, it's about affordability, it's quality. And most importantly, which we did find out in the initial stages of COVID, especially with the supply chain collapsing, it is all about what happens being inefficient. Now, this is true not just across the globe and in other emerging countries, but predominantly in India, the numbers are staggering. If I tell you that the most common cause of bankruptcy now in India is healthcare costs, you would be surprised. It's not agriculture. It is because people cannot afford healthcare costs. Now, why is this important? Healthcare, ladies and gentlemen, is not discretionary. If you have chest pain, it needs to get fixed. This is not about buying a TV later. And that is why it behooves us, for all of us in this room, to ensure that we are able to address and get healthcare to where it's needed, which is in the rural, tier 2, tier 3 cities and the hinterlands. And the stark disparity between urban and rural comes out even more. We also realize that we will have to think out of the box. It's quite clear that trying to build infrastructure or putting brick and mortar without incremental benefits of technology, we will never get there. If I just look at the investment in healthcare, the capacity building, and this, mind you, as all of you know, it's not about putting up a building. We're not building hotels here. We are talking about now training doctors, technicians, and nurses. Where do you get the manpower? How do you standardize the EMR? How do you make sure people actually get paid? It is an enormous task. And that is why I truly believe that if we use technology wisely, and as was mentioned in the previous session, make sure that it is usable by the people who are actually using it, that will make the difference. So if I were to turn around and look at how health tech can be expedited in India, it's very clear. There's certain fundamentals which are already on the ground. Our literacy rates, our smartphone users, online transactions, as everybody uses UPI, we understand we are at the forefront of doing something which other people in the world don't do, which also gives me optimism and confidence that we will end up implementing it better and faster than most countries in the world. Why do I believe that this will be accelerated? Because every single peg point that we are talking about, and I won't bore you with all the details, things are going to change. What we do in hospitals for point of care, what we do with data ownership and analytics and how we handle that, how we reference points go from populations to actually individuals, because now we have access to data, to the physician's role, where physicians were the gatekeepers of how these decisions are made. And actually now it's moved on to the patient, and many such examples that I can give you, which will change the way we've been practicing medicine. Good, bad, ugly, happy to get into that debate later. But this is inevitable. This is going to happen. Now, there are enormous number of technology solutions in healthcare. But my biggest beef right now is people widely use technology as an end all. Technology by a word is not going to change how we deal with healthcare. What is needed is the integration of healthcare and technology. So let's get into some examples. When I look at the healthcare value chain, all of these models here can be changed. So whether it is into diagnosis, treatment, recovery services, claims, payment, to make the systems efficient, every place here, and probably we'll get to it during our conversation at the panel, where we can take live examples of any of these and give you something that makes sense. Why I also believe that digital healthcare will enable us to do everything that we talk about, whether it is in healthy living preventive care, it's about in-home and remote care, and integrated care, diagnostics, and treatment. I have friends from medical equipment, ex-medical equipment here, and we used to have debates 10 years ago about how do we integrate the data that we're collecting. We were creating so much data, but we didn't know what to do with it, and it wasn't leading to any betterment of our patients. I think we are finally at the cusp of making this truly happen. So what do I think will evolve in the next 5 years? There's going to be patient-centric models. They will be doctor-centric models. And mind you, doctors usually are the biggest bottleneck to change, but we are changing. We are being forced to change. And finally, you will have provider-centric models because this will enable cost efficiencies into the system. They will be pharma-centric and payer-centric. Again, I'll leave it to the panel discussion later. So just let's talk about what is going to happen. Healthcare is growing anywhere from 15 to 30% CAGR year on year. You take a decent healthcare company, leave it alone, it will grow 15% year on year. What is also going to happen is that there will be enablement of all the technologies that I mentioned. The health tech market size, and I'm specifying only health tech here, is looking at growing phenomenally by almost 25% annually. What does that lead to? Three important things that people need to, and some of you probably are more educated than me, but in the interest of ensuring that everybody on the healthcare landscape understands tech the same way, there are three words which are going to be very important, and they're used freely. It's almost like using PCRs. Like 2 years ago, if I said PCR, nobody would know what it is. Now it is a breakfast topic. Same thing will happen over here. It is about artificial intelligence. So the components of AI and how it will make it well. The next is blockchain, which you must be reading in a lot of the financial newspapers talking about blockchain. And here, what I mean by blockchain is patient-centric electronic health records, supply chain transparency, securing clinical trials, automation and fraud production. All of this can be brought in at the back end. And the third term that you need to know is Web 3.0. So you've been again hearing snippets of it in the market about how Web 3.0 will change the way our lives function. For us in healthcare, what Web 3.0 will do will bring together the read, the write, and more importantly, artificially execute. So it will take away the control to execute from you. Because it is learning on the job, it will enable us to get better and better. What I do believe that this tech-enabled fluid triangle will do is do three things. It will increase affordability because it will drop costs and it will bring more and more patients into the net. We all know that unfortunately, we will always create more patients than we can treat. It now behooves us to find a way of taking care of them. Number two, it will improve accessibility. And it's again about remote. It's again about taking the monitoring and the treatment to the patient and not expecting the patient to travel 500 kilometers to come and see you. The third is enhancing quality. And unfortunately in India, we don't talk enough about quality because we keep focused on so much on affordability that we lose sight of the fact that for quality to be of a certain level, there needs to be some value creation and some optimization. So I like to call it the need to develop affordable, reproducible care, which brings quality at the forefront. And lastly, a lot of times people keep asking me, so what are your challenges investing in India? And I always say, anything is possible in India. You can get the best technology, the best vehicles, but you need to know that in India, you will come across unseen and unforeseen roadblocks. Be patient, be honest, be ethical, you will succeed. Thank you very much.
Thank you so much, sir. With that, it's time to move towards our next panel discussion on enabling acceleration of healthcare innovations ecosystem. Dr. Verma has already started the talk, and now let's continue it with a few more panelists. Please join me in welcoming a panelist for the same. Dr. Amit Verma, founder and managing partner, Quadia Capital. Dr. Mahipal S. Sachdev, chairman, Center for Sight Padma Shri Awardee. Mr. Naresh Hasija, vice president, Viatris. Mr. Prashant Warrior, co-founder and CEO, Cure.ai. Mr. Sudhir Mishra, founder and managing partner, Trust Legal. And the session will be moderated by Dr. Swadeep Srivastav, founder and chairman, Heal Foundation and Heal Health. Dr. Srivastava is there. He's just joining us. No problem, sir.
Sorry, there was a call from MOS office. We are also preparing parallelly for the evening program. And that's the essence of this whole Bharat Swasth Mahotsav, wherein one of the key center attraction which we have kept in this celebration this year is because of 75 years of Amrit Utsav, what we are celebrating for the country. Similarly, we wanted to celebrate for our doctors. So this time we have focused on Padma Shri doctors. And in the evening, we are having more than 50 Padma Shri, Padma Bhushan, Padma Bhushan celebrated doctors to be amongst us, where Union Health Minister Dr. Mansukh Mandavia and MOS Dr. Bharti Pawar, they both are gracing the occasion in the evening. So today, that's why we have our chair, Dr. Mahipal Sachdev. He doesn't need much introduction. He is a Padma awardee himself, Padma Shri awardee, the pioneer of healthcare, what you call eye care in India, one of the pioneers. I remember, and most of the people on the panel have been fortunate enough to work with them for the last 20 years. I have 20 years, 10 years, a decade. I have known most of the people on the panel, except Prashant. Hi, Prashant. Hi. So I'll keep it very light. I'm not going to be the professor. Because I am myself a student, these people are my professors. So I'll keep it light. So today, the enablement of the healthcare startup ecosystem, which is the topic today, is basically Dr. Amit Verma gave a brilliant overview about health tech and the enablement related various key issues which we are discussing today, and in our overall healthcare ecosystem, what keeps coming from time to time. So I would first like to start with our chair, Dr. Mahipal Sachdev, sir. Since Dr. Amit has given the pretext of this whole session, so I'll not repeat it again. He's brilliantly captured so many beautiful slides, very briefly what we have seen just now. So, sir, you have been one of the pioneers of healthcare startup when probably healthcare startups were very few. And I remember you were just a professor and a doctor at AIMS, and suddenly you said that, okay, now I want to set up a eye care chain in India. And you thought of not only coming out, a lot of doctor entrepreneurs are there for ages across the world in India, but you not only thought of setting 1 or 2 or 3 clinics, but you thought of that time you had a vision of setting India needs a chain of eye care centers. So with that perspective, rather than asking any specific questions, sir, would like to have your perspective on, one is your experience, which you went through, that thought process at that time, how challenging it was. Not very funders were there at that time, not very big fund houses like Quadria or so many organized fund houses were there. But then, so how would you like to, what type of experience and key points you would like to share, particularly in the current healthcare startup ecosystem? Because, sir, what happens today, if anybody thinks of, I've met a lot of healthcare founders, and most of them I've seen, when they come up with a healthcare startup idea, so first thing they think about is funding, that we should get the funding immediately. And sometime in that journey, people stop focusing on the product, the business module, the implementation, the overall success of the initial proof of concept. So your view on from that perspective, Dr.
Well, thank you very much, Sudeep. Pleasure being here. The question you basically asked me as to what started the story for Center for Sight and how you would say is the startup system, or how what does an entrepreneur look at, or how one should look at going into these innovations and things. I think the first and the foremost thing is that you need to find out what is the need, what is the, or if you are doing something like an AI or whatever, so you have to come out with a need and a hypothesis that if we do this particular thing, this is how we are going to succeed, and then you start working on that thing. I think when you, those who have written scientific papers, the most easy thing is to write is the materials and methods and the results. And then you come on to the discussion and then the intro, but the most difficult thing is to write the abstract. So when you are wanting to look at a problem and to be a startup or to be an entrepreneur, I think you should put down on paper your vision and what you are wanting to do and what you are wanting to solve. And that should be not more than one pager. It's very easy to write 50 pages or 100 pages thesis, but when you condense it, nichod nikal ke uska, that is what you have to write. And then you have to see as to what is the problem. Now, in India, when we looked specifically at eye care, the problem was that it was not considered to be a super specialization. And that is how the world was progressing as regards going on to super specialization. And if at all there was super specialization, that was in All India Institute of Medical Sciences in RP Center, where obviously you have the problems of a government setup and the growth rate, etc., is often dictated by political concerns, etc., of an individual as to how high you are going when you become the director, when you become chief, etc., etc. You know, there are so many pulls and pressures. Today, AIMS is without a director, so it's happening another 3 months, another 3 months extension, things like that. Without, not without a doctor, but without a full time. So what was important was to find out as to what was the niche thing that was being provided by people at that time, and that was a super specialized eye care facility that is there. And as was said by the earlier speaker, that patience is something very, very important, and you have to do a SWOT analysis as to what exactly are your strengths, weaknesses, opportunities, and what are you going to achieve out of this whole thing? What is the competition which is there? And that is what I did, and that is what we thought, that these are the things which people look for. These are the things which are not there. And mind you, what is very, very important is at times we talk a lot about affordability, but then there is also the talk about quality, which is equally essential. That we looked at providing the super specialized, cutting edge, top class quality, and therefore you have to be not a me too product. You have to establish yourself as doing something which is different from what others are doing, and giving, like for us it was giving super specialized eye care, and that is where we looked at and we went on. Yes, another thing, doctors do not have a single course of management or a single lecture during MBBS on any of these things as to how to professionally manage, and therefore hamari jo soch hoti hai, that is very limited, which is only limited to doing medicine and seeing patients, etc. And private equity again was considered to be a bad word, that they are hawks and vultures and things like that. I personally worked with three of them, but I feel that they and you can together create things which are going to be exponentially growing, and that is something very, very important. So for an entrepreneur, I would say that these things that are important is lay down what is the problem, lay down the hypothesis, lay down what you are going to do, lay down as to how it is going to be different, lay down as to what it will deliver, which is not available just now in the market. And this is what is called as innovation. And above all, whether you want to do the quality or you want to do affordability or you want to do a mission of both things are possible. And then you have to have your assessment of your strengths, and in these strengths, as was said, I think funding can come, but you should be bootstrapped initially, and you should look at being able to reach a particular level, and it is then only when the funding agencies start looking at you. But do not be averse to failures. Do not do not take unforeseen risks, that basically it's something that you're just doing which you know is going to blow up. The take risks which are calculated, graduated and you need to go in the proper direction. So I think the environment today is pretty conducive for people, especially in healthcare, as after COVID, people have realized the need for healthcare. And there is going to be more money that is going to come in healthcare that is happening. All these big tech things that came up are obviously the froth is settling down, but healthcare is for real. And that is going to increase over time. As was said, 15% growth can be gone on to 30%. I think those are the important things. The mind needs to have the intuition, the gut, and the strength to follow a particular path that this is what I am going to resolve. So I think that is what I would wish to say is what an entrepreneurial mindset should be and how one can develop onto that journey.
Thank you, sir. One key point you made is that as a startup founder, one should look at as a product or a technology or a service which solves, which sort of makes an attempt to solve a problem in a way which has not been done before. That's one of the key things. Uh, Mr. Naresh Hasija, who represents Beatrice, I have known him for about 10 years, and he's one of the very active guys in public health and also works actively with the startup healthcare startup ecosystem. So Naresh, my question to you is on, as a healthcare industry veteran, your perspective to make a startup successful. Very, very generic question.
So I think we have stalwarts of startup industry here. I personally believe it is not like used to see in college, like we have to identify a problem and start working on it. We will able to create a startup. It is actually, particularly in healthcare, you have to truly identify a gap. If you are able to identify the gap properly, I don't think so. There are further challenges. Second thing which I see is like most of the startups, don't take it otherwise, are basically without healthcare experts. So my request will be like we have to have healthcare experts along the journey because they can give a lot of insight. In earlier panel, like Dr. Mahajan was insisting on the same point. I also strongly believe healthcare is well known with professionals like all of you, and startups have to really take guidance. Third point, what I see around is go to market, which is again a very, very crucial part. So once product in healthcare is ready, in go to market, I foresee now like it is like large companies who should come forward and start adopting. Maybe there can be a policy by government of because like healthcare is like considered to be more of a charitable industry. So I strongly believe instead of making that way, what we can do is we can get handhold 3-4 startups, maybe by large companies, or large companies can create a bigger group to really solve healthcare problems at the root. Go to market for a startup. Right now, it is like for a, as sir said rightly, maybe if you are bootstrapped and if there are not much fundings available, you can see that the data what talks about it, as he said, froth is settling down. We had 450 startups registered in 2016, which is now like 70,000 startups, and 4,000, 5,000 startups are working on IoT and AI, in particularly in healthcare. So maybe Prashant will able to answer this question better. How many of them could come out in the market and really provide a right solution? So just to summarize this, my suggestion is maybe a good handholding by healthcare professionals, go to market by large organizations who can seriously, who knows the industry well and deeper. Like for example, if somebody has to launch a solution for pharma industry, particularly let's take an example of retailers or wholesalers. So what do you want to do? You want to either deploy people to go to retailers or wholesalers, or you would like to work with a pharmaceutical company who has 5,000 people at the ground, has access to 400,000 retailers already. So I will choose to go with the large organizations who have already created access, the kind of partnerships we can evolve in that space. Thank you.
Thank you, Naresh. So coming to Prashant, so Prashant, one is definitely do uh, explain a bit about your very interesting startup, which is of course now a very successful company, Cure AI. And as Dr. Verma already touched that point in his presentation of how AI is now so abused. So definitely we'd like to have your perspective on what really AI is and how you're using in healthcare and how it should be used in whether it is disease management or any aspect of healthcare.
Thank you for that question, actually. I'll first answer the second part. AI is a term which is quite abused. I mean, people talk about AI for everything, including basic math calculations. Now, I mean, everything is called AI enabled. In reality, AI, at least the promise of AI is in some of the areas that Dr. Amit spoke about, right? Which is machine learning, which is natural language processing. Those are the areas where you see a lot of improvement in AI over the last 5 to 6 years, I would say, and especially image recognition. And that is one area which has been completely transformed by AI. And about 7, 8 years back, if you had an algorithm try to understand an image, it was very hard for it to be able to figure out what's going on in an image, whether it's a cat or a dog. That was very hard, and you cannot teach the algorithm. For example, if you want to teach the algorithm what a bottle is, you have to give it all the features of the bottle. And you cannot do that for every object in the world. But with the latest technologies that came about 7 years ago or so, which is called artificial neural networks, you could basically just give the algorithm a lot of data and it will automatically figure it out. And that leads me to what we are doing as a company. My company, I am co-founder and CEO of Cure.ai. We use the same kind of AI, which is built or which is basically being used by Google or Facebook. And we use that on medical imaging AI, medical imaging, to build medical imaging solutions. So we have got algorithms that can interpret X-rays, that can interpret CT scans, that can interpret ultrasound images. The idea is simple. I mean, you basically give the algorithm a lot of data. So you give it millions and millions of scans along with the radiologist reports, and it automatically figures out what the abnormality is. For example, we are able to teach the algorithm to understand what about 60 different abnormalities on a chest X-ray, about 20 different abnormalities on a head CT scan, and so on ultrasounds and other technologies. Right. So that is what the algorithm does. Now, our company is about 6 years old. We are today present in about 62 countries. We are deployed at about 700 hospitals, and we touch close to 5 million lives on an annual basis right now. So it's scaled up. We are FDA cleared. We are CE marked. We have got about 40 plus peer-reviewed publications in the likes of Lancet, Nature Scientific, and so on. And I think coming to the first part of the question, right? I mean, I think for us, what we found is that, like I think Dr. Amit said, Dr. Maipal said, Naresh also said this, right? That it is very important to identify a problem that you're trying to solve. And a lot of times technology comes in and we feel like, okay, there is this really cool technology, AI, blockchain, all cool words, but what exactly are you solving for? And for us, we found, I'll talk about some of the solutions that we've implemented. So just to get a sense of where it is helping. So we have an AI solution which can detect TB from a chest X-ray, right? Now, TB, if you know, is still a rampant disease. I mean, it is killing more people than COVID. It has been killing more people than COVID. It has taken more than 1 billion lives till now. And it's something which is not going away. We want to eradicate TB by 2025 in India. The global goal is 2030, but doesn't look like we are going to get to those timelines. And one of the ways that you can screen for TB is by basically, there are so many X-rays being taken for screening. The challenge is that there is nobody who's available to read that X-ray on the spot at that time. And we have now deployed in many countries. I'll talk about one of the deployments in Baran. Baran is this very small district, which is about 3 hours from Kota in Rajasthan. And there, we deployed this at a district hospital about 3-4 years back, where we said that any X-ray that is taken is reported by the algorithm. And if the algorithm says that this is TB, you basically do a test then and there. For that, you do a microbiological test or sputum test then and there. And the protocol before that, so people are coming, walking sometimes kilometers to get to the hospital. They're coming from 50 kilometers away, 100 kilometers away, and they come, they take an X-ray, they go back, they don't come back again. There's a huge loss to follow up. And what we were able to do is by including that AI, which can basically interpret that X-ray on the spot within a minute. You take an X-ray within a minute, you get the result. That becomes radically uh, time saving for the patient because they are now able to get that diagnostic done right then and there. You come in, get an X-ray, get a result, get a microbiological test done, and you're able to then get treatment pretty soon. Otherwise, that would taken maybe sometimes weeks or months. And this technology now, I mean, this happened about 3 years ago. Last year, WHO endorsed our technology as an automated reader for X-rays for TB, where they said that the protocol for interpreting X-rays, interpreting TB is first, diagnosing TB is that you take an X-ray, you diagnose it with the Cure AI product. And if Cure AI says this is TB, you do a microbiological test, and that is part of the recommended workflow by WHO. So that is how AI is changing lives. So in this, for example, Philippines somewhere, I mean, diagnosis was taking 4 weeks, 5 weeks. They're able to make that happen in a single day. And this is a global protocol change where AI is part of the protocol for TB diagnostics. Second example is stroke, where, I mean, stroke patients come in, they've got infarcts, they've got sometimes bleeds, right? And getting that scan read, especially in the night, takes a lot of time. Sometimes it takes hours to get that scan read. And that is where, again, AI can play a role. It can make that read happen within a minute. So we have this technology where you can read a HCT scan, non-contrast CT scan, CT angio, CT perfusion, all of those get read, and the results come back to your phone within a minute. And again, that becomes valuable because an emergency physician, if they want to administer thrombolysis, or you want to, or a neurosurgeon wants to look at that stroke patient at home before they come in for the thrombectomy, or a interventional radiologist wants to look at that scan before they come in for the thrombectomy, we are able to enable that to happen very, very quickly. And our FDA study shows that we are able to make that happen almost 1 hour earlier than it would. You can imagine 1 hour of a stroke patient's life. I mean, basically, it could save a huge number of lives. Right? So that is the promise of AI in stroke. And third is lung cancer, which is again an area that we have been working on for a long time. So there are, all of us take X-rays very often, right? I mean, we take X-rays for routine reasons. We have some infection, we take an X-ray. I mean, a lot of times employment requires a X-ray, immigration requires an X-ray, annual checkups require an X-ray. So there are about 1.3 billion chest X-rays taken every year. And why I'm talking about this, lung cancer is one of those conditions which gets diagnosed very late. What happens is, by the time, at least I'm not a doctor myself, I'm a data scientist, but I'm talking about from talking to a lot of experts on this, right? What I've learned is that by the time the mass becomes big and you start showing symptoms, it's already too late. And at that time, the survival is very, very, very short. I mean, sometimes less than a year. So most of the time, less than a year. So one of the ways you can diagnose lung cancer early is to look at that 1.3 billion X-rays, which were taken for routine reasons, and opportunistically screen them for lung cancer. You can potentially find a nodule on an X-ray and you can say, this is potentially lung cancer. You can then investigate further, take a CT, take a biopsy and confirm that lung cancer case. And this is exactly what we're doing. We have a partnership with AstraZeneca now across about 25 countries where we're exactly doing this, where X-rays that are taken for routine reasons are now being screened for cancer, lung cancer, and they are then being tested further for that. And again, this is something which can make sure that there is a stage shift in the diagnosis of lung cancer. You can diagnose lung cancer earlier and you can treat lung cancer earlier using this kind of technology. And this is like a surveillance technology. This is basically AI running surveillance on every X-ray that is taken for any reason, and you can help diagnose that better. So these are some of the stories. Again, we have a lot of other stories about how we are helping hospitals, helping healthcare providers become better using AI. But I think that's sort of the key learning for us, at least, is that we have to go after a very specific problem. I mean, while we can do 60 different findings on the X-ray, the reality is only certain findings are so much more important. I mean, an emergency care finding like a pneumothorax or a misplaced line on a tube is important because that could mean that a patient could lose their life. TB is important, lung cancer is important. So we are going after very specific use cases. And that is how I think we found opportunities in the marketplace for the use of our technology. And I think final use case is basically improving quality, improving affordability and accessibility.
So Cure AI is broadly, you are disrupting diagnosis of disease in healthcare.
We are disrupting is a wrong word. I mean, because it's not great. I mean, the reality is that we are fortunate to have high quality healthcare. Everybody in this room is fortunate to have high quality healthcare. But you go down to the rural parts of the country, you go down to rural parts of so many different countries, the quality is so poor. So we are helping those places improve the quality of healthcare. And
So I use the specifically use the word disrupting because that is also another abused word. Yeah. So coming to Mr. Sudhir Mishra, he is an distinguished Supreme Court lawyer, also run a very successful law firm, Trust Legal. We met 10 years back. And since then, I have seen him doing a lot of healthcare practice in law. So Sudhirji, you also have worked with so many startups, particularly on the hospital side and other such healthcare startups. So what is your tips to the startups? Because when I have seen a lot of startup founders, they are in a hurry, particularly when it comes to signing agreements, whether with the funders or the partners, or getting into any legal sort of compulsions which they have to do while setting up a startup. And many times they are in a hurry, and they may miss a lot of important aspects. So how important is the legal aspect for a startup founder, and what are your few certain words of wisdom for such?
Thank you, Sudeep. I'll take it little more broad-based than a startup first, and then come to the specific question. My own understanding after 2 decades in courts concerning healthcare cases, and I'm saying healthcare cases, so they are not consumer cases alone. What I have felt is that we have not kept at pace with whatever innovation, whatever new things which have happened in healthcare, so far as the courts and the legal framework is concerned. For example, and I say it with a lot of hope, that I feel that entire advocacy part, so far as the medical devices is concerned, or the new medical bill is concerned, or the surrogacy bill is concerned, or the Consumer Protection Act went through repeated amendments about how much a doctor will pay as a liability. Not even one proper representation I saw ever, anybody coming forth. And when you see in a district court that there is, unlike a European jurisdiction or an American jurisdiction, where you have to deposit a minimum amount before you file a case of malpractices, in India, we have no such caveat attached to it, but no whisper, no challenge, nothing. So we are still in medieval times when it comes to legal advocacy, lobbying, due diligence, all these aspects. So this is the first reality check which I'm telling. And pharma is the only shining example where they understand advocacy, they know how to get things done in the parliamentary system, but whether it's this pricing of the stents, whether it's anything to do with any specialty, see the poor success of entire advocacy in despite whatever government team we handle or something. Something like that has been witnessed just now when you call about bitcoins. When the taxation system happened, they were not ready and they paid a big price. So think about that part, why we are not spending sufficient on the policy and advocacy front. That's point number one. The point number two is that when it comes to spending as a startup in any sector, so I work with single specialties, I work with diagnostic chains, they all want to go to IPO, they all want to become unicorns. How basic is the problem there, that there is no anti-poaching agreement between hospitals or startups in the healthcare. So you are eyeing the same prey base, you are eyeing the same talent pool, and everybody wants the same talent pool. So that's one first basic, and there are litigations happening around that. And of course, law firms have a very good time there. But that is very elementary. You can't stop anybody from leaving a place, joining another place. The second thing which is happening is, you talked about, one of the speaker talked about that you should know very clearly what business you are catering to. So you started a very flourishing diagnostic business. Some another investment company came in the same business. He took all your people away literally. And this is happening while I'm fighting one particular thing. And your entire business, which was on a piece of paper, has become a house of cards. So that's second. Third is data privacy. Amit talked a lot about the data, that how data became a big thing. The biggest collateral damage of poor legal management, poor legal advisory is that your data is freely circulated. You thank God for that India privacy laws are not very stringent as of now. So data is very freely traded. You do one test from one lab and other labs start sending you messages on WhatsApp and SMS. Why don't you get your test done? So we have to work on these areas. These are very serious issues which are happening. The last point which I'll say in the first round is that we do a lot of work with the contract administration of hospitals, large hospitals, and also the single specialties, all the private equity funded single specialties. I realize that your contract management or how you go about engaging with the employee completely needs a overhaul the way European and other systems function. And we have advised those things and realized that they are very poor, very poorly understood, mostly done by the company secretaries or the chartered accountant who are not equipped to design those clauses which will protect you and your employees, or you will be protected against a employee action. So these are some initial observations from my side.
Thank you, Sudhir ji. So contract management is one important aspect which startup founders should definitely look at more minutely and put a lot of thrust on that part in the initial stages itself. Coming back to Dr. Amit. So, Dr. Amit Verma, everybody knows he's one of the pioneers in critical care medicine, and then he became a pioneer in funding, healthcare funding. So he has a beautiful transition and the journey what he has traversed so far. Whenever I get an appointment to meet him, so this thought automatically flashes in my mind कि डॉक्टर अमित से मिल रहे हैं तो कोई startup, suppose I am doing a startup, so कुछ ना कुछ funding कर देंगे. So Dr. Amit must be facing this challenge day in and day out of a lot of people meeting him with a proposal and pitches, or whether friends or a lot of other startup founders approaching him. So what does a funder see in a startup before investing?
So thank you for that. And one disclaimer: we are investors in his company. So if I say something pleasant about him, it is absolutely deliberate. I think from our perspective, and I mentioned this earlier, there's a lot of financial jargon that is used in private equity to make us look very smart. So there's a lot of corporate finance used. And coming from somebody like me who's not a trained finance person, I boil it down to three simple basics. And that's how I look at any funding, whether it's a startup or it's growth or larger checks, smaller checks, because the fundamentals of investing are exactly the same. The first one is answering what is this problem that is going to be solved? What are you solving for? So is it another Me Too, as my pal mentioned earlier? Is it a unique proposition? Is it something which can scale up? What are you trying to solve? And that needs to be very clearly illustrated. The second thing I look for is a coherent business plan. And by that, what I mean is how much money do you need? What will you use the money for? What will it eventually get to? And what will the balance sheet look like 5 years from now? And I'm very cognizant that I'm sitting in a room full of doctors. And as soon as I start talking about balance sheets and money, and people flare up saying, again, you're talking about making money. No, this is about making sure that you are able to sustain yourself. And I think understanding, and it was mentioned earlier, unfortunately, doctors are not taught a single page of business. And the world has moved on. And even if you're running a clinic, you need to be viable. If you don't understand the concept of viability and hoping that somebody else will fund you, it's a waste of your time. So a 3 to 5 year business plan, which looks at all the scenarios, and lots of times you may not have the ability to do so. We will help create the business plan with you. So it's called a joint business. And the third, which is the biggest to me, is people. Who am I investing in? What kind of people are they? What does their vision look like? What are their gaps in their organization? And will they be amenable for us to fill in those gaps, to create a team? If we can answer these three things, I think most of the times the decision to go, no go becomes much simpler. I will add a last one to it, is how are we planning on exiting together? Because one of the points that is made, and private equity is always accused of, that we are vultures who are basically out to make our own money. And probably we believe very strongly that at the end of the day, whenever I am exiting, I want to make sure that the company is bigger, stronger, and doing better than what I think I have done.
Beautifully explained. Beautifully. So now, last round we'll just have quickly. So to you, Naresh, what are the absolute don'ts for a healthcare staff? Who is everybody talking? Just talk about it.
So maybe I think don'ts also are very, very clear with the startups. I would like to give here two good examples. So one example, actually, I know Prashant is sitting with us. I visited, I think these examples will help us to identify the problem actually. I personally went to district Baran. There I saw that being working in public health, I know that he was very generous saying that X-ray identification happens in a week. No, this is not true. X-ray identification happens in 14 days, 1 month, or it's seriously in 50% of the cases, it doesn't happen. We have seen cases where patient does not turns up. Is this correct? No. So when we went to the district and we saw that how we were knowing this problem, why there are 1 million patients lost in tuberculosis till date, because diagnosis is not happening on time, diagnosis is cumbersome, patient has to come 2 times, 3 times, and his 1 month is spent only in identifying what problem he has. So when we went to this district and we saw that uh, patient is given time for X-ray, okay, it takes time. Patient's X-ray was done, okay, and on the spot, patient X-ray report is given to him and report is given to doctor. We said, wow. So a primary identification, a small tool, what value it is adding in primary care, we personally saw it. So it goes back to my earlier question where I was just saying identification of the problem and really working hard to bring a solution. He was generous in saying, when I see an X-ray, there is a published data which talks about, I means healthcare professionals, when we see 65% time, this is correct. But when we see this through this tool, which has read more than 5 million X-rays by now, we see 95% correctness. So maybe we know that countries' radiologists are extremely busy today, and we have less numbers in CT scans, MRI, and we need them for a lot of emergencies. Can this tool augment their efforts of screening, doing this primary screening? Yes. So this is one example which I can cite right now. And maybe one more example quickly is, like, I got in touch with a company in US. They are, by identifying the symptoms, they are telling a disease by symptoms. And how they want to enter in India is, they said, we will do B2C. We will reach out to people and we have huge money. We will spend our money and we'll reach out to customers. I personally believe this is right now not B2C. This has to be B2B. In India, there are companies which have already evolved in this space. Like we have Practo, who has huge database, who has a lot of backend. So my suggestion to them was, guys, why don't you work first with them? Instead of burning your money every day on B2C, why don't you do B2B first? So again, my suggestion is, these are very, very important things. And why you should choose for go-to-market large companies is, this is one of the key reasons. We as large companies have a lot of experience in this space. We understand this market so well. We have huge network with healthcare professionals, whether it is doctors, whether it is pharmacists, whether it is lab technicians. We can really help in establishing any solution better in the market space. Thank you.
Thank you, Naresh. Very valid points. Very quick questions. Sudhirji, with respect to the patient rights, what is your few tips to the healthcare startups to know about various legal implications, particularly when they are dealing with the patient lives, whether in diagnosis or disease management? What would you like to?
So I would say, I would make it very simple. The patient right is unlimited in India. Because there's no capping. Because we don't believe in fundamental duties. We believe in fundamental rights in this country as per the Indian Constitution. So that answers it, that patient has so many forums now to go to, online complaint system, file a consumer case by spending virtually nothing, having an arrangement with somebody that, okay, compensation will decide. So all kinds of things are happening. My suggestion is that few basics which you need to do as a startup is that if you're dealing with patient, make sure that the data is exclusively private. It has to be very, very private, because this is something which is now spanning out with so many posts happening. So one WhatsApp, you can see every day today somebody is doing something and it comes in public domain, and people are taking action. So you are in a real time in a social media, and you're somebody sending a message on your behalf for some kind of clinical examination or anything. You make sure that the data is properly procured, the data is properly stored, all the relevant provisions of IT Act are properly followed. Even if nobody is very serious about it, already cases with regard to these matters are going. Especially if you're working in the areas where nobody wants to know the other person what I have been tested for, or I have gone for a IVF treatment, then he'll be very conscious or she'll be very conscious how you're dealing with the data.
Thank you. Thank you, Sujit. So coming to Dr. Mahipal, sir, you have been a live example of a doctor entrepreneur thinking about starting a clinic and then setting up one of the largest eye care chain center for sight in India. So what is your words of wisdom for, particularly for the doctor entrepreneurs? When I roam around, meet a lot of healthcare startups, I see a lot of this new emerging trend of lot of medical doctors leaving their medical practice and coming into startup ecosystem.
Well, I think if you look at that, the concept is very clear that as a doctor, if you are working as a doctor, you are making a linear difference. I can do as a doctor maybe 10 surgeries, 20 surgeries, 25 surgeries a day, or see 100 patients. So there is a linearity in the impact that I am making. But when you go on to thinking of solving a problem and becoming innovative in getting onto that, you actually are looking at converting this linearity into exponentiality. So you want to make an exponential change or an exponential impact, which possibly as a medico, doing with your own hands or your skill, you can make only this much of a difference. But when you get on to a system where you are acting as an innovator, whether you are putting together a team, whether you are putting together a thought process, like there was a thought process, which I would say that there's studies that are being done that a person for say an eye ailment would not want to travel more than 10 kilometers. A person with a cardiac disease would not want to travel more than 200 kilometers. A person for cancer treatment may travel for 500 or 700 kilometers. So there is a difference in the thing that you are solving for. And that is why the point is that for us, it is important to go to the neighborhoods or to places where there are even no eye surgeons, etc. Like radiologists, they are saying to put up centers at that particular point. So that is an exponential difference that we are trying to make. And you have to have a system of DNB, of fellowship, of training, of continuous updation of people, so that those who are not, there is so much of discrepancy today between what is coming out from a medical college versus what's coming out from, say, an All India Institute. And now the Ayurveda people are also allowed to do phacoemulsification. I don't know how our ophthalmologist cannot, and they will be able to do phacoemulsification. That's something. So that is the point, is that the whole chain, supply chain, etc., that has to be integrated. You have to tie up all the loose ends. And that is where a person, a startup today, see, success stories are something that at times motivate you, but they can also lead you astray in the sense that you only know the success story and you don't know where the people failed. And for every one success story, I would say, Amit may be a better person to answer, but for every one success story, there may be 100 people who have failed. But that the point is that you have to iron cast your case. You have to iron cast as to what your proposal is and where you are going and what it is. And one beautiful slide that I liked is that Hindustan mein kuch bhi ho sakta hai, in the sense that ye jo aakhri inhone बैल दिखाए थे, India is a place where you have bullock carts and you have planes. So you have to try to do that, and then there are roadblocks which you can never anticipate. Because what I feel is that India, if you have to succeed, you have to succeed in spite and despite of the systems. The systems, whatever one may say in the government today, that we are becoming friendly and we are trying to help, etc., etc. But the systems are, you have to grow in spite and despite of the systems. That is something very, very important. Entrepreneurship is rising. Entrepreneurship in medical people going in for health jobs or becoming doctors is decreasing, because the time that you are spending to become a doctor and the time at the end of the day, just read this, I think Forbes India had the 100 richest photographs of people, and I don't know how many of you read. How many doctors are there?
So you're not there.
I'm not there. There are only two doctors in 100 richest of India, and they are Arvind Lal, Dr. Arvind Lal at 83 number, and Dr. Pratap Reddy at 84 number. So that's the linearity of doctors versus the exponentiality of somebody else today. I think maybe there is this startup. I'm forgetting the name. Who doing these aggregation of surgeries. Uh, Pristine. They might be doing as many cataracts as I am doing as center for sight within a very short period, but they are burning, and people are turning away from them because they don't know who the surgeon is. At the end of the day, again, that is where the linearity will come into view, but aggregation is for the exponentiality. So all that I'm trying to say is that you have to, as he said, we don't learn anything about business. We don't learn anything about exponentiality. Our thought process as medicos is very, very restrictive. That needs to be changed. What he said, a doctor को बोलो यार तू अपना budget बना दे या तू अपना next वो you show where you are going to be 1 year. He thinks कि what are you talking about? We are doctors. This is something like a घर में भी आप अपना budget बनाते हो, in the sense that you say कि भाई मेरा घर में मतलब middle income family or anybody will say कि भाई what I am going to spend, what I am not. So having targets does not mean that you are unethical. Targets are something which are you are making a big step into small steps and doing a day-to-day kind of a situation that this is what I need to achieve and how do I reach there without needing to going to be able to reach where you want to reach. You if without a target you are चल रहे हो तो उस तरह की बात है. So I think it is very, very important to have a whole cosmopolitan thing, and you need manpower. Even when I just heard him about AI, things are evolving so much now. There are kids who are coming from IIT who are coming to us. They say we want to take a fundus photograph, and we will be able to tell whether a person is at a chance of getting a heart attack or a stroke, because you can see the vessels and you see what it is. Diabetic retinopathy. Tomorrow you will be going to a mall, and with all these things the person will be able to say कि भाई तेरे को तुम्हें diabetic retinopathy हो गया, you need treatment or not. You're just going to have there and you get the thing diagnosed, hypertensive retinopathy and those, because that's the only place where you can see. So the answer to your question is the scenario has changed very significantly. More and more healthcare people are going to move into entrepreneurship where they feel that they can make a bigger exponential difference. As today, I think we are doing a great social cause also. It is for the good of society and well-being of everybody that healthcare needs to be focused. And you have in the process also to make good money. So money I divide into good money and bad money. So जो अखबार में उछलता है at times may be bad money, but majority of the healthcare is good money, and that is you are doing things in a proper, in an ethical manner. And for every services, if somebody has to kind of pay for it, that person will pay for it. And I think Indian healthcare is going to be booming over the next couple of decades, and things are going to exponentially change with, I think, people like them looking very, very actively at healthcare. I think almost everyone wants to be in healthcare. You had Adani today saying that he's kept, I don't know, 5 billion or whatever, some amount of money that he has kept for going into healthcare. So everybody.
60,000.
So 5 billion, say, okay, billion. Anyway, so that's what my answer is.
All the best, sir. We want you in that Forbes list soon, sir. Thank you. So we have so what we'll do is that under chair of Dr. Maipal Sachdev, we have few startups whom we have invited, selected and invited to present very briefly in 5 minutes to 7 minutes about their startup and why they feel that they are one of a good model which can be scaled up, and take some perspective from the panelists here post their presentation. But before I move on to that, the point which is intriguing, I'll just quickly like Dr. Amit Verma to answer, is about this conflict, sir. This has become like Dr. Mahipal raised the point of startup coming with the technology and an aggregation module and trying to disrupt, again, the same word, disrupt, the bringing surgeries on one platform. How ethical it is when, and so many case studies now coming up, multi-million funded startups. So where is the balance, and what is, as a funder, what you look at in terms of, you can also play a role in terms of creating that balance and the whole ethical ecosystem while such disruptions are happening?
Okay, a couple of quick general points. I fully endorse what Mahipal said, that you can do ethical healthcare, contrary to popular belief. There is no reason for us to be unethical in the pursuit of creating value. That's point one. Point two, very importantly, is that people are very star glamorized with this whole startup idea. It is probably the most painful journey that you will ever undergo. So please do it with eyes wide open. 99% of startups will fail. And they fail because they make the basic mistake of an idea and believing that the idea is already a startup. It doesn't work like that. So I would strongly urge people to spend some time, some groundwork. And you asked me the question that people do come for funding. And unfortunately, a lot of times it's very early in the stage where they have not thought through what it takes for funding to come in. Funding, as Sudhir rightly knows, comes through some legal structures. It comes with some legal binding to you. And there are so many companies out there where the promoters, erstwhile promoters, have lost their shirts and lost their companies. Coming back to your question on aggregators and things, that I don't want to name particular companies, but my view has always been, at the end of the day, your patient is going to be your primary focus. And you have to be true to that patient. And at the end of the day, my personal belief, if I cannot take full responsibility of what is going to happen to my patient, either as an investor, a doctor, or an aggregator, I am going to have a problem someday. And that's my view. I think in India, unfortunately, as Sudhir again rightly pointed out, the legalese is very, very weak. There are lots of gaps on what can happen to you. So we will have to find ways of getting the structure together. And that's where I believe centralization of EMRs, quality metrics, reporting data openly rather than keeping it hidden within corporate hospitals, and bringing it on a central backbone will help us flush out people who are not good and reward people who are actually good medically.
Thank you, Dr. Amit. The very structured answer you gave to all the points. We quickly move on to the presentation of the startups.
Hello. Thank you. Firstly, I think let's give all our panelists and our moderator a huge round of applause. And now for the healthcare startup presentations. We have 5 of them, and there'll be a 6-minute timer for each presentation. And the first one is Jackfruit 365 for Diabetes, a startup's scientific journey from Diabetes India to American Diabetes Association Conference and Nature Group Journal by James Joseph, founder and CEO, Jackfruit 365. Let's welcome him, everybody. Let's give some confidence. Yeah. Thank you.
Good afternoon. Can you all hear me well? Okay. Thank you. Great to be right after the presentation talking about startup ideas. In fact, Dr. Mahipal, you mentioned about the difficulty of writing an abstract based on the need. Okay. So in my case, it was a one word, Jackfruit 365. All I wanted to do was make sure people eat jackfruit 365 days so that the jackfruits in my tree does not fall off and go waste. That was my need. But 7 years ago, exactly 6 years and 9 months ago, 2 kilometers from this venue, I was at a house of a Bharat Ratna, And he changed my perspective from the cause for jackfruit to the cause for diabetes. And this is a great forum about celebrating Padma awardees. And in my journey with jackfruit, I had 3 Padma awardees who helped me to where it is now. Okay, where is it now? We have 500,000 people in India consuming jackfruit 365 with 11,000 positive reviews on Amazon now. It all started from one simple ask from Dr. Kalam in 2014, when I told him about an incident of a patient who was taking insulin for 5 years, took a Kerala way of consuming raw jackfruit as a meal, as a rice alternate, and took his normal dose of insulin and collapsed because of hypoglycemia. And I was writing a book after my time at Microsoft about working from home. And Dr. Kalam got the first copy of that book. He read that towards the end. He saw that I'm doing something with jackfruit, called me, and I was here 6 years and 9 months ago at Dr. Kalam's house. And I showed him what I found, the nutritional comparison between a cup of rice and a cup of raw jackfruit, and the way Kerala is consuming it as an alternate to rice. He went through it for 3 minutes. And he said, James, this is absolute science. A high fiber meal always translates to low absorption of sugar. There is only one thing new here. It's possible to eat an unripe fruit as an alternate to rice. Most fruits, when they're not ripe, the acidity is so high that you can't even eat a cup. Whereas jackfruit, the acidity is low. You don't need any study, but you must remember one thing. Changing eating habits is worse than changing religion. You must find a way to use the unripe jackfruit to reduce rice and wheat without changing eating habits. You are an engineer. You go figure that out and then come to me. I will help you campaign this all over India, convince every housewife to use raw jackfruit to reduce rice and wheat. India there's a diabetes express running in this country. We must import jackfruit if required. And that ask, it took me 18 months to crack an atta from raw jackfruit. In fact, that is my first patent. I made an atta out of the raw jackfruit. That is a green jackfruit flour, kacha katalka atta. But by the time I invented that product, Dr. Kalam passed away. And then came another Padma Vibhushan who came to help me, Dr. M.S. Valithan. He went through my work and he said, James, the biggest blockbuster development here is you found a Kerala way of eating unripe jackfruit as a meal, good for diabetes. But even bigger blockbuster is you made a flour out of this, so it can go to any food. You must take it to the highest scientific body on earth and prove that this is good for diabetes. Then only India and rest of the world will accept the science. And he told me to do, if you're aiming for Olympic gold medal, you must practice in an Olympic swimming pool. And the randomized controlled trial is the only way you can prove that this is good for diabetes. 2020, in fact, I first presented at the Indian Dietetics Association on the nutritional benefits of jackfruit versus rice. Then I presented at the Diabetes India conference. The scientific committee accepted my findings. Then at the RSSDA conference, where I showed in the continuous glucose monitoring, an intervention showed that there's a 34 units of average blood glucose level from week 1 to week 2. Then the randomized controlled trial, a double-blind placebo-controlled study, was presented at the American Diabetes Association's conference in 2020. That is where we got the ADA journal Diabetes, we got the RCT published as a result. Then it was sent for peer review at the Nature journal Nutrition Diabetes. For 11 months, the peer review got completed and it got presented at the at the Nature journal as a peer-reviewed publication. This 7 years of work which I did with this, was it worth it? Within the next 1 year, we had demand skyrocketed for the product. And in fact, Dr. Anurag mentioned about Amazon getting into healthcare. It was Amazon which helped us to reach 500,000 people in India. And we've been, forget about the jackfruit going waste in my tree. For 10 months, I was running around Kerala to source as many jackfruit as possible, convert that to atta, and then supply it through Amazon to 500,000 people. Now we have 11,000 reviews on Amazon. That is the kind of impact we have made on people's lives. Okay, but then comes the next Padma Bhushan, Dr. Srinath Reddy. Professor Srinath Reddy called me for a meeting at PHF. That's the first time I'm seeing a Padma Award. In fact, 2 of them at his office. And he told me, James, diabetes is a small problem compared to fatty liver. Because I explained to him how it was working, how the soluble fiber, which I got into the jackfruit atta to make it behave like a fulka. When you add this to your atta and you make a fulka, it should fluff up. And I used soluble fiber in the raw jackfruit to get that binding. And that is what helped in the diabetes, where how the soluble fiber binds. I mean, first in your stomach, it becomes a gel and stays longer. The gastric emptying gets slower. So at low calorie, you get higher satiety. You feel full for longer. Then it enters your small intestine. It binds fat, cholesterol, and sugar from the bile. And then it takes to the large intestine, where it ferments and becomes food for the gut microbiomes and rebuilds the gut lining. And it prevents constipation. So when I walked him through how this works, he said, James, if it is removing fat from the pancreas, and I said before that it removes fat from the liver, he said India has a bigger problem in fatty liver than diabetes. You must focus on. Then I asked doctors who are prescribing a product to type 2 diabetes patients. And in fact, the last HEAL Summit, we had one doctor, Dr. Vinod Abhichandani from Ahmedabad, who was been practicing diabetes for last many decades. And once the Nature publication happened, he started giving it to his patients, one of them including his wife. And in 3 months, the HbA1c dropped from 7.9 to 7.6. But more importantly, grade 2 fatty liver dropped to grade 1 fatty liver. Triglycerides dropped. Okay, and then now within 6 months, the HbA1c dropped from 7.9 to 5.87. And in fact, this morning, he sent me his wishes for this conference. He said, October, I'm waiting for the sonogram results. I want to see my wife's grade 1 fatty liver has also disappeared. So what I'm saying here is that with this humble journey from this jackfruit, but taking the scientific route, because of the help I got from Dr. Kalam, Dr. M.S. Valithan, and Dr. Professor Srinath Reddy, I was able to prove scientifically why it is working, how it is working, and then communicate that to a large population in India. So through just simple diet, using our regular idli and roti without changing eating habits, you're able to control blood sugar. And this is all possible because a lot of Padma awardees came forward to help me. Thank you.
James, you forgot to mention about the PM Modi acknowledgement.
Okay, now, Dr. Sudeep, thank you. In fact, how did it reach 500,000 people? So as soon as the publication in Nature got out, we got the lot of newspapers covered that. But I also won the National Startup Award because Dr. Kalam's ask ended up as a patent. I actually got the patent for the green jackfruit atta with the amount of soluble fiber which I got. And the American Diabetes Association's presentation got us the National Startup Award. And as a part of the National Startup Award, I got 2 minutes interaction with the Prime Minister, a live telecast interaction. In that 2 minutes, I could articulate my vision for India and how it is helping with diabetes. And that video, 2-minute video, as soon as the Nature publication got out, went viral on WhatsApp. And what happens when it goes on viral on WhatsApp? People search on Google, and from Google, it goes into Amazon, and from Amazon, it gets shipped to their home. So that's how the trigger happened, how technology helped us. Okay, and that is how Jackfruit 365 became a bestseller on Amazon within no time. And thanks to the National Startup Award and Prime Minister Modi's video, which reached masses all across through WhatsApp. Thank you.
Thank you. All the best. Also, just on a lighter side, except me, everybody here on this stage they can also be, they are rich investors. So we can also play Shark Tank if you like. Anybody who likes the idea.
Then do the non-medic people also get a chance at that? Yeah? Okay. From Jackfruit 365 on to our next one, Care. Our patented AI-based healthcare technology by Mr. Apar Gupta, founder, Blue Ocean Studios Private Limited. There he is, and while he's walking up, a request to all our presenters, please stick with the time limit because we wish to follow the proceedings on time. All the best, sir.
So
I'm thankful to the BW team and everyone, all the invited dignitaries here. So for giving this valuable platform. And so I think we all know that, innovations are the necessity in today's healthcare scenario. I think that's what we have already been discussing in the last 2 hours. And also the true aim of a healthy ecosystem is to provide the sustainable technologies instead of control C, control V. Let's focus on something original, something unique that never existed before. And it should be within the reach of every citizen. And rather than not being a part of the current existing trends. So I think the focus of the innovation should be the inclusivity and, should be all encompassing. And with that understanding, I would like to proceed with presenting one of the innovation from Blue Ocean. It's also important to mention that Blue Ocean isn't a startup that was, founded during the COVID. The initial thought process on the technology and everything started in 2016, and the company got registered in 2018. So with that, so it's a kind of a self-explanatory video. Post the video if anybody is having any doubt or any questions. I would be happy to answer that. Thank you. I think we can just play the second video also. So there are two innovations what we are working on. One is the care, for which the presentation was just given. So it's basically a smart hospital and healthcare technology where the entire hospital ecosystem would be improved. So we are creating a new healthier ecosystem to counter all the malpractices, gaps and loopholes. The technology has been patented and of course accoladed by the Prime Minister of the country, and has attracted people like Robert Downey Jr., the famous Iron Man actor, by virtue of his company Downey Ventures. So due to certain confidentiality agreement, the slide was not included here. And the revenue so planned collected from this care technology would be invested onto exploring a technology, what we call as the nanobots, the micro robots that could be injected into a human body, and they could scavenge the stage 4 cancer cells. So the patent has been filed. Now we are just awaiting for the patent to be granted. And I think that would be a better, way to discuss about more on that technology. And still then I'm not, can discuss more about the technology, but I think that's what I was talking about, that, we should talk about more innovations, uniqueness into the healthcare or whichever domain we are working, rather than, focusing or carrying on what our predecessors have left behind. So just to quote an example, Blue Ocean published an article, Lock and Key Hypothesis, in much before COVID. So the idea behind that, hypothesis was that when the lock changes, you need a new key. I think the best example, what we have seen in COVID, that vaccines are not a true solution. It's probably just a hit and try. In fact, vaccines have failed. So I think that's what one vision was that was given by Blue Ocean in 2016 and 18, that, when in the coming near scenario, when I'm sure there would be a time, and of course we were proven right, that, things like COVID come up or any other, challenge into healthcare, probably, the previous technologies that have been developed by our predecessors, they won't work. So maybe I think COVID was an example to prove that the next virus or any such microbe won't give you another chance also to prepare a vaccine. So I think I'm thankful to the Indian startup ecosystem that before COVID, it was a Momo and biryani ecosystem. I'm sorry to say that, no offense to anyone. I like momos and biryani a lot. But I think, people should understand the priorities. I mean, look at the current ecosystem. I'm sure everyone might have heard about Tesla, okay, Elon Musk. I'm sure somebody might have read about Neuralink. They are working to transform brain into a microchip, the damaged brain. And most of the research has not been published, has been kept a very secret, confidential research. But because in the last 4 years, I've been studying very deeply into the AI technology and Neuralink, and we have been in touch with some of the members of SpaceX company because we approached for the funding and all those things. Believe me, we are much behind what other countries are focusing on to. So I think let's make a healthier ecosystem. Let's understand the priorities. And I would request all the investors who have the big wallet to come closer and support those technologies, which of course will definitely give you 1,000 times also. But rather than, just creating value, just creating money, they are also creating value and a healthier ecosystem. Thanks to everyone. Thanks for giving this platform. Any questions, please feel free to ask. Okay, thank you. Thanks.
Thank you so much, Mr. Gupta. If you have any questions to ask, you can, of course, take them on a personal one-to-one basis. And the next presenter, it's Wellfie, contactless health check as simply as a selfie, by Dr. Shiv Kumar, Head, Public Health Initiatives, Be Well Health Tech. There he is. Let's welcome him with a warm round of applause, everybody.
Thank you. Good afternoon, everyone. Sorry to keep you all waiting for the lunch. I will not take much big time. So before I think putting to my presentation, I would like my team to play a small video.
Imagine a world where your mobile phone will be used to capture class, like your blood oxygen saturation, your heartbeat, and more, just ever on the sun. Then imagine if you did this radio, how this data combined with artificial intelligence could be used to find and change your life. Now, you're not the only one doing this. But our past, hundreds of thousands, millions of people all over the world using their phones to capture their houses. Living on the endless possibilities of global data analysis. If this navigation and complicated that motivates us to possibilities the liquid on the device is always your mobile phone. We are enabling existing platforms to reach millions, have this incredible fundamental, easy, global, all delivered at the top of the mind. Our use cases include governments, insurance, airlines, and more. In fact, anything that we need to assess the body of the person.
Thank you. So we are trying to create your mobile phone as your healthcare gadget. So far you have been using your wearable devices to monitor your health. Now we are bringing Wellfie, like, taking care as a selfie. So by taking your selfie 1-minute test, you can access your many of the multi-parameter of your healthcare, and through which this is like, towards the democratizing the healthcare services at the population level. And this is the way when I think previous panel and since morning, everyone is talking about patient first and patient friendly ecosystem. And we are trying to create a patient friendly, user friendly ecosystem where patient have or user have control on their healthcare. So can you go to next slide, please? So this is the kind of, ecosystem we are currently working on. So we are working through the multiple devices where we are measuring our health. And by measuring our health, we are not able to track our healthcare data. And that is the one of the important. And if we are able to do that, we have to use our phone as a only link device. Our mobile phone are not being used as a healthcare device. And our effort towards that, we can convert your mobile phone as a healthcare device. Most of the devices which we are using, wearable devices, you have to invest in those devices. If you are investing in those devices, if you are investing in the high lane devices, then you get the quite near to reliable result. It has been, there is a study in US that, like, there are most of the devices, wearable devices, which are not at the higher level, are not, their parameters are not reliable. So those are the kind of things, like, there is a lack of reliability, and especially in the healthcare, like, we work in the similar kind of technology. We work with the same PPG model, but only thing that there is a more kind of reliability from this system. Yeah, can you go right? Can you go to next slide, please? Yeah. So our Wellfie, we are saying that, like, you can have your health risk assessment anytime, anywhere, and you can share this information with your doctor anytime. So this is the kind of, and right now we are working with the multiple partners who are using, we are integrating our API with them, and we are able to help them to access these are the parameters through their mobile phone by just taking a selfie of 1-minute test. Can you go? Yeah. So these are the parameters, and most of the parameters are very useful in the remote monitoring, and especially when government of India, we are, like, we are talking about hypertension. We are talking about, we are going to be the hypertension capital of India. We are going to be the hypertension capital of the world. And then we are running a massive program on that to actually measure the BP, where our Anganwadi worker, where our health workers are actually in the field and measuring the BP, and lot of there is a manual error in that. And we see that, like, this kind of system actually going to bring revolution in public health system. Yeah. So this is we are using the same technique, what the wearable devices use, the same PPG technique, and it work. This is the kind of, workflow we are using. And so we can have a later on, maybe the technical, because there is a paucity of time. So I cannot go into detail of all the details of the technicalities. Next. So this is our journey so far. We started our prototyping development from 2021 February. We have reached to the clinical validation and minimum viable product with some kind of pilot from the different setting, from the hospital setting to public health setting through the camp setting. And now we are ready to go product, and we are getting integrated with the many leading insurer and the wellness provider. So B2B is our primary go-to-market strategy. Like in our previous session, they said that there are the big companies, there are a big institution who are already working in the ecosystem. So we have decided that rather than going B2C at the first stage, because we are the early stage startup, we are keeping our solution at the B2B stage, and we are partnering with those big institutions to get the monitored. Yeah. So we are getting cohorted at the ICMR Center for Innovation and Biodesign, PGI Chandigarh. I think after this research, we will be able to share the result from there. So this is small video again of how this test happened by selfie. It's a 1-minute test. Thank you.
Thank you. Okay, from phones and welfies, it's now time for smart wearable headband for stress management and improving productivity by Mr. Karthik Raghavendran, CEO and co-founder, NeuroStellar. How come everybody forgets the... Thank you.
So good afternoon, everyone. So I'm Karthik, as he mentioned, and I'm the co-founder and CEO of a company called NeuroStellar. NeuroStellar is a neurotechnology startup based out of IIT Madras. And our entire vision of the startup is to leverage brain-computer interfaces for the betterment of humanity by leveraging the potential of neurotechnology. And one of the entrepreneurs who spoke before also mentioned about Neuralink, and he gave an initial good marketing for our startup too, because in the long term, we are one of the good competitors in Neuralink. And we also have some advisors and mentors from Neuralink. Go to the next slide, please. Next slide, please. Okay, so I'll give you a small teaser before getting into the details of what we are building. So we are building a powerful product which helps to unleash the true potential of your brain, which kind of helps you to understand your brain, as well as quantify certain metrics like stress, your productivity, your focus levels, as well as helps you to increase your performance and productivity, as well as various other cognitive metrics. But before getting into the details of the product, we've seen a lot of sensors and other sensing other physiological signals, right? From heart rate to blood pressure to diabetes, glucose, all the things. But one of the least understood organs is human brain. And once we are able to build tools that can accurately understand the human brain, our potential for this technology is very huge. Going to the next slide, please. But now we are taking a small portion, focusing on one single problem, which is stress. As you all know, stress is one of the major killers for humanity, and it affects both your physical and mental health, sleep, as well as mindfulness. And I started this company because I had a very traumatic experience during COVID for the past 1.5 years. One of my close family members dealt with traumatic stress, depression, coupled with schizophrenia, which had delusions and hallucinations. So it was a complete package of what I've read in psychiatric books, and we had 1.5 years of struggle. We tried different kinds of things, right, from CBT to antidepressants, to antipsychotics, but we didn't have much effects. But coming back to the basics, for the just 1 year, we tried everything, but it didn't work. But the next 6 months, we got to the basics of taking care of mental health, which is trying techniques like meditation, breathing, pranayama. Those who went to other kinds of yogic techniques. And after 6 months, there was a huge drastic difference. And I just understood one thing, that humanity already has answered how to manage stress, how to kind of handle your mental as well as physical health. But the problem is, taking our generation or even the next generation, it's really hard if you kind of ask your son or a daughter to do yoga, because we are most accustomed to instantaneous pleasures using our mobile phones. So in case if they want to get into these practices, you need to kind of gamify the whole process of how it's being done. And that's exactly how we are solving this problem at the root, by gamifying the whole wellness space. Next slide, please. So we are leveraging one of the boldest technologies that's being used by psychiatrists and psychologists to deal with stress, anxiety, and depression, which is neurofeedback. Neurofeedback basically helps an individual to get control of his brain rhythms by giving some feedbacks on how your brain rhythms are at that point of time, which is a real-time feedback. For example, an individual playing a game, and he's connected with electrodes on his brain, and the brain rhythms are recorded. So based on how stressed or calm he is, the game acts according to his will or against his will. That's how neurofeedback works. But there are three major problems. One is it's expensive, and the patient has to come to the clinic for around 25 plus sessions. And it has a very poor user experience when you go and see in the clinics. So we are solving all these problems and trying to bring this powerful technology to the hands of each and every individual present here, or even people who wanted to unleash the potential of the brain. Next slide, please. Which is our headband called Orbit, coupled with a mobile application. A mobile application is what has 1,000 plus content for wellness protocols, ranging from meditation to music to breathing to a lot of protocols. And a headband basically is a sleek and a user-friendly headband, which is a neurofeedback system which senses your brain activity and as well as your stress levels, and gives you real-time feedback, auditory feedback during those sessions. In case if you're calm, it gives a different feedback. In case if you're stressed, it gives a different feedback. And not just that, it gamifies by giving you scores and other kinds of rewards in case we are maintaining a streak of a calm state of mind over a period of time. Next slide, please. So we are targeting majorly, our main target as of now is corporates and corporate wellness, but we also have other potential markets, which is patients with stress, ADHD, anxiety, and fitness and meditation enthusiasts, and athletes who want to improve their peak performance. Next slide, please. So for B2C, it's a one-time cost for a hardware and a SaaS-based, sorry. Okay, fine. So for B2C, it's a one-time cost for hardware and a SaaS-based model for our mobile application. And for B2B, it's mostly monthly or annual subscription, where corporates might have a Orbit pod and the employees can come and use it. So we have, based on all the other solutions that are present for stress management right now, we have a clear competitive edge in terms of bringing the technology to an affordable cost over a period of time, as well as higher efficiency in terms of engagement, in terms of gamification, in terms of accuracy in detecting stress, because our system is more accurate than a smartwatch detecting stress, because it captures EEG, which is the source of it. So we are currently a very early stage startup and a pre-revenue stage. So we are currently built our alpha prototype, and now it's going on for testing. So we'll have our beta at November 2022 and planning for initial sales. We'll have our product launch in March 2023, and then improving the product, R&D, and scaling the company. So, but this has, as brain-computer interface technology, has huge potentials, and that's why big players like Neuralink are coming into play. It can be leveraged powerfully in neurology for epileptic patients, as well as other neurological conditions, mental health and psychiatry, as I've already mentioned. Defense, we have already talked, has discussions with Indian Defense for using neurofeedback for our soldiers to improve their performance, as well as neurostimulation is one powerful technology which can be utilized to improve their cognitive performance. And gaming as a part of neurofeedback. And it is also leveraged by marketing. It's to understand how your brain rhythms are when you watch a movie or an ad, and changing your content according to it, and also in education for improving the performance of children. So we have a multidisciplinary team at IIT, where we have PhDs working on the R&D, as well as hardware, software engineers, and other people working in the team. We have a visionary and a renowned board of advisors, including the past president of Indian Academy of Neurology, as well as a key opinion leader, Dr. Dinesh Naik, who's a renowned epileptologist, and also have professors from IITs and people who have run a lot of companies. And one of our mentors is Professor V.S. Ramachandran, who's a Padma Bhushan awardee. And we have a very good pool of neurologists and neurotechnologists helping us to make this dream a reality. So we have been recognized as India's 50 most promising tech startups by Your Story Media. And we also got a lot of other recognitions from BIRAC. We are a BIG grantee and a MEDI grantee, and a lot of other awards and recognitions in the recent days. So I would like to end with one quote, which was mentioned by Francis Crick. There is no scientific study to the man vital to the man than study of his own brain. The entire view of the universe depends on it. And that's my one single vision for this life, is to build tools that can help us understand human brain and leverage it so that we as humans can have a very great experience of life in the upcoming generations. Thank you so much.
Thank you so much, Karthik. And the next one is on innovation empowering rural healthcare by Mr. Amit Bhatnagar, MD, Akusta Technologies Private Limited.
Hi, everyone. So I'm Amit Bhatnagar. So I'm graduate from IIT Roorkee, did my master from Penn State in Biomedical Engineering, USA. Was working with Universal Studio Hollywood as a business consultant. But there was always a hint what has been given back to the country, and came back to India with a vision that somewhere we have to solve the society problems. And the vision was very clear that somewhere we need to own the problems of the country. And the problem we picked was that 95 crore people of India, they are not getting quality healthcare services, because of which liver damage, kidney damage, all these things happens and they don't even know what happened to their body. And we could realize that the conventional technologies were never designed according to Indian challenge. And those were like, you cannot have this delicate technology taking to the remote location to bumpy roads. You will not find electricity to operate over there. You will not find skilled manpower to operate these technologies. And you will not find air conditioning environment to operate these delicate technologies in the remote location. So we developed world's first lab in a suitcase, lab in a box, which operate from 2 degree to 50 degree centigrade, consumes only 40 watt electricity, works on a solar panel. It does glucose, hemoglobin, lipid profile, liver function test, kidney function test at the most affordable cost. And because of these features, my first client is the Indian Army. So every field hospital of Indian Army, they are using our lab. Leh Ladakh, Kargil, Arunachal Pradesh, Jaisalmer area. Then border road organization, every task force level, they are using it. Then more than 100 NGOs, Tata Trust, Reliance Foundation, Helping India, Hans Foundation, in the remotest location of our country, they are providing this healthcare diagnostic to the doorstep through our innovation. So, but that's not where we stopped, because our vision was, our mission was that how to take these services to the 95 crore people of India. Even after being used by all these institutions, we were only touching 1% population of the country. The only way it will be possible to revolutionize this is when a rural healthcare entrepreneur says, I want to run this as a livelihood manner, as a business model. So our clear goal becomes a sustainable answer where he can provide these services in a more sustainable manner. So we went one step further. We actually developed, after 3 years of intense research, we developed whole lab on a bike. So I'll share the video later about this. So right now there are a lot of, health camps we are doing right at the doorstep location. And the beauty is that in a rural location, generally, for example, labor, carpenter does not go to a static medical center because uska dihadi marta hai, usko kiraya lagta hai, isliye wo jata hi nahi hai. But the moment I start delivering this healthcare at the doorstep, I'm able to intervene at the right time so that I do not lose productivity for the nation. And I ensure that we are able to catch the problem before it goes on the critical stage. One of the important features what we developed in our technology was that ensuring the quality in the remote location is the most critical one. So what we observed that Haryana government, every MMU, they are using our lab, but they ask us to validate in a Panchkula General Hospital. I was doubtful, is a government hospital, whether if they are maintaining the quality, how they will validate. So there is something called quality control L1, L2, which every lab across the world, whether it's Lal Path lab, SR lab, they have to follow it. So I gave them L1 sample. My reading came 102. Their reading came 123. They said there is an error, 20% error. Then I had to show them the mean value was 99. The range should be 95 to 108. So we were very close to mean. They were way out of the range. Then it we figured out was they did not buy the quality control for 2 months, past 2 months, because of some bureaucratic struggle. So I could feel if a general hospital is facing this, how you can ensure a quality diagnostic in the small peripheral, this small PHC center type labs. Then we developed a technology that the lab technician who's operating our lab, if he does not put quality control on the device is warning him. And if you ignore the warning, device will get blocked. He need to call customer care. Then another beauty what we did is we created a satellite control system. It's a 2G based, ultimately it's a SMS based algorithm. So now I have from Jaisalmer desert area, I'm getting the QC values reported on the portal directly. Nobody can manipulate it. Nobody can change it, right? And the counter, how many tests being done in the remotest location, that I can observe. So you can see in SDMC Delhi, we are observing this. I'm not sure how to. So this is the QC1. You can see there are the QC are reported on the portal directly, which nobody can manipulate, nobody can stop. So I can at least make smallest lab accountable even in the desert area of Rajasthan and in the hilly areas. This is the most important innovation. So the biochemistry I've already explained. One of the most lacking one was the CBC and the most required in the rural healthcare system. So there are two technology available for the CBC system. Number one is the cell counter, the cytometry based, which is a very delicate technology to take it to the remote location. And second is the microscopy. In the microscopy, you need a pathologist you will not find in the remote location. So what we did, we pick up the microscopy, but whatever the high skill requirement was there, we converted into very low skill requirement. So for example, the smear making, which is a high skill job, the tongue shape smear. Now we have created a AccuSmear device. You just rotate the knob, high quality smear will be made. Then you just dip it, the staining will be done. And then we converted a microscope into auto microscope, which AI based Bluetooth controlled XY stage. It will automatically take the images of the slide the way pathologist takes it and sync it to the central location. So now imagine in a desert location of Rajasthan or a jungle area of Jharkhand, with a very low skill technician, I'm able to send these hematology high quality images to the pathologist sitting in Jaipur or Delhi. So now with only 1 rupee cost of the chemical, I'm able to get this high quality consultation from a pathologist to the remotest location now. So now with our innovation, we are able to cover 95% of the diagnostic for the remotest location of India, which is complete biochemistry, hematology, and urine, and the complete digitization of the data is happening. So these are the various accolades which was launched by President of India. The beauty is the cost of the biochemistry. It costs 70 rupees chemical cost for glucose, hemoglobin, lipid profile, liver function test, kidney function test. For CPC is 1 or 2 rupees. So it is the world's most affordable diagnostic with highest accountable ecosystem where nobody can fool it around, even in the remotest part of the country now. So these are the various health camp activities which is in use right now with our innovation. It is available on GEM. So a lot of government institutions are using it. So I want to play a video. Yeah, this is a video. Yeah. Can there So now we have converted Labaik into Dr. Labaik, where we are doing actually the doctor consultation in the first place, right at the doorstep. And with the telemedicine kit, where you have the digital stethoscope, otoscope, all these reporting can be done for the diagnostic for the doctor panel sitting in the central location. Once they prescribe the test is being right done over there. 102 parameter of the blood diagnostic can be done through the Labaik right at the doorstep. And then primary care medicine of 20, whatever requirement for the primary care, that can be delivered right over there. So with the complete offering of e-clinic service right at the doorstep, that is a new revolution, and it has a potential of creating 10 lakh jobs across India. Last but not the least is the skilling of the manpower. So that is one thing unique we did. After 3 years of research, we have actually made IP modules of skilling, where people only says that it is a good skill or it's a good or bad. We actually quantify, for example, the whole pathology of the diagnostic. We have created a module of 3 months where we are converting a rural youth into a lab technician by ensuring a very measurable and very qualitative, like micropipetting, phlebotomy, typing speed, smear making, cell identification, cell counting. All these skills are now scientifically being measured and assured. When the person is fully ready, then only he's getting into the field to deliver these services. And now our trained technician with Reliance Foundation, with Tata Trust, they are delivering very successful career they have. Now they are with this organization. So what truly observe, now we are ready, because this CBC model is a very recent innovation, what we have come up with. But now we have a complete answer with Dr. Labai consultation and complete diagnostic care. So this is a very scalable model ready now, where we can ensure highest quality care in the remotest location by empowering the rural youth of that location itself. Thank you. So we have innovations over there. So if you would like to experience what we have built, it'll be wonderful. You can have it over there. Thank you.
Thank you, and congratulations, Mr. Amit. Okay, from food for thought, it's time for food for your stomachs. Let's break for lunch, and we shall meet here at 2:45 sharp. I'll start troubling you at 2:40 for 2:45. Thank you. Do enjoy your lunch. Hello. I hope everybody has had their lunch or is about to end. We will start in the next 5 minutes sharp. Thank you. Hello. Just a reminder call for everybody in the audience. We're about to begin. We request you to please take your seats. Thank you. Okay, welcome back, everybody. Everybody's had lunch? The most obvious question. No, sir. You're sitting right here and you're saying no. I was thinking I did see you picking up a plate, though. No, no, of course not. But everybody else had lunch? And then nobody. Okay, anybody who's not had lunch? You all had lunch. Lovely. It's time to proceed with the next panel discussion on cardiovascular diseases, CVDs, burden, and preventive medicine. And I hope that you've all got your energy back. So please join me in welcoming on stage our panelist for the same, Dr. Mohsin Wali, Senior Consultant, Physician and Cardiologist, Sir Gangaram Hospital, Padma Shri Awardee, Dr. Balbir Singh, Chairman and Head of Cardiology, PanMax, Padma Shri Awardee. Sir will be joining us in a while. Dr. Mohit Gupta, Professor of Cardiology, G.B. Pant Hospital, New Delhi. And the session will be chaired by Mr. Anuj Seth, VP, Alive Corp.
Good afternoon, ladies and gentlemen. My name is Anuj. Topic for this discussion is CVD burden and preventive medicine. So I'll start with some statistics before getting into the questions around this topic. So CVDs are the leading cause of global mortality and a major contributor to disability. Based on certain studies done earlier, in 2019, CVD was the underlying cause of nearly 1/3 deaths globally. Over 3/4 of CVD deaths take place in low and middle income countries as well. Out of the 17 million premature deaths under the age of 70 due to non-communicable diseases in 2019, as high as 38% of these were caused by CVDs. Given these alarming stats, it's obviously important to detect CVDs as early as possible so that management with counseling and medication can begin. It goes without saying that CVDs remain one of the leading causes of disease burden in the world. Dr. Wali, sir, do you think India is headed towards resentment and ignorance of CVDs as its symptoms in our daily routine?
Thank you. And yes, I had to acknowledge my deep thanks for getting me on this Bharat Swasth Mahotsav, especially Mr. Anurag Batra and Sudeep Srivastav. You see, this is the most important forum, and it obviously makes me feel that you have read good amount of material, as you quoted, very genuine statistics. Let me start by making it a little more interesting. I always tell to my patients that God has made heart the most sophisticated organ in our body. It's a very artistic organ. And the peculiarity of the heart is that heart starts beating when we are in the womb of the mother and doesn't take any leave, keeps beating till the last breath of the life. And this is what heart is. And as an individual, we make so many insults to qualify your question, I'm telling you all, to make a burden on our life and to the life of others by bringing in too much of three whites, that is sugar, flour, and salt, three bad whites. We pour in lots of sugar, we develop insulin resistance, and whatnot. So, coming to the answer of your question, the resentment is there, and there are reasons to resent. Why should we resent? Because we are a developing economy, a developing nation, and there's a very interesting term called DLY, DALY, Disability Adjusted Life Years. That is the years lost due to a specific disease, which has increased fivefold in younger patients in a country like India. And we are in the midst of a crisis. So your topic chosen for this forum is very, very important. And we are heading towards an epidemic of heart disease. As somebody just now was telling, we have become already nearly diabetic capital of the world. I just overheard in the air. Yes, I know. And according to global burden of disease, as you said, the data is absolutely correct. 24.8% of all deaths in India are due to CVDs. And the mean age in which a heart attack occurs in an Indian is 53 years, which is 10 years before than the developed countries. So therefore, lots of agencies, including UN, have focused attention on these facts, like in countries like India. SDGs is a very good term used in such forum, that Sustainable Development Goals set by United Nations in 2015 and later on also. They called for 1/3 reduction of premature mortality from non-communicable diseases, and in which cardiac diseases are the one of its target. And it also includes diabetes and respiratory disease, obviously, because of pollution. There are reasons why we are talking heart disease in this forum, because youngsters involved in smoking, alcohol abuse, low physical activity, insufficient fruit and vegetable intake. I will elaborate on that. Stress, everyday stress, and substance abuse. So this is an outline through which we can take our journey further, that diseases of the heart, especially coronary artery disease, when we talk of diseases of the heart, when we say CVD, we basically focus on coronary artery disease or heart attack. So we have to be very careful. You see, we have started losing youngsters walking on the road, CEOs, media anchors, those who were regular for the gym. Sudden deaths have increased, especially at the young age. And the reason for this is probably we are not doing correct form of exercise. Let me clarify why it is not correct. Because in the gym, there are instructors whose focus is on selling their product, or the youngsters whose focus in building their muscles, inspired by film actors and otherwise. So the basic aim going to the gym to train the heart is missing, is still missing. So this is very important to discuss today, and I have my colleague who will elaborate on further questions. My take for this first question is this is a serious issue for our homes, for our youngsters who are eating junk food at the midnight at 2 o'clock or 3 o'clock while their parents are sleeping, and in the next morning they see empty boxes of junk food at the tables, or sometimes not. So this is going to be a very serious disaster in the urban India and also in the rural India, where my India lives, majority of India lives, and there are reasons for increase in coronary artery disease. Thank you.
Thanks. Mohit, you created one of the largest contemporary registries of heart attack. Any findings that you'd like to share?
Thank you so much for this opportunity and very good afternoon to you. Well, I remember 21 years, 22 years when I was in Hopkins, I read in a line that India is going to be the world capital of CVD by 2020. And in 2022, I see that India is already on the second rank. And I'll tell you why it is important for us to understand that why CVD is so relevant to it. For assessing the progress of any country and healthcare system, there are 3 A's that are in. Just make a note of this. The product and the healthcare system has to be available, has to be accessible, and has to be affordable. Only a system that fulfills these 3 requirements is going to be successful. Now, the challenge here is that we are increasing in our availability. To some extent, the affordability is also increasing, but unfortunately, the availability, accessibility of this healthcare system is still very poor to a majority population. I work in a tertiary care center in the busiest centers of the country, right in the central Delhi only. And what we thought was we collaborated with Harvard University almost 3 years back and started the largest contemporary registry with more than 3,500 patients of acute heart attack only in one center, in single center. Imagine our single center is getting more than 5,000 patients of heart attack. We enrolled all of them. Now, what were the findings? Look at this when we say that we are already developing so fast. Out of these patients, imagine that 50% of these, 25% of these patients were between age of only 18 to 30 years. This is revealing. Heart attack occurring in a patient of only 18 to 35 years. This is very, very surprising. Not only that, 30% of our patients were very young individuals, less than 50 years was their age. Smoking was the highest risk factor in these young individuals. The average delay The average delay of a person of heart attack presenting to a tertiary care hospital, can you believe what was the time period from starting of the symptoms? It was 71 hours. The global recommendation is that a person of heart attack should reach the hospital at least between 2 to 3 to 4 hours. 71 hours is what it took for an average person to reach to our hospital. We also started studying the modalities which they use for transfer. Some were driving themselves, some were walking to the hospital, some were taking the bullock cart. This was the state of affairs for the patients who were presenting to the hospital. And then 50% of the patients who presented with heart attack had already 25% of the heart which was destroyed. We did the angioplasty in these patients. We had some level of recovery, but my question was, where are we heading? Have we developed an infrastructure to make our healthcare available to the poorest of the poor, accessible to the population which are living in the periphery? It's not that it's not only accessible to the poor. Sometimes even the rich population, they are also not having access to this. Ignorance was one of the major risk factors. Many of the patients, almost 15% of the patients, thought that their chest pain was only a gastric chest pain. When they reached a primary care center, the doctor there in the primary care center misdiagnosed them, gave them only a ranitidine or a pantoprazole and sent them back home. They had persistent chest pain, presented to the hospital, their heart was completely damaged. So that is why in these patients, we had revealing findings, which is known as the Norrin's Semi-Indian Registry. We have now 6 papers which are already published in all the international journals. And why this was important was because 14 years back, the CREATE registry, which was done in India, in the same population, showed that these were the state of affairs. And now, even after having large healthcare systems, centers, the state of affairs is only marginally better. So if we want to revamp our healthcare system, more than just modernizing it, we need to use and expand our availability and accessibility to the larger population. We have to replicate these models. And this is what we call as hub and spoke model. We have to create small replicas of the tertiary care hospitals in all the peripheral care setups. And that is how our whole population, iski jagrukta badhani. We have to increase the awareness amongst people. We have to make and educate our doctors as well as our patients that these are the high-risk symptoms that you should seek immediate attention in the healthcare. Nothing is going to work, policies are not going to work until and unless each one of us as a healthcare personnel, we are reaching out to the doctors and the public forums and to the masses to completely transform them. So this is what was the registry all about, that we had more than 3,560 patients, and we have used multiple analysis out of it. And I'm telling you, out of, as sir was very nicely mentioning, besides the contemporary risk factors like smoking, like diabetes, which was present in 30% of the patients, like, dyslipidemia, one of the major risk factors that emerged in our population, especially in the younger population, was psychosocial stress. I will be sharing these findings later with you as you ask me, and those findings will actually blow you apart. You will be amazed that where and how we are working. So that is why today that awareness has to be.
Thank you so much for sharing that. And thank you for creating such a registry, because the analysis out of this will definitely help improve treatment in the future as well. But there's been an interesting thing out of both the responses that I've heard so far, that we've seen ED in younger patients as well now. Okay? So is it a specific trend here, Dr. Wali, that we see that we can do something about?
Yes, I started pointing out in my first answer. The young generation has to be sensitized. When you say something about friends in the home, they are very sensitized. If I talk to my son, I talk about his friend, he is very sensitive about the person I'm talking to him. But if I talk about his heart and his future, And in case somebody's son is smoking, the father talks about smoking, they leave the room. This is the attitude of the young generation. Post-COVID, we are seeing, as my colleague was saying very rightly, that levels of stress have gone very high, and this has changed our behavior. Yesterday evening's single bulletin showed 3 ladies with abnormal behavior, one out of them slapping a doctor, one fighting at the toll, and the third one also was abnormal behavior. So in 30 minutes news bulletin, if we are seeing this kind of behavior, this definitely tells us what are the undercurrents of stress in our society, and this is serious. Similarly, my teachers have always said, do not talk of your personal experience in such fora, but it is very important what I am telling you. A person came from a village with full-blown myocardial infarction, 23 years, young, healthy man with no family history, non-smoker, normal cholesterol, non-diabetic, blood pressure normal, uric acid normal, no risk factors. And I was surprised that why this man had an MI. This was a couple of years back. And when he became settled and he became all right, I had, because he was from village background, I had sent him for an angiogram, not for his age. But his angiogram was surprisingly normal. Then I sat down with him again and took the detailed history. Why did it happen? Why did he have chest pain? And the history came that young energetic boy went down the well, the motor and pump got erratic. For repair, he alone went down and brought the whole Kirloskar pump up, following which he had a chest pain. The local doctor thought it was a gastritis or something like that. Just consoled him, gave him some treatment, and he continued to have chest pain, which is the normal scenario. And then somebody sent him to me, and then he is now walking normal, with normal health. Very importantly, we see certain patterns in young females and young males who have normal coronaries, or they have some other diseases other than atheromatous blocks. Some have abnormal origins of coronary arteries, as we see day to day in our angiograms, once in a while, of course. And then they have arterial diseases. The arterial diseases which we know of the larger arteries, they also happen in the smaller coronary arteries. Some of them are genetically determined. And so it is not a condition that we have to have atheromatous obstruction related to cholesterol and classical coronary artery disease. We can have a muscle coming over the artery, like bridging, myocardial bridging, what we technically call. Lots of females can have coronary problems due to overuse of oral contraceptives. So all this happening then comes in young, hypertension is not detected. I made a survey of a school, good school in Delhi, and in a class of 50, at least one boy was having hypertension. Some of them had history in the family. So we miss out blood pressure. Many doctors do not mind taking blood pressure in each and every patient, which should be a regular practice. So all this said and done, the most important enemy is diabetes. Very paradoxically, diabetes manifests when 30% pancreas is already destroyed. So when someone is aware of diabetes, he has already lost 1/3 of pancreas. Similarly, some diseases like thyroid are undetected. So this is, I'm giving you general perspective. But knowing about the coronary artery disease in young is very important. And you are making a registry. Kerala also had a registry, and they found hypertension was most prevalent cause in young coronary artery patient. And we have typical abdominal obesity and stress, of course. Then one of our colleagues, my colleague working at same hospital where you are working, Dr. Gambhir, had done a very important work on lipoprotein, which is a fraction of our lipids. So ApoB and ApoA1 ratio, this is also disturbed in these patients, and we have to regularly screen them for that. So what I'm trying to stress is that at young age, coronary events can happen. They can happen without alarm. This is most important. And higher suspicion index by all of us as doctors is very important. And they should be properly managed, screened, family histories traced, hypertension controlled. And here I would add something which I have seen in about 48 years of my practice. In a youngster, even when he comes with his father or mother, it is very difficult to convince that he has hypertension. And it's still difficult to convince him to take treatment. So if we ignore hypertension, if we do not convince the youngster that your blood pressure needs to be controlled, 10 years later, it is going to tell over his kidney, and sooner or later, he is going to generate a full-blown cardiac event. So all these things are very important. And in youngsters, as I said, food habits causing a lot of problems, including truncal obesity, which we typically have in India, are very important. And we have to really have a watch over what children are eating. Because one of my teachers taught me when this modern medicine was not that developed, modern cardiology was not developed. It was in 1972 in pathology class. And I still remember her words when she was teaching atherosclerosis. One of her sentence was that the nidus, the seed of the erythematous plaque, sets in the very early life when one is in the womb of the mother. So this is how the predisposition goes. And if we insult our heart by not disciplining our body, we are going to have the disaster which you are pointing out, coronary artery disease in young adults. It includes women as well.
Started the sessions earlier this morning. Dr. Anurag Batra also mentioned about technology being the future of healthcare. And we've seen that kind of a theme in all the presentations we've had today. Dr. Vaisa, do you see any developments in RPM space besides what we have to offer in the LifeCore?
LifeCore, yeah, I'm grateful for pointing out this. I use LifeCore. They have made a device, ECG device. And by putting it on the body, a layman can record his ECG, transmit it through the mobile phone to the doctor. And once in a while, if one is having acute MI changes, it can reach to the doctor within minutes, not unlike 71 hours patient reaching to the hospital, which is very common in India. We have to be very smart, you see, with the heart, because heart is beating every beat. 3 days back, I had a case. The patient had very severe form of a malignant tachycardia, and that patient was paranoid for not having DC counter shock. The patient probably was in left ventricular failure, and we made him to lie down. He was sitting, I talked to him 10 minutes, and I made him to lie down. He went into frank left ventricular failure, and he was immediately hospitalized. So this is how the system works, like what we call as talwar ki dhar or sword stage. I came across a very good word acceleration. So yes, I am seeing in future, and what I have felt to see in COVID days, we have demonstrated our skills and speed of treatment without face-to-face confrontation of the patient. And a lot of good has happened in India. I don't know what was happening abroad, because we did with a very great speed, and we treated majority of patients at home. And at least I can say that I treated a lot of patients at home. Now, a GP remarks from London, and his quote came in New York Times. We are basically witness 10 years of change in 1 week. This is amazing. Yes, this is true. We have done that. Our teachers used to teach us, do not consult a patient on phone. No, it's a good tool today. Patients are getting benefit of consultation. We can see the patient. We can see the patient on video. And many times we can get very good information by seeing the patient. So there's another word which I have just now written while I was having lunch, technonomics. So we have to deliver the technology in a cost-effective method. A technology which is cost-effective is very important, and its delivery is very important. And we have a lot of variables these days. You may be seeing, as somebody was talking about Elon Musk, somebody was talking about brain chip. We have a chip which we can link to the glucometer, and that chip can transfer the blood sugar data to the doctor sitting at a distance. Very important. So these are the technological innovations. Lots of them are very practical. We are connecting our blood pressure instruments through mobile. We are transmitting that data. So this is the era of technology, and we have to really explore this. And somebody was showing a lab bike, mobile bike. This is innovation for the villages. So such things can happen in day-to-day life, and we have to take an advantage. And I salute to the Indian minds, Indian young minds who are brilliant and who can change the future, even in the field of cardiology tomorrow. And I really admire our young generation, IITians and mathematicians, physicists, and young brilliant boys and girls who are giving us insight to enrich our experience and coupling the experience with the newer technology. And smartphones are boon. But sometimes picture is not as rosy in cardiology as it looks, but things will improve. There will be a lot of job changes. There will be new roles to emerge. And I see a good future, especially the topic which we are discussing. Every day when we were young doctors, we used to treat MI by, even Lasix was not there, by propping up the patient, by giving him a shot of morphine, sometimes if indicated digoxin, and that's all, oxygen. Today, we are doing cardiac transplants. So the things have moved from that bed with prop up position and oxygen cylinder to the cardiac transplant and many things in between. Government of India has also done a lot good to it. And when Mr. J.P. Nadda was health minister, they have reduced the cost of stents. So I'm talking this because these are all technological innovations, and we are getting benefit of that. And in a city like Delhi, every 1 or 2 kilometers, you have a hospital which can have an angiography. We have other tests, technological innovations, which help us to see the heart beating, echocardiography, to have imaging of the heart, and lot more, which is beyond the scope of covering in this small time. So summing up, I can say, yes, technological innovation in medical field, especially in cardiology, is a big boon. And we are going to see the benefits in the days to come.
We often talk about factors like stress at work. Any science done in this area?
So I'll talk about something which is very practical and relevant for all. You must listen to this actually. It was 2019, Friday evening at 9 p.m. We were already winding up our Catholic, and I was just about to leave. And suddenly there was chaos outside the lab, and we had a young guy, 24-year-old gentleman, who was brought there to the hospital. He was brought massage to our cath lab with an extensive form of heart attack, anti-all myocardial infarction. We took him on the table, massage on, he was put on a ventilator. I was asked to operate. I was the cardiologist there. And just smilingly went inside, and everybody was like shouting, and just the chaos was there that we really have to do something for this because it was a literally flat line. I went there and my colleague said that, Mohit, you are just smiling and you are just, I said, we are already working in the worst possible scene. We have to give our best. And we opened up, his main artery was on the intubation and the massage. We opened up that particular artery. We could see the heartbeat which was coming. We could see the blood pressure which came up. And successful operation, we shifted him back. Everything gradually stabilized, but he was still unconscious. The whole night he was monitored. Next day, when I went for my rounds, I was kept updated throughout the night. He was much better, conscious, still with the ventilator. We extubated him. And I started talking to him after a couple of hours. I said that, what is happening? Why did you get a heart attack? He's a non-smoker, non-diabetic, no family history, no other risk factors, still in heart attack. And their parents, his parents came. He was a married guy with a child. But his wife didn't come, and I asked that I don't want to talk to you. I want to talk to his wife. But they said, no, you talk to us. I said, no, I want to connect with him and his wife and family. His wife was bought, and I was informed that that guy was on the verge of divorce. I counseled the couple for approximately half an hour, 40 minutes. I took a promise from the wife that, your husband was almost gone. We have saved him. This is the only chance he has. I'm going to see this guy only when you hold his hand and bring him to my OPD. She said, yes, I will do that. And I said, promise today that small differences are not going to destroy your life. This young child, only 1 year old, where are you guys heading? Think about this. They all promised, hugged each other. And today, my dear gentlemen, it's almost 3 years down the lane. The child has grown into a big child. Both of them come walking, smiling to my OPD, and they are doing very, very fine. This is what we need today in our life. This is how I started experimenting and studying the genetics of young people. What I did, I tell you. We started measuring their DNA telomere length. Just like there is a cap on the shoelace, there is a cap on the DNA also. And what does happen is that cap goes down with the age, and hence as we age, the disease expression increases. So we included all the young heart attack 18 to 35 years in our study. And we measured their psychosocial stress, and we measured their genetic length. What were the results? Now listen. Their body age was 18 to 30 years. But when we measured their genetic length, you would be surprised in this published study, their genetic age was equal to a person of 60 to 85 years. Their genes were completely destroyed. The second question that came to my mind is, why is this happening? Mohit, you must investigate it. The single factor that was responsible in these young people, they had highest level of psychosocial stress, anger, irritation, hatred, jealousy, competition, criticism, expectations, everything massively prevalent. Then I said, how does it matter even if it is prevalent? We went into the deeper details, and we saw that lack of love, lack of purpose in life, lack of gratitude in life, lack of happiness in relations, that is responsible enzyme called telomerase, and that decreases the telomere length and makes the disease express much faster. When we taught meditation to these people, lifestyle modification to these people, you would be surprised that their genetic length started increasing gradually. My dear friends, this is the point I want to make, that today we are just working and doing a better, not better than what a washerman is doing. वो जो झाड़ू पोछे वाला होता है ना, उससे better a job we are not doing, my dear friends. Why? Because a person comes to Dr. Gupta, he will operate and do angioplasty and say, oh, I'm perfectly fine, a perfect procedure, artery is now flowing. That is not. We are just cleaning the floor, but none of us today is bothered to switch the tap off. The moment we turn the tap off, the disease will start going down and the epidemic will be stopped. And for that, we have to work on our basics. We have to harmonize our science with our ethics and our spiritual self. We have to teach that we are human beings and we are not human doings. We are doing throughout the day. That is very, very important. Similar study by Dr. Robert Waldinger from Harvard University. He again carried out Grant and Dweck. He said that the single factor that is responsible for a good life and a happy life is good relations. Happy relations in family. That is why it is very, very important. Very, very important. I'll give you a 5-point message as Anush tells me.
It's quite surprising to hear how genetic age can be.
Yes, it is.
Alarming. So just continuing on with that, preventive medicine is obviously also equally important. Right?
Yes.
Preventive medicine is equally important as well. So anything you would recommend in terms of preventive medicine?
Very simple. Very, very simple. You just keep this, note it down in your pen, in your mobile and anything. Keep it always with you. Just have a simple A, B, C, D, E approach. Nothing more than that. This is what I do for all my patients. A is alert, active, and assured. Every one of you, irrespective of your age. If you are a South Asian or an Indian, you are already at risk. Remember, Indians have a heart attack 10 years earlier, more severe form of disease with different risk factors and very, very poor prognosis. So we are already at risk. So we need to be alert. Second, B, blood pressure control. Measure your blood pressure once in every year if you are non-hypertensive and frequently if you are a hypertensive. C, cigarette cessation. Stop smoking. Any form of active, passive smoking, tobacco should be immediately stopped. Second C, measure your cholesterol. Once in a year, your cholesterol levels have to be measured, as Dr. Wali very nicely mentioned. It has to be complete cholesterol assessment, complete lipid profile, along with apolipoproteins and lipoprotein A. All these things have to be measured. D, diet. Take care of your diet. Very important. It should be a healthy heart, healthy diet, which I'll share sometime later. Then the second D is very important, is diabetes. Measure your sugar. If you're a diabetic, your numbers have to be set right. And the third D is de-stress yourselves. Every day, 1,440 minutes, my dear friends, you get. Take out 20 minutes to take care of yourself. Self-care is no more a luxury. It's a priority. I end my day with meditation. I start my day every day at 3:30 a.m. with meditation. 3:30 to 4:45 is my morning meditation time, after which I go for my workout. And then the last one is E, that is exercise every day. If I am to summarize exercise in one day, irrespective of your health and a physique, mote hain, patne, it doesn't matter. But if you are not walking for 30 to 45 minutes every day, you are decreasing 30 to 45 minutes of healthy age every day. These are the simple principles, my dear friends, that you have to measure. Jaldi ho, jaldi karo, time nahi hai. These have turned into a virus. Busy ho, jaldi karo, jaldi karo. This is not give and let give this word away from your life, busy. I've never let this word busy associate with me. I transform and change this word busy to be easy in my life. Busy outside, but be easy inside. That's the mantra for self-care. That's the mantra to transform your.
It was amazing. Never heard of a better definition for ABC. Dr. Wali sir, anything you would like to add on this topic?
I would say that with such a wonderful and wise audience, we can go on talking on the prevention of heart disease. The crux of the matter is, it is known by all, followed by none. So from today onwards, hearing to the nice thoughts of Mohit, and I also profess the same philosophy that we should be loving each other, we should be sleeping adequately. Sleep is also very important. De-stress yourself and do not produce adrenaline unnecessarily. And we do everything to produce adrenaline, starting from driving on the roads till in-house. Many patients, I ask their wives, does he shout? 80% of them says yes. So what we are doing, we are burning our heart, we are burning the telomeres, we are burning our age. The second message is, as far as it is possible, keep your children away from smoking. This is a bigger disaster coming up. And drinks, alcohol, all this added to Mohit's talk would make it complete message that heart is the decent organ in the body. Let us promise today that for everyone, we will be nice, we will be decent, we will love the humankind, and will live long for sure. Thank you.
I can see your time is up here.
Yeah.
Go ahead, sir.
The method of teaching is rudimentary. They teach it from the book, which are 20 years old. The same book is being repeated even now. They teach it from about heart. They will grasp, from the book, they will tell us it is heart. By showing arrow, it is heartbeat. It is not function. I mean, instead of that, if 3D animation is used, they are just shown that how it works for artists.
Yeah. In the more contemporary teachings now, sir, in most of the hospitals, we have tried to revamp the program.
करते हैं ये हार्ट में हार्ट काम कैसे काम करते हैं बुक में काम कर हार्ट तो आप वीडियो से दिखाएंगे तो पता लगेगा और दिस नीड टू you may be also attending some direct teaching to students and I think just scholars introduce just the management to do that.
A suggestion.
Wise suggestion, short 30 seconds addition to that. You are absolutely right, sir. Sometimes we can't animate the nature, but our medical teaching has deteriorated very much. Our generation was a little more fortunate to have good teachers and who have inculcated beyond the knowledge of the book and those arrows, good sanskars in us, and that we are trying to emulate and share with our students. You very well said this side of the first edition, and I wish tomorrow's young medical graduate should learn from teachers and great medical eminent leaders like Dr. B.C. Roy and so on, if not at least their seniors, to inculcate good mannerism, good bedside manners, and a positive thinking and hardworking nature, and above all, being a nice human being beyond a doctor. Thank you.
And my last line with which I'll end, and please आप इस चीज को आत्मसात करिएगा कि दोस्तों किसी ने बहुत सुंदर कहा है कि हर जज्बात को जिंदगी में जुबान नहीं मिलती, हर आरज़ू को जिंदगी में दुआ नहीं मिलती, मुस्कुराहट बनाए रखो तो दुनिया साफ है, आंसुओं को तो आंखों में भी पनाह नहीं मिलती। तो दोस्तों जितना हमने जीवन के अंदर सामान बटोरा है, मैं आपको केवल यही वर्ड बोल के जाऊंगा कि थोड़ा सा सामान तो हमने बटोरा, लेकिन अब सुकून बटोरने का टाइम है। अगर हम सुकून बटोरेंगे तो शायद जिंदगी हमारी अच्छी चले और जिंदगी में हम खुशी और आनंद का अनुभव करें। बहुत बहुत शुक्रिया।
That was lovely. Thank you so much, Dr. Wali sir.
I will thank you, Swami Mohitanand. I am inspired. Thank you.
Thank you.
Thank you, Business World.
Thank you. Thank you so much, doctors and Mr. Seth, for moderating that. I think a warm round of applause, ladies and gentlemen, for our panelists and for Sir making all the acute observations. Thank you. Yes, a group picture, please. You know, when the timer says time's up, I'm already here. And I think by the time audience also knows कि हाँ ये आ गया मतलब अब time खत्म हो गया. So we're trying to keep it on time. And moving on, our next panel discussion is on how far are we from eliminating TB by 2025. Please join me in welcoming a panelist for the same, Dr. Digambar Behra, former Dean of Pulmonary Research Department, PGI, Chandigarh, Padma Shri Awardee, Mr. Girish Krishnamurthy, MD and CEO of Tata Medical and Diagnostics, Mr. Ajay Bhatia, Commercial Head, Viatris India. We've also been joined by Dr. G.C. Khilnani, Chairperson, a pulmonologist and critical care, but doctor couldn't be here for some reason. And the session will be chaired by Mr. Shivam Tyagi, Editorial Lead, BW Healthcare World. Yes, you know, so Dr. Batra keeps saying this, and क्योंकि अब audience भी वैसे हमेशा कहते हैं कि doctors keep saying कि ताली बजाना दिल के लिए बहुत अच्छा होता है, and आप तो सब उसी fraternity से हैं. Thank you.
Well, thank you everyone for joining us for this lovely session. I think we've had a day where we've learned a lot about our health and our healthcare sector in general. And the flow of knowledge will continue since this panel is on a topic where is on a disease that we've been facing since last 75, 70 years. And we're still, the disease is still a big challenge for us. Now, the topic that we are discussing over here is how far we are from eliminating TB by 2025. Now, tuberculosis in India takes 500,000 deaths every year. And we are taking the world's burden. It's over 25% of tuberculosis cases, estimated tuberculosis cases of the world are present in India. So that it in itself is a very big challenge if we see. Now, without further ado, I want to address my first question to Dr. Behra. Dr. Behra, currently, what do you think about the current prevalence of tuberculosis in India, and how do you think we are fighting it?
So thank you and a very good afternoon, ladies and gentlemen. Tuberculosis is, as you have very rightly said, we had the highest number of tuberculosis in the world. About 26% of the world burden of tuberculosis is in India. And if I convert it into the numbers every year, we detect roughly around 26 lakhs cases of tuberculosis, new cases. Similarly, the drug-resistant TB, which is again another deterrent for our TB control. Again, we have the highest number. It is roughly 1,24,000 cases of drug-resistant TB in India. The point is, what are we doing for it? You see, earlier on from 62 onwards, we have got a national TB control program, which we call as the NPCP. But unfortunately, it was not that well organized. Then it was in a haphazard way. Then since 1992, we revised our strategy and we call it Revised National TB Control Program, or RNTCP. And since 21, we named this TB Elimination Program, or NTEP, National TB Elimination Program, which we are going to talk about the NTB strategy. In fact, a lot has been done since then. The basic fact was the political commitment, and then there are various components getting the newer diagnostics, newer drugs, and we have got a very well organized and structured program for this, whether we call it RNTCP or NTEP. But the question, the TB control program, it is the Indian TB control program. It is the fastest and largest, public health program in the world today. That is, I think, one thing we must remember. But the question is, the problem is so enormous. That's why lies the problem. We have done
so much and so many things in various fields. I'm not going to describe that one by one, but in broad, as I told you, as regards the diagnosis, the notification through the NICHA, then the giving drugs, diagnostics, giving people the monetary help so that they can have good nutrition. So all these things are being done. So lakhs of lives have been saved. And then the entire world, when it was decided, okay, we should end TB by 2035 or 2030. So our Honorable Prime Minister said, why not to do it a little earlier? So he announced that it should be by 2025. But that there lies the challenge. And I should say, there lies the problem. The problem here we have to understand TB is just not, as I understand, it's just not that Mycobacterium tuberculosis goes to the lungs and you get TB and you do the sputum test and the AFB is positive or do a chest X-ray and then you give them 4 drugs, INH, rifampicillin, ethambutal, pyrazine. It's just not that. The disease itself goes much beyond that. So what way? Because it has got a deeper socio-political, economic issues associated with the TB. We have got a huge burden of reservoir of TB infection. About 30% of our population, we are all infected, meaning thereby we are having the potential, then bursting it into the TB disease when we get a chance, when the body gets a chance or the mycobacteria gets a chance. This is number one. And number two is the various factors that are associated with TB. They're quite, widely prevalent in our country. Apart from this infection, which I told you, the malnutrition, overcrowding, slums, then the immunological issues, diabetes, which I think you heard just before this session. Diabetes, we are the diabetic capital of the world, and then the number you have already heard that. Then various immunosuppressive diseases. Fortunately, HIV has been controlled to a larger extent. It is not only our country, in many other countries, but then even if we have controlled the HIV is not a greater problem. Let me put it that way. I'm not telling it is not a problem. The other immunosuppressive things are coming out. Other immunosuppressive diseases, use of immunosuppressive drugs, that includes cancer, that includes the organ transplantation. So many factors they are responsible. Our occupation, the various types of occupation, the overcrowding, as I have told you. So it has got a different type of dimension to the TB control that has added. So as you said, the current prevalence, and you did the, remember the problem, I should say TB had been a neglected disease. Let me throw some light on that. You had many advances taking place in many fields of medicine, cardiology, diabetes, cancer, so on and so forth. Can you believe that the last drug, when the last drug of TB was discovered, anybody had worked on the TB drugs? That was 50 years back. Nothing happened beyond the late 70s till about 2012 or 13, when it was realized and work started and we got 2 or 3 new drugs. That means for the about 40 years, 50 years, nothing. Nobody worked on TB. I do not know whether we thought. So that is what was the reality about TB. Now coming to the program in our country, yes, the program is very well running, very well. But unfortunately, the problem, as I see, it actually works through our existing healthcare system. It works through the various states has a different healthcare system. If state A has got a good healthcare delivery system, then that state does well. If state Y has got a poor or inadequate or whatever you may call it, then the delivery of the healthcare system or the TB control program is affected that way. I think there is a dissimilarity in various states that as I could see. Then again, very well you heard in the previous session, it is just having the knowledge or science is not good enough. It is most important to know that how that knowledge or science is being, utilized for the mass or for the population or the person on the street. I think that is what is one issue which we should ponder over the India as a country, or as a country we should understand that. Just understanding, we have done a lot of improvements. You see, diagnosing TB, I just give one example. Say for example, gene export or TrueNAT. You know, technically speaking, within 110 minutes, that means less than 2 hours, we should get a diagnosis of TB. Do this sputum examination, within 110 minutes you get, yes, this is a positive or negative. But actually, you see, go to the field, go to the hospital, what you get, not on an average, it takes 1 week to 10 days to get that report. So why that is happening? So I think that we need to ponder. So these are some of the issues that I will, to start with, I will tell you the prevalence you asked me. Again, the situation is not very good. We had got the first national prevalence survey somewhere in 1958. So then after 60 years, just this year we got our next national prevalence survey. Although in between we had got various sub-national surveys, but then this is again very alarming. The figures are very alarming. They are not very good, despite our program having working for many years and working in a very efficient way. But question is, you can see on an average, roughly it is 316 with TB cases per 1 lakh population. And then again there is a variation. You see, Delhi is having the highest, that is about 700 plus per lakh population, and then Kerala and Gujarat having the lowest number. So this is roughly speaking about the prevalence. So the things are again not very good. So NTB, yes, the Honorable Prime Minister has given a push. Everybody working very hard. But into my mind, because of these issues, although it may be 225 is just 2 years, 3 years left, we may not be able to achieve that, but we will make a significant progress. That will be my short answer. Thank you.
Thank you, Dr. Bhaira. You highlighted a great point that we have been there with the policies, we've been there with the free drugs, we've been there in some states with the delivery system as well. But the figures you've highlighted, that the first study which happened in 1958, it came out and it said that 4 people per 1,000 population. That was the prevalence of TB at that time in 1958. The recent study, which happened in 2021, that it said that over 3 people per 1,000 population are still suffering from TB in India. So that tells you that in terms of prevalence, how far we have come. It's really less. Now, to get to my next question, I want to bring in Mr. Bhatia into conversation. What do you think is the role of industry in managing and controlling TB?
Thank you and good evening to all. Now, as Dr. Bhaira already mentioned about the various challenges which this program is already facing. And one such challenge is the development of infrastructure. As an industry, we can play a significant role in terms of new drug regimens, which really help to shorten the duration of the treatment, create more safe and effective way of giving those treatments, and also to ensure that access to those treatments happens across all the communities who actually need those drugs. That is the first part. Second, even if you have the access of these drugs available, access of these infrastructure available, how technology is nowadays plays a role in terms of early detection. One of the biggest challenge, even in tuberculosis and communicable diseases, are how can you do early detection, which will help you to detect early and then treat them and prevent the spread of this disease. So as an industry, we always look for partnership and association with the like-minded people to create that sort of awareness and use various technology-based approaches, various digital tools-based approaches, which will help us to not only create, build, or access or create a sort of implementation model, which will be helpful for the community to get all this.
Right.
I want to bring this question to Mr. Krishnamurthy as well. So how do you think the industry can help in controlling and managing the TB? What is the role it plays?
See, it's open. See the way the veracity of the problem has been defined, the prevalence and especially the disease burden as a country we carry. It is not possible just to make this happen. Certainly, the industry has to play a very, very important role. And Ajay mentioned about how drug discovery and the new drugs which is to come, which plays a role. And diagnostic is another area where it's become very expensive today, especially for TB. The amount of disease burden we have. It's a very, very large economical problem. For us to make this 2025 goal, one is we have a huge issue of capacity to diagnose and treat. So we have a huge capacity. Second, doctor mentioned about the disparity in the delivery capability. So the consistent delivery capability is also the second. And the third issue, which is what is that we will do long term, so that we need to prepare a foundation. Like from 1952, 1970, 1990, always we know TB is one of our biggest problems. And you also mentioned we have some reason we have not addressed. So now we need to look at what is 2025 we achieve or when we eliminate, whatever the date it is. But as Honorable Prime Minister said in 2025, but beyond 2025, what we need. So it is generally it is an industry has to play a very, very important role. In the last 50 years, private industries coming into TB and effectively contributing is. And using this 2025 as a goal with the Prime Minister program, I feel this is the time for industry to step in. And more or less, if you look at last 30, 40 years in the TB program, it is the international companies which is coming into India, either in the drug space or in the diagnostic space, for the supporting. But it is time for, when you say industry, you also need to quote that to India's problem, Indian industry has to. So a lot of Indian industries has to step in to really address. And I'll go a little later on some of this finally.
Thank you, Mr. Krishnamurthy. Now, coming to my next question and addressing the elephant in the room, to how far we are from eliminating TB by 2025. Now, the UN has said that worldwide they have targeted to eliminate TB by 2030, but we have pledged to do by 5 years earlier than that. So, Dr. Behra, I want to address this to you. How far we really are from the target, and if we are to achieve that, what will be the imperatives that will take us there?
So as I have hinted, you can still see I quoted you the figure. Then still we are getting so many cases of TB in the community. Of course, if we go by what do we mean by ending TB? What is the ending TB by 2025? So in comparison to the various figures that was in 2015, and then in comparison to that, what should happen? That means we have to reduce the incidence by 90%. So I think you make the calculation and you make your own conclusion. So I am not going to tell you openly yes or no, but therefore I made a very categorical statement that yes, it is we will be nearer to that, but we may not achieve that figure. Let us be very practical about that. And the number 2 was the reducing the TB deaths, the people dying because of this. That was the second goal of this NTB strategy. So that to a greater extent, say for example, the people, how many people are dying per lakh, and then it has come down to a greater extent, but again, not to the figure that is expected to be done in comparison to what was in 2015. And the third thing was reducing the catastrophic cost by the patient and his or her family because of TB. Maybe the last one we have achieved to some extent, but still I'll say lot of people still go to the to seek healthcare where they have to spend a lot of money. Earlier I was working in a government sector, and now I am working in a private sector. So in the private sector, still many people go to the private sector. Obviously, they go there. Although there are facilities for free drug, free diagnosis, free everything, but because of certain things, then why they don't want to go to their to their government hospital nearby? Why they still want no and go to the private hospital? Because obviously there is something lacking in our government hospitals. Then if the patient gets that type of facility, if he is getting in a private hospital, say he comes, he is seen in a time, he gets his diagnosis within time. So I think that we need to build up. And in nutshell, I will tell you, because we need to work on these issues rather than just telling or announcing that we give free drugs or we do the free tests. So that is possibly not enough. So really it has to be worked out that way. And then regarding the industry and then the so-called public-private cooperation, there is a lot a lot of things have been done. And then the private sector is coming forward, the industry is coming forward to help the program. But I think still there is a lot of lacking. Say, for example, even you will be surprised to know that again, I'm not trying to criticize anybody. It's not a fact. That is not the purpose. The question is how we have to improve. The amount of funding which is given, even in under the government setup, they give a lot of money, but the extent of utilization is not 100%. Why shouldn't, if you give me 100 rupees, why can't I spend it? I am not able to spend that 100 rupees. And then very small figure, that is of course 3 years back, 4 years back, I know the utilization percentage was as low as 30%. In some states it is as high as 105%. Some people spend very efficiently, some people don't spend even the money. Say for example, the human resource. The human resource is already identified. Okay, for this number of healthcare workers are required. That is not most of the time, either the posts are on field, the people are not available because of whatever reason. I'm not going into that detail. So in a nutshell, I had hinted in my opening remark that the healthcare delivery system therefore is not very efficient. You don't get doctors, you don't get technicians, will not be nurses. So there are some issues about it. So I think our delivery system is to be very efficient. Somebody is to be looking at it. Yes, there is a lot of development by the industry. They, as I told you, they have developed new drugs. Now the duration of therapy has come down from 18 months, 2 years, 30 months to now it is as low as short as 6 months. We get even the drug resistance, MDR, multi-drug resistant TB can be treated very efficiently and with better result if the treatment duration is 6 months. They have come, things have come now with the BPAL regime. So these things are there. But on the other hand, it is not reaching to where it should be. Not to everybody. That I should say.
Dr. Bharat. Mr. Krishnamurthy, I want you to come into the conversation again. And here, Dr. Bharat mentioned about public-private partnerships. How much do you think these are essential going forward in controlling and managing TB?
I think I will combine your previous question, how far we are in 2025 and what we are. See, as a country, when I look at the current Stop TB program or eliminating TB program, we got the methodology right. It took some time and COVID also derailed us. But I feel all the components, what is required to be done in a very aggressive manner, we got the methodology right. So let's take first the diagnosis of a TB right now. While the disease burden is predicted very high and prevalence rate is very, very high, that's what we see. But what we don't know, we don't know, right? It's all real prediction. So certainly let us make an assumption, the prevalence more than what we really know. Now that means the diagnosis comes very, very important. So diagnosis, I want to divide the diagnosis into two parts. Because the confirmatory test today available, which is complicated. That is, it takes time. You mentioned sometimes it takes 1 week, but it can be done in 2 hours time. And at the same time, the screening methodology also has evolved. The recently last 1.5 years, if you look at it, a little more than that, the digital X-ray framework has come into a real model to diagnosis, at least screen better. So in the digital X-ray space, I see into about 3 different methods we need to quickly adopt. We are ready theoretically, we know how to do it, but we need to do it nationwide. One is like, handheld X-ray type with a very moderate radiation and easy to operate. And second is portable digital X-ray where you can put it through close to the care, point of care or close to the patient through a mobile van. And the third is stationary X-ray, but it should be necessarily digital. The digital gives us an advantage that immediately available X-ray, number one. Second, eliminate lot of manual intervention to really screen. So there are a lot of automated tools have come, and I think Government of India is also approved few of them, and worldwide it is a very matured model where a fast track screening happens. See, all this time it was not happening. So this methodology is in place. We need to find out how do we fast. Once you do the screening from the diagnosis perspective, while whatever the method old we had, but to create really a good throughput to get it, we have standardized to do a molecular based test and either a closed system or open system. But we might need to use this opportunity during COVID. We kind of established large molecular lab, large amount of molecular lab in the country. In government setup itself, there are about 3,000 laboratories out there, and about 7,000 laboratories out there, where we have created a strong molecular diagnostics capability and with technicians and but not necessarily to do a TB diagnosis. So creating to leveraging these laboratories to a molecular diagnostic test on an open method can give us some capacity very quickly because it's readily available and we are used to it. We're still not out of COVID. The infrastructure in place, people are in place. We should quickly leverage. And then we have the closed system diagnosis. We have got few companies, but predominantly the capacity and the economics is the challenge. So we need to find a solution to how large scale capacity we can create on the closed system diagnosis for confirmation. But screening to diagnosis has to happen in unison and fully supported through a monitoring and digital platform again, which we proved during again in COVID. ICMR did a fantastic job. Not even one test was missed, everybody. So if we put a will together to create a platform, it is possible, but for some reason it was not fully successful in TB yet. So we need to make that rigor ready to ensure the tracking monitoring mechanism at the very early stage from the screening stage is integrated, then moves into therapeutic. Of course, we have a lot of new drugs coming in, and we are using some of the old drugs and availability of drugs. Government is subsidizing or giving free. All of these are there. Now here, compliance and governance plays a very important. Since it is not a one time, it is more or less, TB is like a lifestyle disease. Now 6 months to 1 year or 1.5 years, somebody has to be monitored and tracked. So a overall command center based, continuously monitoring patient. See, today, the culturally in health system, one big problem we have. Always it is patient driven. Somebody is sick, they come, then we identify as a team. Whereas the way we are looking at 2025 or whatever the time frame, it should be more proactive. It should be system driven rather than patient. The health systems and health delivery authorities, state, they need to drive. Now, by putting this together, we can achieve this target very effectively. Maybe 1 or 2 years later, or we will achieve it 2 digits, but that is possible. Then I want to take it the 2 other items which you need to really, which is not been in the discussion or it is not getting priority. See, TB is a very old disease. And our scientific community, if they put their things together, what are the mechanism we can bring preventive therapeutic in TB is a very important point because it's not going to be over by 2025, 2028. It is going to continuously linger around. So the preventive therapeutic is an area where we need to trigger a lot of research. And of course, the final Brahmastra in this is the vaccination. As a country, as a group, the kind of prevalence we have and effective TB vaccination should be on our cards and where we need to put our mind. So this is where I will stop to give you, and all of this possible, not just by having a government here. It can be a lot of PPP model, which we are already doing. I think as a country, we are mastered managing the quality of a PPP model, economics, and how the private partner can be profitable. As a country, pretty much we have mastered that. And just we need to bring in the rigor to get the holistic approach.
You highlighted a great point there that we have to rigorously do the screening and from screening to diagnosis to treatment to therapeutics, it has to happen in unison, a collaborative approach if I may. Mr. Bhatia, I want this question to be addressed to you too. How do you think collaborative approach and public-private partnership is going to be essential going forward?
Continuing what Mr. Krishnamurthy mentioned from early detection point of view, seeing the collaboration starts even from before that in order to create awareness. How are you utilizing various community-based approaches so that the awareness around early detection should happen, and how you use the technology going forward to detect early. Some of the few initiatives which we have taken in our organization is in terms of artificial intelligence based software, which will able to detect early, detect TB very early. And by detecting early TB, you could able to treat them fast. At the same time, there are now tools available which will also help you to create a sort of a symptom-based course. And when you get those technology-based symptom-based course, you could able to also stratify the risk factor and also ensure that if there is a risk factor, then you can screen them early and also treat them early. That's the second. The third important factor, which is very, very important in managing the collaborations, is also in terms of prevention. So you can treat with drugs, you can detect early, but if you cannot prevent the spread of the disease, this will not moving towards the goal of eliminating TB from this country. Dr. Bhaira already mentioned about 30% of our population have the latent TB. What can we do to ensure that awareness and education at the community level happens so that we could able to reach out to the masses and educate them for early detection? We can have a lot of collaborations with the community-based leaders. We can create advocacy around those district level or state levels regarding TB advocates, TB champions, so that we can create examples to the community and say that there is a bridge between the program and the community, and whatever the gaps and challenges which are seen by the patients on the ground can be addressed to those advocates as well as to those TB champions.
You mentioned a very valid point that the awareness, I think it's an issue because Dr. Bhaira also mentioned in the start of the conversation that TB has gone in the background and it's not in the front. So my next question is on awareness, Dr. Bhaira. Do you think there is still less awareness that is needed to eradicate the disease? And what do you think should be done to increase the awareness of farmers?
You see, one of the components of our TB control program is the IEC. But some IEC, you are very right, I will agree with you that the awareness program is needs to be more aggressive. Maybe sometimes you can see the advertisement by Amitabh Bachchan ji. Sometimes he speaks about TB, but I think the similar such things needs to bring about the awareness. Then, as very rightly told about the screening part, we have, but now who are to be screened, and that part is already identified. I told you about certain at the beginning of the session. I told you which are the vulnerable population who has to be. So they are the targets. So our early diagnosis, as a part of early diagnosis, earlier it used to be passive case finding, means somebody is having cough, he goes to the healthcare system. So now the program is trying to find the active case finding, then it becomes the intensive case finding, and now it is the targeted case finding, so that the number of cases are detected and they are reported to our clinical system. So that is and then accordingly the patient is treated and traced and completes the treatment. And then at the end, I think very rightly you pointed out about the vaccine. A lot of this work is being done by the ICMR. You see, the TB Research Consortium of the ICMR is already undertaking a vaccine trial. It will be one of the world's biggest vaccine trial. It is already on the 3rd year. So we have to wait 1 more year because these vaccine trials need, and there are 12,000 subjects are there being followed up very meticulously. So I think while we are discussing here already, the other team is monitoring how it is done at different places. So I think it is going on in different ways. The country is doing, and I think the vaccine again is created. Very good thing is done by the Indian pharma company. So that is being tried. So I hope something will come out. So at this juncture, it is not. I will not try to reveal, although I know some of it, but it is not ideal to speak out something about the results. But I think we may get something good. So all these things are going on. But what I think we need to emphasize it, all of us, or the society as a whole, it should be social movement. It's not just between just it is a case for the TB patient or for the government or for the program or for the industry. I think all of us should work together and it should be made a social movement. Maybe then that will have better success. Let me put it that way.
Thank you. Mr. Krishna, if you would like to add to that?
Add to what?
To the awareness.
Yeah. So I agree that awareness should be a social movement. But right now, what is that from a common man perspective? Why is he is not able to think this is a big problem? That's a question we need to answer. See, the common man, when you say awareness, what is that awareness you want to create? You want to say that no, we have a big problem of TB in the country, and is that the one, or what is the impact it is going to happen to him if he doesn't do? And so those kind of messaging right now, there are a lot of thought process has gone in. But I think the communication aspect of it. So all the missionaries, government missionaries and the private missionaries, and a social movement has to be created from the individual citizen perspective, because the individual citizen is not sick, and most of the TB is latent, and he doesn't see it. So he doesn't know the veracity of it. He's not seeing. We are thinking as a country at a macro level, this is the impact of it. But at a micro level, as an individual level, is the communication, and which we did a fantastic job in HIV. I think we need to do that similar one on TB.
Mr. Ajay, would you like to add to that?
I think most of the point got addressed, but still I feel in terms of now as a organization or as a corporate or even as a societies, we all need to take a pledge. We all need to take a pledge to create awareness. Yes, maybe at the micro level, it looked like that it is not impacting us, but at the same time, the movement starts from individuals. And when you start a movement, like when you start working with corporates or business associates or with the NGOs, and take that pledge of creating awareness, and take that pledge of also some of the very social factors of TB, which is like stigmatization or discrimination behavior. I think if we can all start talking about all those things, this will have an impact in the long run, and this will also have an impact of creating an earlier awareness and detection about this.
Also, one message that you would want to give out to the audience to how should they educate themselves about TB and how should they educate others about TB. Dr. Behra.
Yes, I think all of us should know for ourselves, and also we should spread the message that if you have got symptoms, the warning symptoms of TB, so I think you should go, like say for example, cough for the usual things. If you have got cough for more than 2 weeks, you have got blood in the sputum, you are losing weight, you are having no, you are having loss of appetite. So this type of things, so these are the warning symptoms. So you should get tested for it may be TB, and also similar messages in your area, in your village, to the relatives. So I think that will be one great step. And once it is the diagnosis is available everywhere, it is free. So if it can be done, then get the adequate treatment, which is equally efficacious, and they will be totally cured. Otherwise, I think one very important point which is told, it is very important how and what will happen if you don't get treated, you don't get diagnosed. I think that message also is equally important.
Yeah, we have to change the tone of awareness from a macro level. We have to individualize the problem. Mr. Krishnamurthy, like.
So if I want to spread TB message, I cannot advise audience, but I can say if I really want to communicate to my friend or a colleague the importance of TB, the way I would rather say is, I will tell him that why I don't have TB, how I determine that I don't have TB, and how I'm protected for it. And I will start talking it, so which will automatically become contagious for people to follow. So that's the way I would rather say that first, if each and every individual, if they start thinking, do I have TB? Don't have. And how affirmative I can say. And if you're able to same communicate that how affirmative you are, you think that you don't have TB, then everybody will have that. That's the method I will adopt.
See, for me, the message is very clear and simple. I think we all should become an advocate for creating more awareness. And also within the awareness, the message should be that by giving awareness, you also are saying that you are also preventing the spreadability of the disease to others. This is if we give these two strong messages, like you become an advocate, and at the same time, you also giving a message of preventing the spreading of this disease to others. I think we are moving in the right direction in terms of eliminating this disease from this country.
Thank you, Mr. Bhatia. Now we can open the floor for questions. If there are any, stand up, introduce yourselves, and ask the questions. Yes.
Hi. So I wanted to know, when a patient has TB and he's had his medication. Okay, now you can hear, yeah? So if a patient has TB, he's had his course of medication and he's supposedly cured, does he need to be monitored throughout, or does he need to go in for monitoring again for the rest of his life, or it's done at one time?
No, usually after the completion of treatment, we follow them up for about 18 months. After 6 months, 12 months, and 18 months after completion of his treatment, whether the sputum is again becoming positive or not. That's all, not that you.
Okay, and but it can recur.
Yeah, it can recur, but by and large, it is not. If the treatment is complete.
Right. Thank you so much for the question. Right. I think you're being positive. Okay, sir.
Hello, everyone. I'm Rajiv Nath, Forum Coordinator for IMED. My question is related to the biggest issue of stigma. We've not been able to address the stigma issue of TB. So unless we address that, I don't think we cannot really move forward in eliminating TB. And I think that's the biggest psychological challenge, whether it's for employees or even in our own homes.
That's a great question, Dr. Behera.
Yes, I think many people come out. Say, for example, I named a great man. So he himself tells, "Well, I had TB." I think that we hear in the television message. So that type of thing should come up so that, the message goes. So he is not hiding, he did not hide it. So that way, I think we all should do that. And your point is very well taken, sir. That is one of the still the things people are not coming out of it. People are not hesitant, but still a larger number of patients are still they want to hide it. They think the stigma is always there. But I think with time, we all should, as we are telling very clearly that all of us should come out uh, so that there is no stigma.
Right. Thank you. I think we have deciphered a lot from what's coming up, vaccination, and a lot of collaborative approach that is going to be essential from diagnosis, from screening to diagnosis to treatment. And we will make great strides in controlling TB by maybe not by 2025, maybe a year or 2 years after that. But if the imperatives are done right, we will be able to do it. Now, again, I want to thank the panelists. And I have a question. It's a very positive time. Okay.
Thank you very much. I'm Dr. Pandav from the All India Institute of Medical Sciences, where I spent 45 years. I want to ask you, Dr. Behra, especially, the treatment schedule for TB is 12 months to 18 months. So the greatest challenge is compliance. I want to understand from you, what is the strategy you have used for compliance?
Yes, sir. Fortunately now the duration of therapy has come down from 12 to 18 months to 6 months. Of course, for MDR TB, it is still, about 9 months to 11 months, and in certain cases up to 18 months. So for that, I think there is what the strategy was DOTS, that is direct observed therapy. That means once the patient gets the drug or the treatment, so he is regularly followed up by a DOT provider, or the DOT provider may be from the DOT center itself, from the government side, or even the family, or some friend becomes a DOT provider. So that was the strategy. There are many electronic ways also, like say for example, and what we call as dots 99 dots, meaning thereby the patient, there will be telephone number. Once the strip is, there will be telephone number which is free. So there are many ways, sir. So I think that is being adopted that too, so that the patient completes the therapy. But again, I understand what I am sure, sir, you know all these things, it is there. But your question is it being really implemented or not? So that part actually I will not like to answer.
I hope that answers your question, sir. I want to thank the panelists for being here and the audience to be patient for listening in to this conversation. Thank you.
Thank you. Thank you so much. Also, thank you so much, Shivam, for moderating the session. A group picture, please. Okay, that was a session on how far are we from eliminating TB by 2025. And now it's time for our last panel discussion of the day, which is on healthcare policies and program conundrum, corporate sector expectations versus public interest. Please join me in welcoming a panelist for the same. Dr. T.S. Clare, Chairman, Fortis Heart and Vascular Institute, Padma Bhushan Awardee, Mr. Rajiv Nath, Forum Coordinator, IMED, Dr. Urvashi Prasad, Director, DMEO, Niti Ayog, and the session will be chaired by Mr. Harbinder Narula, CEO, BW Healthcare World and BW Wellbeing World. Let's welcome them collectively with a nice warm applause, everybody. Thank you.
this session is more focused on trying to understand the challenges that we as an industry are facing, both in terms of ethics as well as, the corporate sector expectation versus the public interest. So I want to begin with my first question, and it is, Dr. Blair, I'd like to ask you, because you're so passionate about it, that there was a time when doctors were treated next to God. And unfortunately, there is a trust deficit which is there, and what has led to this, and what are some of the unethical issues that is now becoming a burning issue in the industry today? It's a very controversial question, so let me begin with this.
First of all, I want to thank you, the business world, as well as the HEAL Foundation. You have taken first such step to call Padma doctors and to discuss about the health scenario of country. So compliments to you. That's number one. Number two, what you said is very right. We have seen progressively decline in the trust of the public and doctors and hospitals. Let's face it, let's accept the reality. I have been in Delhi for the last 33, 34 years after my, training in the UK, and there has been a progressive decline. And I tell you, there are reasons for that. The reasons are multiple. First of all, if there is any inadequate treatment or wrong treatment of a patient from any doctor, it is because of two reasons. One reason is the doctor doesn't have adequate knowledge of the latest, what should be done. So this will be called as a lack of knowledge, or that he is not up to the mark. And we have such doctors, such medical professionals who do not keep pace with the advancing knowledge. The second reason could be that he is knowledgeable, but he is not ethical. He does some procedure which is not required, medically speaking, for the benefit, for the commercial benefit. So, and honestly speaking, there are both the components in our country. The problem is that if there are 10% or 15%, let's say, unethical people, the whole community is labeled as unethical. So that is one reason, that there is a deficiency on our part. So this I accept is on our part. The second is the negative role played by, and I'm sorry to say very openly, negative role played by our politicians for the benefit of publicity. It's very, for last 15 years, it's very kind of normal nature to blame hospital, to blame doctors, particularly private sector. Though today, almost 75% of the healthcare in India is delivered by private sector. So they are labeled as that they take more money, they do this thing and that thing. And many politicians have given statements in the paper. All of you must know. The second thing is, the third thing is, I think even the role of press has been negative. If there is a doctor, some patient dies, they make it prominent headlines all over the country, so and so. So this is a mixture of all these things. So as far as I'm concerned, my role as a doctor is to rectify my own yard. That how, as doctors, we can remove this deficit, we can get back to our past glory is, first of all, I would recommend that there should be a system where doctors are supposed to attend certain CLE, that they have to have credit hours in, let's say, every year, so many credit hours, he has to attend some meetings so that he knows what is latest. And this is not only by compulsion, it must be mandatory. The second thing I recommended in the past, I even do that today, that there has to be some kind of minimum examination every 5 years of any doctor. See, once you get a degree, it doesn't mean that you are good for life. Medicine is ever changing subject. You get a lot of publication daily. I don't know how many number of publications come daily, even in cardiology. I'm not able to keep pace with them. So nobody is perfect. Every 5 years, some minimum examination could be computer based, sitting at home should be there. This is to augment the capability of the medical professional. Then as far as the unethical practice is concerned, only way is that we should introduce what is called as medical auditing, which doesn't exist in our India. If I do, let's say 30 angioplasties in a month, there should be somebody to check my 1 or 2, 3 cases randomly and find out exactly whether I've done the right thing or wrong. For example, if I'm the auditor and I go to some center, I can pick up some, random files. I will see the CD, I will see the history of the patient. I can tell you that whether this was required or not. So medical auditing should be introduced. I have said in the past, I say it again, and I think it is people like you, business world, to tell the government that we need some kind of medical audit. So if there's a doctors are knowledgeable enough, then they also have in this mind that there is somebody who's going to check you. Then I think this malpractice can be decreased to a lot of extent. Let me tell you that the people in America or Europe are not more honest. Human beings are same everywhere. Exactly, there's no difference. But in US and in those countries, there are checks. The checks by the government, the checks by the insurance company that this is what is supposed to be done. This was done wrongly. They'll catch you. So that kind of things are required as per government. And I think it is a lot of loss to the public also because they have lost faith. I'll tell you one example. 37-year man come to me to show me 5 years back, and he said, I said, what's the problem? He said, I get breathless. Even when I lie down, I have to get up. So I see the file. Just 1 month before that, he gets a pain in his chest in the night. He goes to a hospital. He has an acute heart attack. The cardiologists say that you need urgent angioplasty, but he doesn't believe the doctor. He goes home. Initially, I thought there must be some doctor who has not done the right treatment. I see the ECGs and ask him everything. The doctor ने क्या कहा था आपको अर्जेंट ट्रीटमेंट के लिए कहा था. He said, सर कहा था, पर हमें विश्वास ही नहीं हुआ वो क्या कहते. So he didn't get him treated. If you don't open the artery in a acute heart attack, the damage to the heart will be permanent. So his ejection fraction dropped from 60 to 20%. Mind you, he was 37, accompanied by his young wife and 2 small children. And I wanted to cry what I saw. So this happened because there was a lack of trust. So people, if you don't trust your doctor, many times you will be also in problem. It's both ways the problem.
Dr. Claire, I think you brought up a very important issue. It's not just the trust which is being broken, but the impact of it is that people are not believing when they genuinely also have a, and Dr. Raghunath, I would like to come to you on the same issue. When you're looking at the lack of faith in the system, lack of faith on the doctor, and when something negative happens, it is leading to violence against the doctor. What is leading to that apart from the 2 things that Dr. Claire has mentioned? Anything that you would like to add?
Today's occasion of calling in all the Padma awardees, an excellent initiative and an idea, is again very inspiring by the great job done by these stellar persons and their institutes which they run. Along with that inspiration, unfortunately, over the years, private healthcare has really improved. And we are proud to have hospitals in India which are competing with the best in the world, what we call 5-star hospitals. Unfortunately, with that came the corporatization of healthcare. Nothing wrong with that. I'm a businessman too. It's okay to make money. It's good to make money. Money is to be used productively and to grow and help in the economical growth of the country. All that is fine. What went wrong? Or as an outsider to the system, what do I see going wrong? I noticed that the tail is wagging the dog. The institutes were put up by doctors with very strong value systems. You see anybody's website, Vedanta, Fortis, Max, Apollo, the doctors at the top and their statements are inspiring. The ground reality when you're in touch with the hospital is different. If a patient is coming on a three-wheeler, there's nobody at the reception to tell him that, Baba, you cannot afford this hospital. I'm calling an ambulance and I'm redirecting you to a hospital which will be matching your pocket needs. They will still take him inside knowing that he cannot pay for it. And that's the starting point of the problem. The second problem that's come in is the CEOs who are running these organizations are not from medical background mostly. They are MBAs from commercial background whose sole motive is pleasing the shareholder. And slowly they convince the ethical doctors that money is the key thing. As an industrialist or as a doctor, you're doing something to achieve success. Money is a byproduct from that successful journey. None of us chase money for money's sake. But in this journey, what I find in the hospital case, we've got misled and we are chasing money. And that's where I think that's become amiss. So three things have happened in shortfall as bullet points. You've started the game of commissions. You started the game of needless diagnostics and needless treatments which are not required to shore up your department's profit center because you are a party to that, you're answerable for that and accountable for that in certain hospitals. Not every hospital, but certain hospitals, yes. You're buying medical devices and pushing medical devices and products which have got the highest trade margin, which will add to the bottom line because that's what's demanded by the hospital's organization. So in doing that, the mindset has slowly started eroding on the core value system of the hospital. And when the patient is interacting, his family is interacting with the hospital, they tend to notice the change in the attitude. And that becomes their irritant. So when something goes wrong, that's where the trust deficit starts coming in. So I think if you have to rebuild the trust, you have to do the reversal or backtrack on these things which have happened. So unless we start backtracking on these 3-4 things which are creating that deficit, we will not be rebuilding it. And you're right, Dr. Saab. It is hardly 0.1% of the people who create militancy or terrorism, which creates a bad name for the community. It's hardly point something. Even the medical profession. I ask my salespeople, how many doctors do you really feel are doing this? It's very, very rare. It's very, very rare. But again, it's not the doctor, it's basically the commercial hospital which is creating it. So that's something that we have to address. Thank you.
Thank you, sir. I think, my key takeaway from what you're saying is that, to run an institution, profiting is important so that you can create feasible business models. But profiteering as a motive is something which is not correct. And second thing is that, at the top level, in these institutions, you have to have people who go or have a lot of empathy rather than just a business model. Dr. Urvashi, let me come to you. I mean, government plays a very important role in the success of a healthcare system and a delivery mechanism. There have been a lot of schemes that India has had since independence when related to healthcare. So I'm sure there are a lot of learnings that we've had on the way. What are some of the key learnings do we have that can become the fundamental basics for designing the new schemes that India needs?
Yeah, thank you. I think, one of the major learnings is that we've historically been a very cure-focused health system. Whenever we've spoken about health, we speak straight away about hospitals, we speak about medical doctors, specialists, and of course, you need all of that. But health is so much more than that. And health is so much more about well-being, about absence of disease, as the WHO actually defines it. So there is need for a lot more focus on those preventive and wellness interventions. And of course, some of that now, hopefully, we will see after the pandemic. But I think that's certainly been one of the biggest learnings from our health system, that we need to reorient it, towards health promotion, towards prevention, and not just talk about cure. And in doing so, we also need to look at our entire human resource base. So of course, we need more doctors, we need more specialists, but there are many other cadres of health professionals as well, which are called the sort of allied health professionals, or many others who practice community medicine or family medicine. There's so many other types of health professionals who we need to invest in. And we need to build up those cadres. If you look at some other countries, they have a cadre called nurse practitioners. When you first interface with the health system, it's not a doctor who straight away looks at you. It could be a nurse practitioner who actually looks at you. But in India, our reliance is, solely on the medical doctors and the specialists. And as I said, we need more of them. There's no doubt. But that's not the entire health system. So I think that is one very big learning, that we need to have a public health approach to the health system, in which, of course, secondary and tertiary care fits in, but it's not the only thing. The other is that when we talk of India's health system, it's a highly fragmented, heterogeneous. Most of it are people in the informal sector, and that's actually also comes to the first question you asked, that why do we have these issues with trust, etc. Because most of them are informal providers. They are small establishments, 1 to 2 bedded establishments. So most of your healthcare sector is not organized or formal. So that is very important. How do we actually integrate all these small establishments, all these providers who are anyway providing healthcare to the population? How do you actually, integrate them? How do you train them? Because they are anyway present, especially in the rural and remote areas. So, whether you like it or not, they are there. Now, how best do you actually deal with that situation and that extreme heterogeneity in the health system? So I think that is another learning that we sort of need to build on. And I think lastly, I would say, general awareness about health, because health is a sector with a lot of information asymmetry. So making sure that all the stakeholders are actually educated about it, including patients, including, doctors, families, all the different stakeholders, because some of it is malintent, but some of it is sheer lack of information and, sheer lack of knowledge, just given the nature and the complex nature of the subject. So I think a broader scale, awareness about health and the health sector is also something that we need to really focus on from the government side. Thank you.
Doctor, I need to say one second.
Yeah, I want to just couple of comments. First of all, what Dr. Nath said. One thing I agree with him that the hospital CEOs are, MBAs and young people. They can never understand the patient flow. So if you are hospital headed by a doctor, it does make a difference. Doctor, whosoever bad may be, he still has his sympathy for the patient. Ultimately, we go and fight with these people. No, we have to make concession. So they don't bother about the patients. What happens to him ultimately? They say in the evening how much to balance. So that point is very well taken. So as far as possible, this trend came from US. Everything we are learning bad is come from US. So there also their CEOs are all the business people. They are MBA and this and that. They make doctors run here and there. They are the bosses rather than the doctors. So I think the healthcare system, private or government, it should be doctor-driven. That is important thing. Number one, the deterioration started in India when the consumer doctors are brought under Consumer Protection Act. So many of the investigations, many of the procedures people do just to save their skin. So which happened very wrong in India. You know, we were not that kind of people that we have to protect ourselves. Now, what is happening now is worse. That in a small setup, for example, in a small town, if a patient is serious, the doctor is scared. If this patient, if I give some treatment, if he dies, they will either attack the doctor or they will break the glasses of the nurse. He is not willing to treat because he is scared of his life. So there are multiple factors. The deterioration has it. There was an article in Times of India very last Sunday, the condition of doctors and the healthcare professionals, the way the society is treating us is also dismissed. That I think the people, the politicians, the public has also looked into that matter. Many times, believe me, that many times everything is done right, but patient dies, they create records only that they don't want to pay me. Believe me, this happens almost every other week. And lastly, I want to tell you that the private hospitals are blamed for one thing, that they give a target to doctors. Believe me, no hospital, nobody can give target to the doctor. It is doctor's own, kamzori that he wants. If he wants 10 lakh salary, they have to give it. So it is not. Nobody in my entire lab has told me that how many patients come for your treatment. Nobody can tell me, because if I curtail my greed, they can't tell me. It is the greed of the doctor, where the private sector or the CEOs are blamed. But I think the fault is not with the doctor, not with the CEO. So I blame the doctor if they want more money. So there is nothing wrong in earning money. I always tell the doctor, earn the right way. You should treat the patient properly. Then you should earn money. That's the point. So it's a multifactorial problem. And one thing also I want to tell you, coming to capability of doctors. I have worked in UK, I have worked in USA, I have worked in Middle East, so I have a fairly good idea. Believe me, everywhere the best doctors are Indian doctors. Everywhere. And not only that, there is a published paper from Massachusetts. They followed 50,000 patients from Harvard University. They followed 50,000 patients in that area over 10 years' time. And the result of the trial was that patients treated by foreign medical graduates, out of these foreign medical, 81% were Indian. They had more longevity of life. So this is a documented paper. And I want to tell the people of this country that your doctors are capable. Believe them. Don't have doubt on them. So that fact also needs to be considered.
So I think it's a double-edged sword where the doctor is responsible for the best care, as well as he is responsible for the, if I can use the term, malpractices. So, I mean, that's a very bold statement. Dr. Ajit, if we come to you, we as a nation have come a long way when it comes to innovation and development. We're becoming the hub for medicine production, medical equipment, etc. But one area that we lack in is the R&D. One of the things that come into my mind when you're looking at the lack of R&D is probably because of the number of failures expected when you're developing stuff and the commercial viability of the investment that is being put in. What do you have to say about it?
Very key point you raised. And this was interestingly raised by me, by Joint Secretary DOP today morning to me also. R&D is done by a company at two stages. Either as a startup at the beginning for his first product line, he's going to launch his first product line, or later on when he is already successful and he is going for incremental improvements or revolutionary improvements in the medical devices, he wants to bring it to the field. What you see as very impactful medical interventions, whether from medicine or from devices, usually come from the second one, not from the first one, because money is limited in the first one as a startup. So it's mainly ideas, not products. And to do that, you need money. And and you need time and you need gestation period. Now, in India, for medical devices, we are 80% import dependent. If imports keep on coming in at nil rate of duty or at 5% duty rate or 7.5% duty rate, in most cases, that's the case. The Indian manufacturers find it very difficult with a 15% production depreciability factor to compete against those imports. Plus, the payments come late. The payments were coming late from the government hospitals. Now they also come late from the private hospitals. Excuse being Ayushman Bharat payments coming late, CGHS payments coming late, whatever. But yes, the distributors gets late and the manufacturer gets paid late. When he's struggling to have his cash flows to pay his salaries and doing firefighting for all this, he virtually has got no luxury or a cash pileup for long gestation period R&D projects. That's a reality. So instead of going forward over the last 10 years, I find in many cases we're going backwards. There are very few success stories, very few companies who've, I would say, broken the barrier where they're in a strong position and then they would have the cash pileup available for doing this kind of R&D as an ongoing exercise. That's the challenge point here.
Dr. Urvashi, we have been talking about public-private partnership, and that is the way to create a progress in the field of healthcare. Now, do you think that PPP model can really work in terms of bridging the gap between the need for healthcare that exists in the tier 2, tier 3 cities? And what is your take on it? And do you think that it will really help, but would increase the cost? Because when you look at a private company getting into this business, I'm using consciously the word business because at the end of the day, there needs to be a feasible business model. The cost of delivery will go up, which is what is the balance between getting the private players to enter into this to solve the problem versus trying to keep healthcare affordable and accessible?
Yeah, I think so. There's certain services which I think it's the government's prerogative to provide. And when it comes to public health, I think the government, has to take the onus for that. And that's true anywhere across the world. It's true here as well. So public health, preventive health, and even primary healthcare to a great extent, it is the government which has to provide. And so, you have government mechanisms in place, but we need to make them more effective. We have the health and wellness centers being set up under Ayushman Bharat currently. Again, the thought process there is right that, we'll be looking at non-communicable diseases, we'll be doing screenings, but we need to actually operationalize all that on the ground. That is the challenge. We have a human resource challenge. We have a skill challenge. So the government needs to address all that, but there are certain sectors where the government has to play the biggest role. But in other areas, I think involving the private sector is not a choice, it's essential. And it's an imperative because we have such a large private sector in health that you cannot have the government just working, in a silo on its own and, leaving out this private sector. Like I said, most of India's health sector is actually this private health sector. Now, whether it's informal, whether it's, not organized, but they exist. And so as a government, you cannot really choose to ignore them. You have to find systematic ways of working with them. And I think there's different public-private partnership models that need to be evolved. When it comes to primary healthcare, we're trying to see, if there are certain corporates through, say, corporate social responsibility who can, help operationalize these health and wellness centers, or who can help set up telemedicine at these centers, right? So that's one model of public-private partnership that could work. The other, of course, is actually then setting up hospitals in tier 2, tier 3, cities and towns, as you mentioned. And of course, I think the costing there, is challenging in many places. Ayushman Bharat can certainly help to drive up demand. It has its challenges, but it can help to drive up demand. And we're also looking at how Ayushman Bharat can be potentially in the future expanded to a larger population base. Because in India, what we also have is a very large missing middle. So you have the poor people, but you also have a large middle, population segment which doesn't have access to any health insurance. So they are not exactly poor, but they don't have access to health insurance. So we are looking at how Ayushman Bharat could be expanded to serve that segment as well. So I think the demand, exists in many, many places, but there has to be a partnership to figure out the feasibility and to make it work. And I think addressing the trust deficit between the public and the private sectors is the most important to make these partnerships work. Because I think there's still an inherent trust deficit and a lack of complete understanding of, what is the real strength of the other stakeholder. And where should they be playing in the sector vis-a-vis the other. So I think that and building up that trust is the most important. But I think public-private partnership is the way forward in a country like ours and in a mixed health system like ours.
I completely resonate with you because, it's the challenges. Sometimes we just assume that the private sector is corrupt or they are profiteering from it. It's a big assumption that we make. And we are reacting and responding to that particular statement. So you wanted to say?
I disagree. I think people of this country today have more trust in treatment in private sector. I tell you why. Even the minister, they go to private hospital. They don't go to government. That part is wrong. Anybody who can afford, he goes to private. Why? They trust the system. It is expensive, but the trust is no doubt about it. See, one of the things which this country has lacked from day one, that we never introduced accountability in our system. Whether it's a private sector, whether it's a government sector, there is no accountability. I have seen many government hospitals, there are a lot of equipment lying unused, crores of rupees lying unused, nobody has used it. There should be somebody to ask them why this 10 crore machine is lying there. It's not being used. So ultimately, I think till we bring accountability in our life, in every sphere, that is where I think we fail in this country. Accountability. Go ahead.
Sir, my last question, I see this time is up, screen is there for a while now. But my one last question to you, sir, is since you represent a corporate hospital and you also are one of the most experienced doctors in the country in the field of cardiology, what is your expectation from the government or the private sector that you think will help in not only creating accessible and affordable healthcare, but also help in better outcomes of healthcare delivery?
That's a very, very good question. I always say one thing, that the government of any country should do 2, 3 things only. They should look after the security of the country, defense should be with them, and the policy of the country should be with them. They should not do anything else. They should not be running airline, because it's not their job to run airline. Airline running means that you're doing a business. Government should not do business. Government collects taxes from us. Like 3 areas, for example, healthcare, education, they should spend money on this. They should not waste on other things. Now, when I say in healthcare, government should encourage private sector to develop not only in big cities, but they should also give some kind of concession. If somebody wants to go to second tier 2 cities, small town, they should give some concession in taxes and this and that, so that the private sector reaches there. That's number one. Number two, government jobs to keep some kind of control on pricing and the policy, that how it's government job to check that whether we are doing right thing. So they have to have some checks, but at the same time they should produce a healthy company. That one, like I tell you, in India, the cost of bypass surgery practically has not gone up for the last 15 years. It's same. Why? Because the competition is there. Somebody cannot afford fortis, they go to somewhere else, the fortis has to go down. So it is ultimately the healthy competition which is going to curtail all this.
Want to say something?
Yeah, I'd like just to add over here 2 things. What Dr. Clay mentioned over there very, very rightly. One is regulations. If people cannot follow a voluntary ethical code for themselves, then I think we need to bring in regulatory controls. Dr. Clare mentioned audits. That becomes a part of the whole exercise. So when you say regulations, it needs to be the modern regulations, which are audit based, which should be decriminalized, not treat a businessman or a doctor as a criminal for any small offense. But yes, they seek progressive improvements and keep people on their toes. The second area where the government can help is if the government has done a public-private partnership for any scheme, they should honor their terms. In most cases, we find the payments are not made. They are months and months delayed by whether state government or central government. In the beginning, it's with a great fanfare. A lot of cash is available in the beginning. Later on, it just disappears. And then they expect the private healthcare sector to fend for itself, which it cannot. If they want the private healthcare to come forward and share the burden and make it affordable, कि अमीर आदमी से 1000 ले लोगे, middle class से 500 लगे, गरीब आदमी से 100 रुपए से काम चलाओगे, then that 100 rupees has to be made available to him. He cannot give it from his pocket. Or he can't take it from the 1000 rupee person and snatch it and give it to the 100 rupee person. And that's the reality which I think the government is missing out on.
Thank you so much. I think, my key takeaway from this session is that, while we have come a long way in providing quality healthcare, making it affordable, there is still a lot of things that need to be done. And I think the public-private partnership is the way to go. But like Sir said, that, there's a lot of accountability that needs to be created, and government needs to take over that role of monitoring and regulating to ensure that the malpractices can be reduced to a very large extent. With that, I'll come to an end of the session. Is there, I think there, yes, sir.
Thank you very much. Dr. Clare, you made a very loaded statement that the politicians have trust in private sector. We'll on a different occasion, we'll talk about it. I don't want to get into argument at this point in time. It's a very loaded statement. Number two, I also want to put my appreciation for medical audit. I want to know from you, Dr. Clare, as of today, how many hospitals are undertaking medical audit? That should be in public domain. Sorry?
There are two kinds of auditing. One is the internal auditing, another is external auditing. I don't believe in internal auditing because if my hospital is doing my auditing, they will not blame me if I do anything wrong. So it has to be external auditing. In US, for example, the insurance company keep a tab on everything. For example, if a doctor and he does angiography, but if it's 30% angiographies are normal, they will come to him. The average national figure should be 10%. Why you are normal or 30%? That means you're doing more. So there are checks and balances, and auditing, the purpose of auditing is only to bring, to the book, the offender, they should be scared of this. There's some control should be there. In India, there's no control. If I say you need bypass surgery, you need bypass. There's nobody to question me. So there should be somebody to question why I am advising bypass surgery on medical.
My third point is, doctors on an average don't have time to listen. A study has been done where on an average, doctor spends 2 minutes. Dr. Girish Krishnamurthy, in Tata Horizon, I've written an article about doctors should learn to listen. 90% of your diagnosis is made based on history. 5% by clinical examination, 3% by routine tests, and 2% by the high-end tests. My important communication and message in this, I want to give in this forum, that please take time to listen to what patients have to say. That's number 3. Number 4, Urvashi Madam.
Before you go further, I would like to say that this is the most relevant point. Most relevant point is that doctor must listen to the patient, and I totally 130% agree with you. I tell you that many times patients will come and tell me when they are talking to me, sir, your time is limited, so I want to be brief. I said, no, my time is not limited. You tell me whatever you want to tell me. I agree with you, doctor. This is, what has happened over the years that we have forgotten the basics of medicine. The basic of medicine is that most of the diagnosis you make by history. But I think that we have to go back to the medical school, our curriculum to tell the medical colleges, they train the doctors, they should be taught in this way that they have to listen. I totally agree on this.
Dr. Urashi, I want to add to your question about health. Now, there is a new concept of wellness. The traditional definition of health is a state of physical, mental, social being, and automatic disease or affirmity. There are 8 dimensions of health: 8: physical, mental, social, emotional, spiritual, environmental, and occupational economic. That we have to bring it to the stage to look at the holistic dimension of. I've also written an article on this as well. My final question is, there is a pandemic of second opinion. Pandemic of second. What do you do about it?
I think the second opinion has started only because of lack of trust. And believe me, that in our country, it's a good idea. Whenever you are in doubt, take a second opinion. I don't disagree with that. Why one has to take a second opinion? Because he doesn't have a trust or he's not convinced, but line of treatment has been recommended to the person. So many times we see such a difference of opinion between the specialists. So I think second opinion in an independent country should be allowed.
Thank you very much, sir, for the opportunity. Thank you.
So thank you so much for asking these questions, and thank you all of you for taking out time to be with us. I know you are all busy people. You're all busy people and leaving OPD and hospital patients. I really appreciate your coming out all this way. Thank you so much, ma'am.
Thank you. Thank you so much to all our panelists and session chair. No, I also have to inform everybody. I think it's a really proud moment that he's with us. So Dr. Claire and his better half, they are the only Padma awardee doctor couples of the country. So I think that deserves a big round of applause. And with that, we come to an end of the conference. Thank you so much, everybody, for being such a lively yet so quiet audience. And we would request you to join us for tea and coffee on my right. That's the hall left. Also, we request all of you to please vacate this hall by 5:30 p.m. because we have to change the seating layout according to the minister's security protocol. And all the ones who are wearing the white band, all the attendees, we request you to join us here sharp at 6 p.m. for the second half of the evening. And all the ones with the yellow bands, thank you so much for being with us. We would request you to join us for the same virtually. The evening session will be streaming live on all our social media platforms, including BW Business Worlds and Heal Foundations, and on www.bwhealthcare.com. My name is Aditya Malik. It's been a pleasure to be your host. Thank you so much, everybody.
हो रहे हैं। इस कड़ी में अगर देश के डॉक्टर्स के योगदानों की बात न करें तो ये महोत्सव अधूरा लगेगा। इसी को ध्यान में रखकर हमने पद्म पुरस्कार से सम्मानित डॉक्टर्स के योगदानों को याद करने के लिए
of India conferred on him Padma Shri in 2016. His papers and articles in 2018 pioneered the development of indigenous low-cost coronary stents that have benefited several thousand patients. The government The government of India conferred on him Padma Vibhushan in 2009, Padma Bhushan in 2003, and Padma Shri in 1993. Dr. Ganesh Kumar Mani is the chairman of Cardiothoracic Vascular Surgery at Max Smart Super Specialty Hospital, Saket City Hospital, New Delhi. He is a cardiothoracic and vascular surgeon reported to have performed over 20,500 coronary artery bypass surgeries. The government of India conferred on him Padma Shri in 2013. Dr. Ashok Seth, Hepatobiliary Sciences, is credited
आजादी के 75 मेडिसिन के
Hi, everybody. I would kindly request all the attendees to vacate the hall now. And can we please stop the tea coffee serving now? We need to set the hall for the evening. I would request all the attendees, only Business World team and Heal Foundation team to remain inside. We need to vacate the hall for setting it up for the minister in the evening. We look forward to all the evening attendees to be here with today. And all the conference attendees, thank you. Hope you enjoyed your tea coffee. Please watch us live in the evening on all our platforms. Thank you so much. One last time, I would request everybody to vacate the hall and all the Padma doctors that we have with us today. Thank you for gracing us. And your tea and coffee is being served outside in the VIP lounge. So if you could also head there so that we can use the empty hall to set it up for the minister. Thank you so much. Hi, one more time, I would request everybody except for our esteemed Padma doctors and the Business World and Heal Foundation teams to vacate the halls. We need to vacate it for resetting. We will open the hall back again in 15-20 minutes when we start. I would request the Business World team and Heal Foundation team to start getting everybody to vacate the hall, please. Thank you so much. Hi, I would request everyone to allow our esteemed Padma doctors and their spouses and the media people to enter in the enclosed area and be seated. We will be starting the program shortly in about 5 minutes or so. Would request everybody else to be seated. We are still expanding the seating, so that shall take about 5 minutes. Thank you.
Good evening, everyone. Good evening. Myself, Dr. Swadeep Srivastav from HEAL Foundation. I welcome all the dignitaries today, especially all the Padma doctors and their spouses. I would request everyone, Dr. Anurag Batra, to please be seated. I request Tanvi to please get the gate closed so that we can start the program formally. Thank you again. Thank you. Our sincere gratitude. You all today took out time and came all the way to be amongst us. We'll start the program formally with a panel discussion on health for all, followed by the Union Minister of Health and Family Welfare, who will be arriving soon, and the Minister of State for Health, Dr. Bharti Pawar, also joining him very soon. So then we'll start the Padma program, Padma Doctors program formally. So I would request the MC, please.
Good evening, ladies and gentlemen. My name is Aditya Malik, and it's an honor and a privilege to welcome you all to the Padma Doctors Congregation organized by BW Business World in association with BW Healthcare World and HEAL Foundation. This is an evening to celebrate the knowledge, passion, and courage of the harbingers of healthcare in India. We are honored to have amongst us the policy makers and stalwarts of the Indian healthcare system. BW Healthcare World's mission is to bring forth the news and trends in the healthcare sector and spark discussion with the leaders, influencers, and experts from the industry to share insights with our audience. May I please request my team to play the BW Healthcare Community AV to give our audience members a glimpse of the same. HEAL Foundation, founded by Dr. Swadeep Srivastav, is an advocacy group that works towards capacity building of health writers and engage important stakeholders of healthcare industry to brainstorm and design ideas for continuous improvement in the healthcare space. Before I move forward with today's proceedings, I would like to take this moment to thank our partners for today. Our associate partners, Tata MD, Beatrice, AliveCore India, India Health Link, Medica Bazaar, and a knowledge partner, NatHealth, Healthcare Federation of India. May I please request my team to now play our partners' AV. Today's digital broadcast is being streamed live across all BW Business World and HEAL Foundation platforms, including BW Business World social media channels and on www.bwhealthcareworld.com. Well, as we flag off today's event, we encourage everybody to join in the evening celebration and share their thoughts and learnings using the hashtag Bharat Swasth Mahotsav. And now, to begin with today's August event, we have a special panel discussion on achieving health for all, learning from Padma doctors. For this, ladies and gentlemen, please join me in welcoming our extreme and expert panelists for the same. Dr. Balram Bhargava, former DG ICMR, Dr. Professor Anup Mishra, Chairman, Fortis CDOC, Dr. Arvind Lal, Chairman, Lal's Path Lab, Mr. Girish Krishnamurthy, MD and CEO, Tata Medical and Diagnostics, Dr. Randeep Guleria, Director, AIIMS, New Delhi, Dr. Ravi Shankar, Medical Affairs, Viatris, Dr. Anurag Batra, Chairman and Editor-in-Chief of BW Business World and founder, Exchange for Media Group. And the session will be moderated by Mr. Harbinder Narula, CEO, BW Healthcare World and BW Wellbeing World. Let's collectively, with a very warm applause, ladies and gentlemen, welcome all our panelists. Thank you. Thank you so much.
Thank you, Aditya. You know, what a panel. This is a proud moment for all of us sitting here to celebrate a journey that we have seen in the last 75 years. And each one of you, the Padma doctors, have contributed in making healthcare affordable and helping India become the destination for not just affordable, but quality healthcare. So thank you so much. And welcome to every panelist sitting here, Dr. Lal, Dr. Guleria. My first question, I'm going to begin with Dr. Guleria. So what, as per you, is health for all?
Health for all is holistic health, which includes health irrespective of your socioeconomic status, caste, creed, religion, or the place that you belong to, urban or rural India, where it does not make you spend too much out of your pocket, doesn't lead to a huge out-of-pocket expenditure, and which provides quality care, which is holistic. When I'm talking of holistic, it means it's looking at preventive and curative health, both. And it is also looking at health, which could also encompass alternate treatment strategies which are available in our as part of our Indian heritage.
Got it. After getting this perspective from someone who is a doctor, medical doctor, let me come to you, Dr. Anurag Batra. As someone who's a non-medico, what does healthcare mean to you? How do you think it is important in today's day and age?
You know, I'm not an expert on healthcare. I'm definitely a student of lot of contemporary things that impact us. Healthcare clearly in the last 27, 28 months is bigger focus than it ever was. Dr. Lal, Dr. Gularia can focus on. But I must say that over the next 2 to 3 years, first, the expenditure on public health has to go up multiple times. The government has been talking about it for a long time. The expenditure on public health needs to grow up multiple times. Second, I want to say that technology is changing healthcare. Telehealth has been around for a long time, but the last 27 months, telehealth became more acceptable, both from the doctor side and the patient side. And there were business models. Third, Amazon in the world, Amazon Care has acquired physical hospital healthcare delivery facilities. That tells you that healthcare is underserved in the US. Clearly, while in India we talk about what we need to do, we have a long way to go, but our healthcare is still world class. And the medical tourism is one manifestation and validation of it. Fourth, I genuinely believe, and I wrote this, I don't write till I really get spiked about something. I've written one column this year and two columns last year, and I write my editorial note. But last year, when India achieved 1 billion vaccinations, the New York Times or CNN, I'm not sure. I think CNN ran an article. The headline said, India achieves 1 billion vaccinations, but millions go without a first dose. And it really, I got upset and I wrote a 2,500 piece, basically saying that Indian healthcare strengths are not amplified or talked about. Yes, there were things that could have been better during the second onslaught of COVID. There were things that could have been better. But the fact is, our doctors are more humane. Our healthcare delivery providers are more humane. And we did save a lot of lives. I will not go into vaccine method. Last point I want to make. I am a PhD doctor, sir. I have permanent damage. I don't have medical knowledge. But I went to an engineering school, then I went to a business school. I got in when the quality control was bad. I'm from the first batch. But in IT services, the reason we've been able to build what we built in terms of large companies and large impact is because we made IT education wider. We opened a lot of IT schools, more engineering graduates came out. From the last 2 decades, I've been hearing Dr. Lal on our forums, other Dr. Devi Shetty on our forums, that the number of healthcare practitioners need to go up. The number of healthcare support ecosystem, technical trained manpower needs up. So if that happens, I think we will be able to build on the work that all these leaders in the healthcare and healers have done. And technology, today AliveCore is a sponsor, there are other sponsors, but technology is working towards predictive healthcare. I think a lot more work needs to be done in that and make it affordable and accessible. I'll stop here, but I just want to say that we have a long way to go in healthcare. I would expect the government to be able to, like it announced Ayushman Bharat and did a lot of work, but there's a lot of work left to be done in healthcare. And I'm sure the next level of intervention from the government in terms of policy, especially in terms of more medical professionals being allowed, you understand the dynamics and the play there, will really help the healthcare unlock. Investments is not an issue, but we have to look at healthcare as a service, because if we can't save our people when we have an issue, in spite of the best intent of everyone and the kind of leaders we have, that means we need to look at healthcare as an investment into our human capital and not an ROI for businesses.
Before we move ahead, I'd like also to invite Dr. Vaidya Kutecha to please join us on the dais. Dr. Vaidya Kutecha.
Mr. Narula, this is a manel. This is a male panel. It doesn't look like a panel. It's a manel.
I agree with you. I think please, sir. Dr. Balram Bhargav, sir, my question to you is there a framework that the government has set up for ensuring healthcare that becomes accessible by everyone? And when I'm talking about making it accessible, it is accessible and even affordable.
Yes, first of all, congratulations for organizing this event. It's always aspirational and people will talk about all the things that are possible. Having said that, I think the Indian healthcare is not glorified enough. In the last 75 years, the work that has been done by Indian healthcare, whether it be generic drugs, whether it be vaccines, whether it be human resources, whether it be training, whether it be medical colleges, postgraduate training, whether it be ASHA workers being honored by the WHO, a lot has been done, but nothing has been glorified in a big way like IT or mobile has been, or Bollywood or cricket has been. I think healthcare needs to be on the forefront and be glorified in a big way. That is point number one. The important thing is that there is a framework for preventive healthcare, promotive healthcare. The current dispensation is trying to bridge the requirements which were mentioned by my previous speaker in terms of the numbers of doctors, numbers of nurses, numbers of medical colleges at a rapid pace. Important to remember that quality has to be maintained. So we are at this moment having 100,000 doctors per year, and mind it, it's about 2.86 lakhs in China. So we're not competing with China, but we need to get our act together if we want heal in India and heal by India. We have about 120,000 health and wellness centers which are there, but and are being set up. 150 is the target. With that pyramid of health and wellness centers, district hospitals, primary hospitals, community health centers, medical colleges, all India institutes, and tertiary care centers, I think that framework is there. The question arises about the budget. Yes, the budget was mentioned. We are reaching a target of about 2.5% healthcare spending, which was about 60,000 crores last year, is now 220,000 crores this year, with mother and child care, water sanitation, and healthcare combined. So it has gone 3 times, but again, mother and child hasn't been included. Water sanitation has been included. So the budget is there. Yet we are very far away from what we are aspiring to be. I do not know whether we want to be a socialist health system or we want to be a mix and match of social and public health system. But the point that has been made, that the empathy and I think the human touch is still there, and I think that should be nurtured in every which way. If you look at the budget that is there in the USA, is 19% of a $19 trillion economy, which is bigger than India's economy, is being spent on healthcare, yet about 60% of the people get healthcare. It's about 10% in UK, 10% in UK, 6% in China. We are 1.5 expanding to 2.5. We are getting the capacity to expand it, but I think that is a gradual process. But I think the train is on the right track and it is moving with speed. And hopefully this will become the central theme of the national agenda, health.
Dr. Lal, they say that change is the only constant, and in the but the change needs to be triggered. You are the one who triggered that change for the diagnostic industry. You are the one who corporatized diagnostics in India. What, according to you, has happened in the 75 years, whether it is technology, whether it is accessibility, in the quality of outcome of the analysis of the diagnostics? How has diagnostics evolved in the last 75 years? What's been the journey?
So thanks for asking me this question. And the first thing which I would like to emphasize is that now medicine has become more evidence-oriented, evidence-based, as compared to, what we used to call gunshot medicine, that if it is a case of fever, you would just, codeine and you give cough syrup and give something else, etc., chloromycin, etc. So the point I'm trying to make is that 70% of your clinical decisions are based on, lab tests. And that has to be recognized by everybody. And therefore, the importance of diagnostics. Having said that, diagnostics have come a very long way. And I would like to emphasize that in 2000, maybe it was 2000 only, it was the pathology labs in India first, which got accredited by NABL, and the hospital's accreditation came 6 years later, not 6 months later. So there is something right which we did in pathology industry, and therefore the results which we tell our patients that you can get the test done from us and so many other laboratories. I saw Mr. Sanjeev Vashishta sitting here from SRL and many more, that our reports will match those of any lab in London or New York or Los Angeles. And this has not happened just because we wished it, because we worked very hard at it. And we brought quality into the lab services in India, which has stood us in good stead. Having said that, there's a lot of many kilometers to be covered so far. And I'll give you an example now. So now in India, we have about 300,000 labs.
And this is, I believe this figure because 20 years back it was 1 lakh, and this is Indian Express figure, by the way. Now, out of these 3 lakh labs, well, most of them are, not in the organized sector. They are run by people who should not be running labs, whom you call quacks, and we have no control over the quality. So taking a firm step towards doing something about them, I firmly believe that the government of India should now, pay heed to the Central Establishments Act Bill, CEA as we call it. And that defines, who can run a hospital, who can run an IVF center, who can run an ophthalmology clinic, and similarly about labs. So who can run a lab? And as per the Supreme Court order, it's a judgment, each lab report has to be signed by at least an MBBS qualified doctor. So that is point number one. Point number two is that in 3 lakh labs, we have only 7,000 pathologists in India. So obviously, so many of them are being run by whatever means. Let's not go into that. So to get a handle on the quality of these labs, if the Central Establishment or Clinical Establishment Act is implemented, seriously, I can assure you 50% of these labs, will die down. And the other 50% lab, like 150,000 more, well, then we can get into the act. Right now we have only NABL, who's the accrediting agency. And mind you, the risk of, my friends are working in the government, that private labs are accredited, but not many government labs are accredited. So this has to be a common kind of a playing field. So then, you can have an NABL like an organization like they have in America. It's known as College of American Pathologists. So for example, if I was a pathologist working in America and my, other people, we would be invited to go to a lab, inspect them, give them an accreditation and come back, and we don't get paid at all. They just pay for, going and coming and staying, etc. But so what I'm saying is it is possible. So we can have another or 1 or 2 accrediting agencies, and these 150,000 labs which would be left can be accredited in a given frame of time, say 3 years, 5 years, whatever. So I'm quite confident if certain steps like these were taken, the quality of pathology testing would go up, by leaps and bounds in India. I think I'll stop at that.
Thank you so much, Dr. Lal. Dr. Vaidya, apart from healthcare, we have a very strong heritage. And as a part of our heritage, we have medication systems which are age old. How are these keeping pace in today's day and age? How are they still being maintained as relevant to the patients?
Actually, this is a wonderful question, and I am in Government of India Ministry of Health since 5 years. So in 5 years, I have seen a lot of changes. So for example, since 2014 to 2020, in 7 years, this sector of traditional medicine grew by 6 times. So in 7 years, it grew by 6 times. It itself, is a kind of a testimony how much is the demand. The another thing is that I would like to cite an example which was published in Journal of Internal Research, that we did a kind of impact assessment of Ayush intervention into COVID with the sample size of 1.47 crore. So it's like about 1% of the total population. We found that 89%, 89.9 to be precise, people have acknowledged that they have used some of the other Ayush intervention, maybe yoga or maybe any other thing, for the prophylaxis or treatment of COVID. This is another example. So what I'm trying to convey is that there is a huge, huge undercurrent at the ground that we usually don't acknowledge. We don't know. There is huge undercurrent. This is first thing. Second thing is that our health system in India is very unique. It's like pluralistic healthcare delivery system where integrative health or cafeteria approach health is available. So, for example, 26,000 health facilities in India have Ayush co-location doctors available. So it's a huge, and there is a National Ayush Mission and National Health Mission working together for public health delivery. Dr. Balram Bhargav ji mentioned about the evidence-based medicine. Dr. Lal also mentioned about evidence-based medicine. It was, a standard, kind of statement that Ayush system do not have the evidences. But I would like to mention that there is a portal, Ayush research portal, where there are 33,000 publications posted in a searchable format, which are all published into peer-reviewed journals or index journals. So it's not that there are no researches being done. One more thing I want to mention, that first time in the history of the UN, WHO has decided to establish a global center for traditional medicine in India. And why it is special? That it is first of a UN outpost which is being established outside of developed countries. This is in developing country. First time it is happening. So it shows that how much importance is being given to the traditional medicine worldwide, and WHO is also acknowledging that. Before I finish, I would like to cite a couple of examples about evidence-based medicine. That during COVID times, with the help of all ICMR, AIMS, and other scientists of the country, Ayush sector has initiated more than 160 studies of different designs, right from preclinical to multi-center trials to prophylaxis to observation studies to so many studies. Out of those studies, there are a lot of publications now came out, more than 50 publications. Couple of studies I want to cite. One is about the Ayush 64, which is just published last month in Journal of Public Health, which is a very high impact factor journal. And it was a study of 65,000 people who have been given Ayush 64 on home isolation patient as an add-on therapeutics for 3 weeks. They were followed for 3 weeks. And what we found is very interesting, that it was during second wave where 10% of hospitalization were common. That out of whoever got COVID, 10% would go to hospital. So all of those home isolated patients, out of 65,000 patients, only 300 required hospitalization. And out of these 300 also, nobody died. So out of 65,000 patients who have been given additional Ayush 64, nobody died. So this is one example. Another example is about our work with Delhi Police, where we have given 60,000 odd Delhi Police people as prophylaxis intervention from Ayush, and they were followed. And then it was studied very rigorously with the DSMB on boarded and with the proper review mechanism. It is also published in the same journal, and it says that the Delhi Police personnel have less mortality, less infection rate as compared to the Delhi population or the police personnel of the rest of the country. So those are the examples that Ayush has a lot of potential. What our country needs is that we need to look at this possibility, is not only providing our country people the better solution of integrative healthcare, but providing the benchmark model for the rest of the world, and also convert it into commerce, because at least 35 to 40% people who is coming to our country for medical travel is for the Ayush. So that's a huge potential. Thank you.
Got it. Thank you so much, sir. Let me come to you, Mr. Girish Krishnamurthy. We have seen diagnostics, we've learned about the traditional medicine and the role it is playing, but health for all cannot be complete if the technology is not keeping pace with the times. What is your view on how and what role the technology is playing?
Thank you. See, let me put in a perspective that how technology can come for a major enabler for health for all. See, we spoke about number of doctors, number of nurses, number of hospitals, infrastructure, clinic. It's all necessary. But in India, we kind of say for every 1,800 people, we have one doctor. But if you just go on demystify that number, you will get an answer. It is 1:1,800 probably in Delhi or Mumbai or Chennai or some of the big cities in the country. As you start moving a little far to the rural India, it increases by many-fold. So this is the first problem we have in terms of availability and access. Now, if you go a little further and start dissecting that, and by specialization, for example, mental health. maybe it will change into 1:5 lakhs. So this is the kind of challenge we have. Now, if you look at it in a manner to create infrastructure, process, human resources, it's going to take a long time, no matter whatever. And even if you increase the 2.5% to 10%, still you cannot achieve it. It is not a question of money. It's a question of multiple things you have to do at the simultaneously. Now, we did an experiment. I'll just give you how technology can play a role on an important point. In oncology alone, we did an experiment of following about 1,800 oncologists in the country and look at what they do and where they spend time. About 52% of the time they spend in non-clinical activity. Be it AIMS, be it in regional cancer center, or be it in a private hospital, wherever you go, the health science processes has developed over a period of 100 years and developed predominantly the protocol, care pathways, methodologies, everything from the health science perspective, predominantly driven from the Western world. So it has gone into a scenario where it is really. So now that 52% or about 35% of the time they spend only on administrative activity. If you just take and if you give the job to somebody else and use the technology for it, then you unleash a huge amount of value out of this. This model we call as, we developed this, fortunately we had an opportunity to work in all India Institute of Medical Science. And we worked in several large hospitals in the country and several public health systems at a district level. And when we experimented this, we came up with this model to create a bridge, digital bridge between the access and the demand, which has shown a phenomenal result. So my view is that technology today, last 25, 30 years, if you look at it in healthcare specific, the technology and an innovation came into healthcare, which always assumes when a patient is with a doctor. A patient is with a doctor in a clinic or in a ward or in a procedure room or in an operation theater. But if you take a patient who is admitted in a tertiary care hospital, how many minutes or how many hours a doctor spends time with? But the majority of activity is how to, 2/3 of the world struggles how to get a patient to the right facility, to a right doctor. So the technology intervention in that area creates a significant role. And the way we unleash the capacity and look at the processes which is required, of course, we make an assumption by just bringing a telemedicine healthcare is technology. Bringing a doctor in a video call cannot be a new technology, which is there forever. And if this problem can be solved, we would have solved it. And then we talk about data in technology. We make an assumption like any other industry, whether it's a banking, financial services, retail. We make an assumption if you bring data together like any other industry in a cloud platform or together, then we solve the healthcare problem. But healthcare is a very different. It's a very context sensitive. 5 minutes before your BP is no longer valid. So you got to be very careful what data you present. And Dr. Lal mentioned about, evidence-based. Now the evidence-based today, for everything we create evidence, but the whole evidence is in disparate. And it is all available in a different format. So the technology to bring together these evidences plays a very important role. And healthcare is one area where the data, which is highly unstructured, doctor communicating a patient, writing a prescription, and for a same disease, same prognosis, same diagnosis, there are multiple different methods to treat, multiple way of thinking through. Now, all of this to bring it in a standardized model where the technology comes to play a role. And I believe it is a very fortunate scenario. India is in a stage where we are a leader in technology and we have the biggest problem of healthcare. And third is we wanted to do it smartly with always like how we did in aerospace and other areas. We also have a smart people like several of our health physicians and doctors we can figure it out to efficiently build a health system. And technology is going to play a pivotal role. By using technology, I'm very optimistic. 10 years from now, probably our healthcare is the best we can deliver because all of us know Western world and other of them are terribly failed in delivering healthcare for all. So the health for all with the technology is the mantra I feel will happen in the next 10 years.
Thank you so much, Mr. Girish Krishnamurthy. We've faced a lot of challenges in healthcare over a period of time. There are various challenges in terms of the diseases and the conditions that you've gone through. So my next question to you is, Dr. Ravi Shankar, TB has been a huge burden on the Indian healthcare system. How well are we poised to eradicate TB, and what could be the role of public-private partnership in this?
So if you look at infectious disease, not just tuberculosis, if you have to eradicate any infectious disease, three things are important. One, diagnosis. We have to diagnose the disease. We have to screen the patients, ensure the diagnosis is appropriate. Second, treatment. We have to ensure that the patients who are infected are treated well so that they don't spread the disease to others. And the third part is prevention. Only if you have effective preventive strategy, we'll be able to eradicate a disease. We have not seen any disease, any infectious disease which have been eradicated without an effective preventive strategy. Now, if you look at how are we poised towards this, in the recent past, a lot of progress has happened. So let's go by step in terms of diagnosis. Now, if you look at tuberculosis as an example, microscopy and chest X-ray plays a pivotal role in screening and initial diagnosis of TB. Now, there are X-ray machines available, even in the periphery in India. The problem was radiologists. We did not have radiologists to screen through these X-ray films and help in diagnosis of tuberculosis, or to stage, to see the severity of the tuberculosis. Now there are AI applications available. Now we have a digital X-ray, we put in the machine, now AI tools will compare against the background X-ray films and then let us know the diagnosis. Even in automations are bringing in microscopy as well. So there are automations to have a smear in place, to look at acid fast specimen through AI intelligence. Now in terms of confirmatory and even in resistance testing, now in recent past, there are molecular diagnostic tests that are available even in the remote places. So a physician can do not only the confirmatory test, but also know the resistance pattern and treat the patients appropriately. In terms of treatment, a lot have changed in the last 5 years. Now we have oral drugs available even to manage drug-resistant tuberculosis, whether it is multi-drug resistant tuberculosis or extensively drug-resistant tuberculosis. What used to be an 18 to 24-month treatment with injectable with so much of toxicity, now we are able to manage these patients with 6 to 9 months of oral treatment. So we are bringing down considerably the duration of treatment, and we are making regimen more simpler, without injectables, more safer. So it is helping physicians to manage these patients better. And cure rates have gone up multifold with these newer drugs that have been launched. Now, there is also a robust prevention strategies that are in place for the close contacts. So close contact screening is happening, and now close contacts are also being managed very well. Now, with this, I would say that we are progressing very well, and definitely we should be nearing the eradication very soon. In terms of public-private partnership, this has been going on very well in tuberculosis since last many years. Now let's go with again diagnosis treatment pattern. In diagnosis, many organizations, including us, have been very closely working with program to build the capacity or on-ground presence to boost diagnosis, whether it is door-to-door screening with risk questionnaire, identifying the risk population, and sending the samples for screening, identification of the disease. Those who are diagnosed, linking them to care, which is most important, and making the patient aware about the disease is also important. So patient education comes into picture. And this is what a private partner can very well do along with the collaboration with the government. Educating the patients, making them understand about the disease, what happens if they don't take the treatment, and also ensure that they go back to the center once in a month to collect the tablets, ensure that the compliance is maintained. The other part is healthcare providers. The constant upgradation is needed because again, TB is evolving, the treatment paradigm is changing. So how can we build the capability within the doctors in the periphery to manage disease also play a role? If you look at the treatment part, Now, the newer drugs have been made available in a controlled setting for the right reasons because of resistance. Now, here again, private and government hospitals can come together. A center of excellence can be created in the private hospitals, and the private hospitals can also start treating these XDR-TB with these newer novel drugs that are available for managing the disease. Lastly, in terms of innovation, again, government and private can come together very well, and it's happening very well, whether in terms of developing homegrown technologies that we are seeing in TB. There are many homegrown solutions that are out there, or bringing in technology transfer from the global organizations to India and creating India as a hub for Make in India would definitely help in scaling to our needs and meet our strategic goal of achieving eradication of tuberculosis.
Thank you so much. Dr. Anup Mishra, thank you so much for joining us. Dr. Mishra, prevention is the new buzzword. And especially after pandemic, we've seen that, people are a little conscious and mindful, and they're taking care of the body in a preventive manner. The second thing is personalized healthcare. What do you think where we are headed and how are we making this a reality?
Thank you. I apologize for joining late. See, since I was in All India Institute of Medical Sciences and now in the corporate sector, one thing I've understood very well, wherever we are reaching as far as the non-communicable diseases is concerned, whether it's diabetes, whether it's hypertension, coronary artery disease, non-alcoholic fatty liver disease, and things like that. Everywhere begins long time back. It is not something which has grown overnight. And so something which begins in the teen years or maybe early 20s. And we have done a number of studies regarding this in the schools, and we published widely. And the watershed period where it begins is around 10 years of age and then subsequently. So we have to prevent these things from happening right from that time on. So prevention starts in the childhood, actually. It's not adulthood. By the time the things are already in motion, and we'll have so much more difficulty in reversing that juggernaut which has started back into the normalized state. So that's what we have been saying, that we must concentrate on school children. We must concentrate on their nutrition, their habits. By the time they are 14 or 15, the habits are well set. So just a couple of years and they are well set into the non-communicable diseases. And we have seen and we have published that around 20 are the lipids, the triglyceride and HDL cholesterol start to go wrong around 20 years. That's a forewarning that things are going to go wrong. And then subsequently blood pressure and sugars in 25 and 30. We are seeing a patient with type 2 diabetes in the teenage years nowadays. So our money should lie in the prevention in the schools, and the government of India, I was part of it, started a program for the school children, and I think it's going on, but I think we need much more vigor and much more force to force that change, which is as yet not happening. The second part of that is the primary health centers, because the moment a person becomes ill, he comes to the primary health center in the villages, in the rural areas, and there is where, again, the prevention lies. The primary health center or mohalla clinic or these initial clinics. That's where the thing. That's where we have a problem in the resources also, because we don't have much of a resources, people who are trained into nutrition and so on. As far as personalized nutrition and personalized health is concerned, that comes much later. And things have been set in motion, and I have a certain disease, I want to reverse it. Then I go for a personalized nutrition program, a low-calorie diet, a high intensity exercise program, maybe some drugs. And that's where the work of a doctor and nutritionist comes in. But before that is the work of the public health specialist. I think public health specialist should be the backbone for prevention of non-communicable diseases in India.
Thank you so much, sir. So we've touched upon diagnostics, we've touched upon healthcare, technology, company, government policies, and traditional medicine. But healthcare cannot become a reality until and unless we have awareness that is created. Dr. Batra, I would like to ask you that what is the role of responsible media that plays a impactful role in creating a better aware society that leads to a healthier nation?
First of all, I'll answer that and I'll give a specific answer. That's an area I have some understanding. But I want to ask Mr. Lal, I was reading this book by Anthony Robbins called Life Force. And he has interviewed the world's top 20, according to him, scientists, thought leaders, practitioners. He primarily is talking to them about longevity of life, reversal of diseases, fixing of diseases, genome surgery. He and Peter Diamandis have done it. And he alludes to in one of the chapters, I don't remember, that tomorrow there is no need for blood to be drawn to. Tomorrow doesn't mean like 10 years from, in the very near future. For blood to be drawn to be able to diagnose what the medical issue is. What are, you're an entrepreneur, of course you're a healthcare leader, but what are people like you thinking about the future where there's no blood being drawn out of a human being to be able to predict? And 10 years back, there was a company called Theranos, which turned out to be such a hoax. Not only a hoax, it turned out to be a fraud. So clearly she was working towards the affordable. So what is your prediction in terms of when will it happen in India where we don't have to put something in the body to be able to take out blood and predict?
Thank you, Mr. Batra. It's a slightly complex question. So to answer your question head on, even today, Dr. Anup Mishra, Dr. Guleria would know that we have got sensors which can be put inside the body. They are monitoring blood sugar and also releasing insulin as and when, the blood sugar goes up and down. So that's one. Now, as far as Theranos is concerned, this was, a company, for those people who have not heard, that this was started by a 19-year-old dropout of Stanford University by the name of Elizabeth Holmes, who claimed that she would, from a drop of blood, she would be able to carry out practically all the tests which we carry out. So cutting a long story short, it turned out to be a hoax. She tried her level best, and there is a court case against her, etc., etc. So testing without blood, I can tell you that I've read reports that in MIT-based medical doctor had perfected a hemoglobin testing device which could take the hemoglobin without puncturing the skin. So right from, if like you put for a biometric analysis, you just put it and the hemoglobin could be done. And this, he said, he invented it because his mother was a gynecologist, and during pregnancy, the lady's hemoglobin would sometimes come down to 2 grams, which would unrecordable kind of a thing. So that is how, but it was not found to be, very practical, because if you have, very cold climate, you have very hot climate, you have perspiration, etc. So these things don't work. What I'm trying to tell you, that blood testing and the labs are going to be there for some time. So that I can tell you very confidently. But having said that, I think the time has come for us. The labs are getting smaller and smaller. Now, lab on a chip is a concept which has been talked about. There are people working in India also, but we haven't seen really one in which, you can put a lab in your pocket and go to the rural area and put a drop of blood. Well, for those of you who are scientifically oriented, there's going to be a microprocessor there. There's going to be fluidics. There will be pumps, nanotechnology, and God knows what all, I'm missing, magnetic something, etc., etc. So these things are being worked upon, and I look forward to the time when people like us, we have 5,000 collection centers, I can turn each one of those collection centers into a lab. If I have a lab on a chip, in my pocket, but that will have to wait. So right now, what I'm saying is that this is a time for the government and the private sector to come together. And we have two stalwarts here, which I'm proud to say I'm sitting with them. One is Dr. Balram Bhargav, and he was the first one who called us at the time of COVID. He said, Dr. Lal, you please come and bring your friends along and let's start, involving the private sector. And do you know what we have done? 2,300 RT-PCR labs are running in India, out of which 60% are private labs. Thanks to Dr. Bhargav. Please give a big hand. And the second person whom I'm delighted to be in this August company is, Vaidji, Dr. Rajesh Kutecha, who is the Secretary of Ayush. You have no idea how we have worked together. I'm an allopathic doctor, but having an interest in ancient medicine. And he just came up. I belong to an ashram. I run an Ayurvedic hospital. In fact, I run 2 Ayurvedic hospitals in Uttarakhand, and Dr. Kutecha has been to both of them. So what we did, I said, Dr. Kutecha, we'd like to come into primary healthcare. My wife and I, we have a, kind of an organization, philanthropic, and we would like to, work with the government of India. So he says, Dr. Lal, come and take as many health and wellness centers as you can. So because we were just starting and they said that don't try to jump, take baby steps. So we took 3 health and wellness centers in Uttarakhand from Dr. Kutecha and 7 from the NHM. And guess what? After 1 year, we are showing the results. So what we said was, our commitment to society was that these are HWCs. I'm not trying to teach the government how to run HWCs. Point number 1. I'm only there to see if I can be of any help. If there is a gap in something, I can, put into that gap, I can put something there. And we have turned it around. 10 health centers are running with this thing, including, I never wanted to get into pathology in Uttarakhand. But when we went there, we saw, which is again approved by ICMR, there is a national list of essential diagnostics, which was ratified by, given by WHO, and ICMR is ratified. And when we went on the ground there, we saw that even for glucose testing, things were not available. They said that they can do it by glucometer. I said, show me the glucometer. And they said, Dr. Lal, we have the glucometer, but we are given 25 strips to test in 1 year. So that is the ground reality. And that is where Dr. Kutecha and we are working together. And I think if we are given more chances like this, we can turn it around.
Thank you. Please give all the leaders a big round of applause. And just to answer your question, brother, I must say that one, I don't think overall media sometimes, before I got into business world, I did build Exchange for Media, which is India's #1 medium on the business media. So I have a locus and I to be able to come. I don't think we take up serious issues sometimes. After the last 27 months, if healthcare is not the most important issue, I don't think, what a certain actress is wearing when she stepped out of the airport gets more views than Dr. Mittal possibly giving a playbook for a healthy preventive lifestyle. So I think media has to continuously, even when we are not in a pandemic, hopefully we are post-pandemic or in a milder pandemic, whichever way you want to look at it, we have to consciously devote more time to one, as Dr. Bhargav said, bringing the strengths of the Indian healthcare system to the fore. I wrote that piece and I'll share. I don't think we do that. Second, as he talked, we have to talk about in the media about 4 other things which are related to healthcare, which we don't. Nutrition. And I eat more, but we have to talk of malnutrition. We have to talk of 100. Air quality. Agle 2 mahina, we will again talk because it's that time of the year when the crops are burnt in Punjab and the quality of our air then leads to a lot of other things. We have to talk about the quality of the air till it is solved. We don't in the media. Third, I don't think, as he rightly said, we celebrate our leaders in the healthcare, whether they are policymakers like Mr. Vaidya or Mr. Bhargav, or people who ran institutions and provided leadership. We don't. We have to bring their stories and constantly kind of bring them upfront. And last but not the least, successive governments have talked about healthcare and done a bit. I mean, we have a robust healthcare system. So clearly governments have done their bit to say they haven't. But I think we have to do a lot of catching up and really put our policies into execution mode. He gave some examples. When I was thinking, I was listening intently to everyone. What has changed now that the implementation will happen to the scale of all of these people represent? Possibly there is a bigger political will. Possibly we have a chip on our shoulder. We want to showcase to the world and to ourselves that we are better than you in every aspect. Possibly that will make it happen. But I think if India has to become what it wants to become in terms of economic terms, it is a good decision to up the case on healthcare. It is a good economic decision. It is a good human decision. And that's why it will happen in the next few months. That's what I get a sense talking to policymakers in the government. And I think the policymakers in the government are also much lesser celebrated, or at least patted on the back than they should be. I mean, look at, we did the number of, I don't know what is the number of vaccinations today. We've done 2 billion plus. 2 billion plus vaccinations. I mean, we've saved how many lives? So clearly, I think we do not talk about, I keep saying in every index, either doing business, maybe there is a healthcare index. The way these indices are done by World Bank and global authorities, they do not play to India's strength. So we have to stop only believing these indices and these rankings. We have to in some way come up with our own, whatever. And I'm not saying just doing chest thumping, improve, whatever. But I don't think the global media does justice to India's prowess and contribution in healthcare, especially when we have 20% of the world population in India. So I don't think we do get a fair press from global media. And in Indian media, generally, unfortunately, we don't focus on serious issues like environment, like healthcare, like nutrition, like mental health. Mental health was a flavor when the pandemic was there. We don't talk about mental health. So I hope things change because we have a chip on our shoulder and we also believe it is linked to our growth.
No, I completely resonate with what you're saying because if you look at it, I mean, the study of genomics, etc., it has been proven that every geographic location has a set of population which has got different sets of problems. Dr. Bhargav, I have one question for you. Primary healthcare has always been a priority for our government. Sometimes it was very difficult to bridge the gap that existed. We still have large hospitals who are trying to fill the beds, and in rural areas, we do not have healthcare available. Do you think that the technology development that has taken place today is bridging this gap to bring healthcare to the rural segment beyond just video consultations?
I think that's a very important point that you have made, and you've hit the nail on the head, that there are hospitals which are trying to fill up their beds in the tertiary care centers, and the primary health is still being neglected in a big way. Yes, technology can play a role. The work has gone down from the specialist to the generalist to the nurse provider to the ASHA, and it has gone down to that level in the sense that the ASHA workers have become the backbone of the primary health centers. And they can use technology, but technology sometimes over promises and under delivers. So we have to be very careful when we use technology. It is a double-edged sword. So what I think when we're going to the primary health centers for telemedicine, consultations, diagnostics, technology will play an important role. but the mindset of the people also has to change clearly that medicine is not like engineering, or biology is a stochastic science. It is not a deterministic science. The example with Girish has talked about space and nuclear and testing regularly the Six Sigma of Motorola, that does not apply to the human body. Over testing and creating over paranoia has to be carefully balanced. So that is an important point. So overuse of technology, right use of technology is what is important. Overuse can mess it up, but I think a lot of promise.
I've just been informed that the Honorable Minister should be here in the next 5 minutes. So I think we'll have to wrap it up. But before I let go, Dr. Guleria, I just need in 1 minute, if you can share that how the mindsets of the care receivers has changed after pandemic. I mean, all of us had teleconsultations always available, but nobody was using it. But today, has the acceptance changed? Very briefly, sir.
So it has changed. I think the receiver has, two things have happened. One is the focus on preventive health has become much more than what it was before. People have started realizing how important it is to stay healthy. So getting regular checkups done and early diagnosis of non-communicable diseases has really picked up. And like you said, using teleconsultation and other means has also become something which has been looked at. And I think that is the future, and we should be able to have it, but it has to be user-friendly.
Thank you so much, everyone, for joining us for today's session. We have our chief guest here, so I think we'll wrap it up here. Thank you so much.
Thank you to all our panelists and our session chair. I request you to please take your seats. Thank you so much. और अब कृतज्ञता और उत्साह के साथ मैं हमारे समक्ष स्वागत करना चाहूंगा हमारे आदरणीय चीफ गेस्ट जी का, डॉक्टर मनसुख मंडाविया जी, ऑनरेबल यूनियन मिनिस्टर फॉर हेल्थ एंड फैमिली वेलफेयर एंड केमिकल्स एंड फर्टिलाइजर्स, गवर्नमेंट ऑफ इंडिया। हम सब आपके बहुत आभारी हैं सर कि आज आप हमारे साथ जुड़े हैं। मैं निवेदन करूंगा डॉक्टर अनुराग बत्रा जी से और डॉक्टर स्वदीप श्रीवास्तव जी से कि वह एक बार फिर हमारे चीफ गेस्ट का स्वागत करें। और साथ ही में मैं स्वागत करना चाहूंगा हमारे गेस्ट ऑफ ऑनर का, डॉक्टर भारती पवार जी, ऑनरेबल मिनिस्टर ऑफ स्टेट फॉर हेल्थ एंड फैमिली वेलफेयर, गवर्नमेंट ऑफ इंडिया। मैं एक बार फिर निवेदन करूंगा डॉक्टर श्रीवास्तव और डॉक्टर बत्रा से कि वह एक बार मैम का फिर स्वागत करें। आपका बहुत बहुत धन्यवाद मैम। और आज की शाम को और पवित्र और धन्य बनाने के लिए आइए हम ज्ञान का दीपक प्रज्वलित करते हैं, चमक और समृद्धि का प्रतीक का आह्वान करते हैं। मैं निवेदन करूंगा हमारे चीफ गेस्ट डॉक्टर मनसुख मंडाविया जी से, हमारे गेस्ट ऑफ ऑनर डॉक्टर भारती पवार जी से, डॉक्टर अनुराग बत्रा जी से, डॉक्टर स्वदीप श्रीवास्तव जी से, मिस्टर हरबिंदर नरूला जी से और मिस्टर गिरीश कृष्णमूर्ति जी से कि वह एक बार मंच पर आकर आप सभी कि वह इस दीप का प्रज्वलित कर हमारी इस शाम को एक पवित्र शुरुआत दे। धन्यवाद। देखिए, जब भी मौका मिलता है ताली बजाने का, आप लोग दिल खोल के ताली बजा सकते हैं, अपने हाथों को कभी मत रोकिएगा। थैंक यू। और अब मैं निवेदन करूंगा डॉक्टर स्वदीप श्रीवास्तव जी से, जो कि फाउंडर और चेयरमैन हैं हील फाउंडेशन के, कि वह एक बार मंच पर आकर आप सभी मां अनुभवों का एक बार फिर स्वागत करें।
Namaskar, good evening. Firstly, I would request our chief guest, Honorable Union Minister for Health and Family Welfare, Chemicals and Fertilizers, Government of India, Dr. Mansukh Mandavia, sir. Sir, please join us on stage. Sir. Our guest of honor, Dr. Bharti M. Pawar, Minister of State for Health and Family Welfare, Government of India. Ma'am, please join us on stage. Dr. Anurag Batra, Chairman, Business World Media Group, please join us. Mr. Girish Krishnamurthy, our special guest, MD and CEO of Tata MD, please join us. Thank you. I have a small welcome video to start with. Then I'll give a very short and crisp welcome speech to start this program formally. Can we have the video, please?
नमस्कार। जैसा कि आप सब जानते हैं, भारत में Welcome to Bharat Swasth Mahotsav 2022. In sync with the Azadi Ka Amrit Mahotsav on the completion of 75 years of India's independence, BW Healthcare World and Heal Foundation have organized Bharat Swasth Mahotsav to celebrate the healthcare change makers in India since independence. Bharat Swasth Mahotsav aims to bring together the entire healthcare industry to discuss the journey of healthcare in India since independence. We have segregated Bharat Swasth Mahotsav into two parts: Healthcare Changemakers Summit, starting in the morning, followed by Padma Doctors Congregation in the evening. Healthcare Changemakers Summit aims to bring to discussion the entire gamut of healthcare, wherein healthcare changemakers, industry, health impact leaders, and experts will deliberate to present a comprehensive overview of healthcare in India. The Padma Doctors Congregation is being organized to honor the accomplished healthcare changemaker Padma awardee doctors for their humane service and innovative ideas which have brought about a drastic transformation in the healthcare landscape in India. Honorable Prime Minister Shri Narendra Modi ji has given us the vision of comprehensive healthcare under the from token to total approach. PM Ayushman Bharat Health Infrastructure Mission is the largest pan-India health infrastructure scheme that aims to provide a much-needed fillip to India's capacity to address emergent public health issues. In 75 years of independence, we have come a long way in uplifting our healthcare systems, adding various innovations to make them at par with world-class healthcare systems. But the next 25 years are very important for us as we have to become a world health leader.
Good morning. Welcome to the first Healthcare Kumbh. I would call it a Healthcare Kumbh by BW Business World and HealthcareWorld Foundation. The BW Business World, BW Healthcare World, BW Wellbeing World, and HealthcareWorld Foundation have put this together. My congratulations to Swadeep, Ravinder, and all the colleagues who have worked in both teams to put this together. I don't have to overemphasize the value of health post-corona. I think if I need to focus on one thing, it is my health, which I am doing. But let me also say, from the business of health, health is supposed to be a service. It is. But Amazon is getting into health. That tells you that technology will impact in a big way the healthcare delivery business. Health tech has already become big. Telehealth existed for 2 decades in India, but really the acceleration, the acceptance that has happened in the last 2 years has made sure healthcare becomes more accessible for everyone. I must congratulate the Modi government for making sure the vaccine program that has really saved lives and livelihood.
We need to take a pledge that while celebrating 100 years of independence, India will be the health capital of the world. Thank you.
Firstly, my heartiest thanks to Honorable Dr. Mansukh Mandavia ji, Union Minister for Health and Family Welfare and Chemicals and Fertilizers, Government of India, for accepting to be the part of this program and make this event auspicious by his gracious presence. My heartiest thanks to Dr. Bharti M. Pawar ma'am, MOS, Ministry of Health and Family Welfare, Government of India, and our special guest, Mr. Girish Krishmurthy, MD and CEO Tata MD. Ame badha tamaru harya tay yethi seagata kari che. Sir, a small line I learned in Gujarati today. We all welcome you from the bottom of our hearts. Let's give a big hand. So on behalf of BW Healthcare World Business World Media Group, their chairman, Dr. Anurag Batra, and our dedicated healthcare advocacy and awareness platform for last 15 years, HealthcareWorld Foundation, our sincere gratitude to the Padma doctors of our country. Today, this event is because of them and for them, who from their busiest schedule took out time today and are among us to make this evening one of the most memorable for all of us. So a big round of applause for all the Padma doctors. I've been working dedicatedly in the healthcare sector as a healthcare communicator, public health evangelist, and a health impact entrepreneur for the last 25 years. And in this satisfying journey, working closely with healthcare providers, patient groups, medical and wellness experts, and the industry, these are my few learnings, and I would like to share them very briefly. Though the train of healthcare comprises of multiple stakeholders, but the engine is always the doctor, the medical professional, or we also call them healthcare practitioners, SCPs. Though their hard work and pain taken by everyone, there's a hard work and pain taken by everyone while delivering a responsible healthcare, whether it is nurses, paramedics, scientists, innovators, healthcare workers, technology providers, service givers, caregivers, everyone in this cycle. But the core responsibility of making the best judgment and that there's no accident and the patient journey is smooth fundamentally lies 100% on this treating doctor, and therefore the onus of treatment and cure is always on this doctor, the SCP. When I started my career as PRO of Indraprastha Apollo Hospital, I came with a perception that doctors are very tough to handle. This is about 25 years back. Interact with them, to handle, to interact with them, and of course, a common misconception that doctors make a lot of money. But as I went deeper into the doctors, working with the doctors, I would have interacted with not less than 2,000 doctors of multiple specialty on one-to-one basis, the key opinion leaders who have been integral part of more than 200 media workshops, health writers workshops, 7 national health writers conventions, and various integral healthcare campaigns we have been doing for last few years, including the COVID Fighters Public Health Safety Movement and our ongoing very popular Health for All online show every Sunday. This is what I realized is just few years, and would like to share it with you, sir, by your permission, for the doctors, with you a few anecdotes which were eye-opening for me and would help in putting a few things in the right perspective, particularly today for the Parma Doctors Evening. In a doctor's chamber, I used to read, "I treat, he cures," which gives a very sensible insight that we should think 100 times before putting any blame on treating doctors if anything goes wrong, as a doctor always gives his or her best to see that the patient gets treated to best of their capabilities and leaves the rest to the God, the Almighty, the Supreme, who only has the power to cure. In another doctor's friend chamber, I read the story of lion and deer in the African jungle. Whenever you are a lion, whether you are a lion or deer, when you wake up, you have to run faster, one to get his prey and other to save his life. Since I have known this doctor for last 25 years, he's in OT every day, morning at 8 a.m. and works 12 to 14 hours a day without breaks for minimum 6 days a week for last 25 years continuously. And believe me, there are many amongst us. In fact, most of us who are the Padma awardee doctors, I am very sure about them, who follow this routine in spite of the fact that they have made their lives secure. They may not need to work to earn their living, have made big name and success, but still what drives them till date, even at the age of 65, 70 years, when most of the professionals retire, their busy routine is never ending till their body gives up. These doctors want to be amongst their patients, as that gives them the utmost satisfaction than anything else. India is full of passionate, hardworking professionals, but this one profession, medical profession, probably lives and grows only on passion to serve their people through hard work and sincerity. Lastly, we as common citizens of this lovely country, India, always have an aspiration, particularly who are achievers in any field. There is a hidden dream, कि मुझे भी Padma Award मिल जाए एक दिन. Then life is set probably. The first thing I would do is take retirement and from full time of working. I came across a lot of people who have been quoting. Of course, very such dreams are fulfilled, as the Padma Awards, being the highest civilian awards, are conferred to very few accomplished based on the merit, and the funnel is too narrow on the top to be so lucky to get it. So I know Dr. Saab and many of them who are sitting here who got many awards, including Padmas. And once I casually discussed with him that, "Sir, you have crossed 70 and accomplished everything, including Padma Awards. Why don't you take a break? I even see you working on Sundays." So his reply was that would be that of most of the distinguished Padma awardees sitting here. This profession is a nasha. A Padma Award to us means more responsibility to work harder and connect, to be of service to this mankind. And more so, I don't know of anything else in life except treating patients. And that is the truth of the doctors and most of doctors sitting here. We saw this in times of COVID. These were the professionals who were the frontline warriors. How many of them lost their lives while saving their patients in COVID times? We also have seen stories of many of our doctors who could not see their families for months, while most of us were stringently following COVID protocols and staying comfortably inside our homes. These doctors were always standing on the front, risking their lives for our safety and welfare. So here we are today, saluting the spirit of these doctors through this first of its kind Padma Doctors Congregation, saluting the nasha which motivates them to work hard and day and night so that we can get rid of any illness and live a healthy and happy life. A simple mathematics shows India has approximately 13 lakhs allopathic doctors. We add a set of Ayush and other alternate therapy practitioners would be, so about 20 lakh doctors. Each doctor sees minimum 20 patients a day on an average. If I say some see 100, some see 50, some see 60, I'm taking a lower side. So each doctor is connected to almost 4 to 5 crores of population on a daily basis. They have the power to influence and change habits and inculcate appropriate behavior changes to make our society a better place to live. Hence, we are sitting amongst the professionals who enjoy so much of power and influence, and they are truly the torch bearers of the society. The celebration of Amrit Utsav would be incomplete without celebrating the Padma doctors and taking guidance and being blessed by their presence today. That's why we are here today, led by none other than our Union Health and Family Welfare, Chemicals and Fertilizers Minister, Government of India, our MOS ma'am, Ministry of Health and Family Welfare, Dr. Bharti Pawar ma'am, who is herself a doctor. Nobody would understand value of this occasion more than her. Dr. Mansukh Manduvia, as we all know, has been the torch bearer of PM's dream of affordable and accessible healthcare for all Indians. Jan Aushadhi program and making medicines and consumables cheaper and affordable for all citizens is already written as a success story of this decade under his leadership. We as healthcare professionals bestow a lot of hope on his doings for the overall betterment of the healthcare sector. Hoping to have a great purposeful evening together. Thank you.
थैंक यू डॉक्टर श्रीवास्तव। स्वतंत्र भारत में आप सभी पद्मा डॉक्टर्स का हेल्थ केयर इंडस्ट्री में अहम योगदान रहा है और आज उसी योगदान को सराखों पर रखते हुए हम आप सभी के समक्ष एक वीडियो प्रस्तुत करना चाहते हैं।
नमस्कार। जैसा कि आप सब जानते हैं, भारत की आजादी के 75 साल पूरे होने पर हमारा देश आजादी का अमृत महोत्सव मना रहा है। एक बेहतरीन मौका है जिसमें हम अपनी ग्लोरियस हिस्ट्री, अपनी संस्कृति और अपने महान सेनानियों को याद कर आनंदित हो रहे हैं। इस कड़ी में अगर देश के डॉक्टर्स के योगदानों की बात न करें तो ये महोत्सव अधूरा लगेगा। इसी को ध्यान में रखकर हमने पद्म पुरस्कार से सम्मानित डॉक्टर्स के योगदानों को याद करने के लिए पद्मा डॉक्टर सम्मेलन का आयोजन किया है। उन डॉक्टरों को जिन्होंने देश के हेल्थ केयर सिस्टम की दिशा और दशा बदलने में महत्वपूर्ण भूमिका निभाई है। यह हमारा सौभाग्य है कि हमने आज ऐसे तमाम पद्मा डॉक्टर्स को एक मंच पर लाने का काम किया है। ये हेल्थ केयर सेक्टर्स के हस्ताक्षर हैं जिन्होंने देश के डॉक्टर्स की क्रेडिबिलिटी को न सिर्फ स्थापित किया बल्कि अफोर्डेबल और एक्सेसिबल स्वास्थ्य सेवा का मार्ग प्रशस्त किया। आज हम इनको सम्मानित नहीं कर रहे हैं बल्कि इनकी उपस्थिति से हम सम्मानित हो रहे हैं। इनके अनुभव और ज्ञान से लाभ उठाकर हेल्थ केयर सिस्टम को और समृद्ध कैसे बनाएं, इस बात पर विचार करने की जरूरत है।
Dr. Dinesh K. Bhargava is a former professor of gastroenterology, AIIMS, New Delhi. He is known for introducing diagnostic and therapeutic endoscopic procedures at AIIMS, New Delhi. The Government of India conferred on him Padma Shri in 2008. Dr. Prahlad Kumar Sethi is an Indian physician, medical writer, and the chairman of the Department of Neurology at Sir Gangaram Hospital, New Delhi. He is the founder of the Delhi-based Brain Care Foundation, which spreads awareness about brain illness. The Government of India conferred on him Padma Shri in 2002. Dr. D.S. Rana is an Indian nephrologist and chairman of the Department of Nephrology at Sir Gangaram Hospital, New Delhi. He founded Parvati Education and Health Society, which operates a small 5-bedded hospital in his native village. The Government of India conferred on him Padma Shri in 2009. Dr. Pradeep Kumar Chobe is an Indian surgeon known for laparoscopic and bariatric surgeries. He is founder of Minimal Access Metabolic and Bariatric Surgery Center at Sir Gangaram Hospital, New Delhi. He has performed over 80,000 major minimal access surgeries between 1992 and 2018. The Government of India conferred on him Padma Shri in 2002. Dr. Vijay Kumar Vinayak Dongre is a veteran dermatologist and social worker dedicated his life to working for leprosy patients. As per estimates, there were approx 40 lakh leprosy patients in India in 1981, but after the efforts of Dr. Dongre and others, this has come down to 83,000. The Government of India conferred on him Padma Shri in 2022. Dr. Kamal Kumar Sethi is an Indian cardiologist, medical academician, and administrator. He is the chairman and managing director of the Delhi Heart and Lung Institute. He is known for the performance of first catheter ablation in India. The Government of India conferred on him Padma Shri in 2006. Dr. Ram Harsh Singh was the founder and vice chancellor of Dr. Sarvapalli Radhakrishnan Rajasthan Ayurved University. He is an emeritus professor of Banaras Hindu University and national professor at Ministry of Ayush, the Government of India. His research on Ayurveda has been documented by way of over 200 research papers and 15 textbooks. The Government of India conferred on him Padma Shri in 2016. Dr. K.M. Cherian is an Indian heart surgeon. He performed India's first coronary artery bypass surgery and considered a pioneer of pediatric cardiac surgery in the country. The Government of India conferred on him Padma Shri in 1991. Dr. Keval Kishan Talwar is a renowned cardiologist and the former chairman of Medical Council of India. He performed the first implantation of implantable cardioverter defibrillator therapy in South Asia. The Government of India conferred on him Padma Bhushan in 2006. Dr. Alka Kriplani is an Indian gynecologist known for her contributions to the field of reproductive endocrinology and gynecological endoscopy. The Government of India conferred on her Padma Shri in 2015. Dr. Arvind Lal is an Indian pathologist, medical administrator, and chairman and managing director of Dr. Lal Path Labs, a medical diagnostic center. Dr. Arvind Lal has brought international recognition to Indian healthcare industry in the form of accreditation from College of American Pathologists. The Government of India conferred on him Padma Shri in 2009. Dr. Arunoday Mondal, popularly known as Sundar Banar Sujan, who established Sujan, a charitable outdoor clinic in 2000 at Roypara, Sahib Khali, North 24 Paranganas in the remotest areas of Sundarban, where there was no connectivity, no electricity, and scarcity of drinking water. The Government of India conferred on him Padma Shri in 2020. Professor Dr. M. Wali is an Indian cardiologist. Currently, he is working as a consultant at Sir Gangaram Hospital, New Delhi. He has the distinction of serving 3 presidents of India, Mr. R. Venkataraman, Dr. Shankar Dayal Sharma, and Dr. Pranab Mukherjee. He is credited to have introduced geriatric medicine in India. The Government of India conferred on him Padma Shri in 2007. Dr. Digambar Behra is an eminent pulmonologist in India. He is a pioneer in lung cancer chemotherapy and founder president Indian Society for Study of Lung Cancer. The Government of India conferred on him Padma Shri in 2020. Dr. Trilochan Sinclair is an Indian interventional cardiologist, medical administrator, writer, and chairman at Fortis Heart and Vascular Institute, Gangaram, and Fortis Hospital, Vasant Kunj, New Delhi. He has performed over 25,000 coronary, renal, carotid, and peripheral angioplasties. The Government of India conferred on him Padma Bhushan in 2005. Dr. A.K. Grover is a prominent name in the realm of ophthalmology. He is credited to have brought the specialty of oculoplastic surgery to the forefront while being at Sir Gangaram Hospital, New Delhi. The Government of India conferred on him Padma Shri in 2009. Dr. Malvika Sabharwal is an Indian gynecologist and obstetrician at the Nova Specialty Hospitals of Apollo Healthcare Group. She is known to have conducted several free health camps for women, children, and employees. The Government of India conferred on her Padma Shri in 2008. Dr. Chandrakant S. Pandav is the former head of Department of Community Medicine at AIIMS, New Delhi. His instrumental role in the iodinization of salt in India made him the Iron Man of India. The Government of India conferred on him Padma Shri in 2021. Dr. Purushottam Lal is an internationally acclaimed Indian interventional cardiologist. He performed the first case of non-surgical heart hole closure in the world. He founded Metro Heart Institute in 1997 for quality and affordable healthcare. For his contributions, the Government of India conferred on him Padma Vibhushan in 2009, Padma Bhushan in 2003, and Padma Shri in 1993. Dr. Ganesh Kumar Mani is the chairman of Cardiothoracic Vascular Surgery at Max Smart Super Speciality Hospital, Saket City Hospital, New Delhi. He is a cardiothoracic and vascular surgeon reported to have performed over 20,500 coronary artery bypass surgeries. The Government of India conferred on him Padma Shri in 2013. Dr. Ashok Seth is an Indian interventional cardiologist credited with the performance of over 50,000 angiograms and 20,000 angioplasties. He has pioneered numerous angioplasty techniques for India and the Asia Pacific. The Government of India conferred on him Padma Bhushan in 2015 and Padma Shri in 2003. Dr. Brijendra Kumar Rao is an Indian anesthesiologist and critical care specialist. He has done pioneering work in respiratory care practices in India. The Government of India conferred on him Padma Bhushan in 2009. Dr. Rajesh Kumar Grover is an Indian oncologist, former director and chief executive officer of Delhi State Cancer Institute, New Delhi. He has propounded various new concepts in radiology and oncology and its technological innovations. The Government of India conferred on him Padma Shri in 2014. Dr. Jitendra Mohan Hans is an Indian otorhinolaryngologist, medical researcher, and inventor of Hans speech valve for speech rehabilitation and laryngeal cancer surgery. The Government of India conferred on him Padma Shri in 2005. Dr. Ravikant is a professor of surgery at Sharda University. He is the former director of AIIMS Rishikesh and vice chancellor of King George's Medical University. He has been instrumental in starting the organ donation program and retrieval of organs from brain dead patients. The Government of India conferred on him Padma Shri in 2016. Dr. Jagat Ram is an ophthalmologist and former director of Postgraduate Institute of Medical Education and Research, Chandigarh, India. He organized over 150 free mega camps for the rural population. The Government of India conferred on him Padma Shri in 2019. Dr. Shiv Narayan Kuril is an Indian pediatric surgeon. He is an academician, writer, administrator, and HOD of pediatric surgery at King George's Medical University, Lucknow, UP. Pioneered the single-stage surgical technique for congenital problems in India. The Government of India conferred on him Padma Shri in 2016. Dr. Raman Kapoor is an Indian medical acupuncturist and author. He's also the head of Department of Acupuncture at Sir Gangaram Hospital, New Delhi. He has written 4 books on acupuncture and soft lasers. His papers and articles have been published in various national and international journals. The Government of India conferred on him Padma Shri in 2008, making him the first acupuncturist to receive the award. Dr. Professor A.K. Bhalla is an eminent nephrologist from New Delhi. He has played a pivotal role in starting CAPT in India. He pioneered in peritoneal dialysis as a modality for renal replacement therapy in India. The Government of India conferred on him Padma Shri in 2008. Dr. Randeep Guleria is an eminent pulmonologist and the current director of AIIMS New Delhi. He is credited with efforts in establishing a Center for Respiratory Disease and Sleep Medicine at AIIMS, which is reported to be first in India. The Government of India conferred on him Padma Shri in 2015. Dr. Shadab Mohammed is the professor and HOD of Oral and Maxillofacial Surgery, King George's Medical University. He has got published a book on oral and maxillofacial surgery. The Government of India conferred on him Padma Shri in 2019. Dr. Balbir Singh is a renowned Indian interventional cardiologist and cardiac electrophysiologist. He has pioneered several new techniques in invasive cardiology. The Government of India conferred on him Padma Shri in 2007. Dr. Balram Bhargava is the former Director General of Indian Council of Medical Research. He is Secretary of India's Department of Health Research since April 2018, pioneered the development of indigenous low-cost coronary stents that have benefited several thousand patients. The Government of India conferred on him Padma Shri in 2014. Dr. Rajesh Kotecha is an Indian Ayurveda physician. He is Secretary of Ministry of Ayush in the Government of India. He is the author of concept of Atattva Binivesha in Ayurveda, which discusses minor psychiatric disorders within Ayurveda parameters. The Government of India conferred on him Padma Shri in 2014. Dr. M.V. Padma Srivastava is an Indian neurologist. She is the professor of neurology at AIIMS, New Delhi. The Government of India conferred on her Padma Shri in 2016. Dr. Soumitra Rawat is an Indian surgical gastroenterologist. He is the head of surgical gastroenterology and liver transplant at Sir Gangaram Hospital, New Delhi. He and his team are credited with introducing robotic and laparoscopic surgery for gastrointestinal cancer to India. The Government of India conferred on him Padma Shri in 2015. Dr. Anil Kohli is an Indian dental surgeon. He is a medical administrator and the former president of the Dental Council of India. The Government of India conferred on him Padma Bhushan in 2005 and Padma Shri in 1992. Dr. Yash Gulati is an Indian orthopedic surgeon and senior consultant orthopedic surgeon at Indraprastha Apollo Hospital, New Delhi. He pioneered the concept of gyroscope-based computer navigation for knee replacement in India and has the largest series of total knee replacement with eye assist navigation technique. The Government of India conferred on him Padma Shri in 2009. Dr. Praveen Chandra is an Indian cardiologist and chairman of interventional cardiology at Medanta, the Medicity, Gurgaon. He has performed first percutaneous aortic valve implantation without surgery in India. The Government of India conferred on him Padma Shri in 2016. Dr. Mahipal S. Sachdev, an Indian ophthalmologist, ventured into the technique of phacoemulsification for cataract surgery in India. He pioneered blade-free femtocataract technology. He installed Zaroptics, introduced phakic IOLs in India. The Government of India conferred on him Padma Shri in 2007. Dr. Anup Mishra is an Indian endocrinologist and former honorary physician to Prime Minister of India. He is credited with developing dietary and exercise guidelines for Indians. The Government of India conferred on him Padma Shri in 2007. Dr. Neelam Clare is an Indian neonatologist. She is known for her pioneering work on neonatal intensive care and ventilation. The Government of India conferred on her Padma Bhushan in 2014. Dr. Harsh Mahajan is an Indian radiologist and one of the pioneers of imaging technology in India. He has served as the honorary radiologist to the President of India and as honorary consultant to the International Atomic Energy Agency. The Government of India conferred on him Padma Bhushan in 2002. Dr. Mahesh Verma is an Indian prosthodontist. He has helped develop MAIDS, the dental wing of Maulana Azad Medical College. The Government of India conferred on him Padma Shri in 2014. Dr. Ambrish Mittal is the head of endocrinology and diabetes at Max Healthcare, PanMax Saket, New Delhi. He established India's first bone density measurement system and osteoporosis services in SGPGIMS Lucknow in 1997. The Government of India conferred on him Padma Bhushan in 2015. Dr. Lalit Kumar is an Indian oncologist known to have contributed to the development of low-cost medical facilities in Delhi. The Government of India conferred on him Padma Shri in 2014. Dr. Jagdeep Singh Guleria is the former Dean and Professor of AIIMS, New Delhi. He is one of the founder fellows of the Indian College of Physicians. The Government of India conferred on him Padma Shri in 2003. Dr. Upendra Kaul is the chairman of Batra Heart Center Institute at Batra Hospital and Medical Research Center, New Delhi. He is known for his expertise in procedures such as percutaneous cardiopulmonary bypass, rotational and directional atherectomy, coronary stenting, and percutaneous laser myocardial revascularization. The Government of India conferred on him Padma Shri in 2006. Dr. Randhir Sood is the chairman of Medanta Institute of Digestive and Hepatobiliary Sciences. He is credited with establishing and integrating therapy with GI endoscopy in India through training and live workshops. The Government of India conferred on him Padma Shri in 2008. Dr. Sandeep Guleria is a senior consultant surgeon in general surgery, GI surgery, and transplantation at Indraprastha Apollo Hospital. He is credited with having done the first 2 successful kidney pancreas transplants in the subcontinent. The Government of India conferred on him Padma Shri in 2019. Dr. M. Khalilullah is an Indian cardiologist. He has authored the first textbook of cardiology in India. He is credited to have developed India's first indigenous pacemaker. The Government of India conferred on him Padma Bhushan in 1990 and Padma Shri in 1984. Dr. Nitish Nayak is an Indian cardiologist. He has done pioneering work in the field of interventional cardiology. The Government of India conferred on him Padma Shri in 2014.
आजादी के 75 साल में हासिल उपलब्धियों के बाद आने वाला 25 साल देश की स्वास्थ्य व्यवस्था के लिए काफी महत्वपूर्ण होगा, खासकर पद्मा डॉक्टर्स की भूमिका को लेकर। देश को अभी कई बड़ी स्वास्थ्य चुनौतियों से लड़ना है, मसलन टीबी, अनीमिया, नॉन कम्युनिकेबल डिजीज, वुमेन एंड चाइल्ड हेल्थ, रूरल हेल्थ आदि। और ये सब सभी पद्धतियों को साथ मिलकर करना होगा, यानी ऑल्टरनेट मेडिसिन के साथ मिलकर, और तभी अगले 25 साल का लक्ष्य पूरा हो सकेगा। इंडिया को दुनिया का हेल्थ कैपिटल बनाने का लक्ष्य।
भाइयों बहनों, अगर भारत के हेल्थ केयर सिस्टम को ट्रांसफॉर्म करना है, स्वस्थ समाज का निर्माण करना है, तो हमें होलिस्टिक सोच के साथ काम करना होगा। पारंपरिक और आधुनिक इलाज की साझा ताकत को मजबूत करना है। आयुष और मॉडर्न हेल्थ केयर का एक साथ एक बराबर विकास होगा, तभी बेहतर स्वास्थ्य समाधान हम तैयार कर पाएंगे। साथियों, आयुष्मान भारत योजना इसी सोच का परिणाम है।
पूरे विश्व और खास कर एक भारतीय होने के नाते मैं आप सभी पद्मा डॉक्टर्स का बहुत बहुत धन्यवाद करता हूं। ऑन बिहाफ ऑफ एवरी इंडियन एंड एज अ ट्रू इंडियन माई सेल्फ, I surely take this moment to thank each one of you for your contribution and dedication. Let's have a warm round of applause for all our Padma doctors. Thank you. And with that, it's time for a special address on it's time for Make in India in medical devices and diagnostics. Ladies and gentlemen, please join me in welcoming on stage already Mr. Girish Krishnamurthy, MD and CEO, Tata Medical and Diagnostics, to deliver the same.
Honorable Minister for Health and Family Welfare, Chemicals and Fertilizer, Government of India, Dr. Manchuk Mandviya. Honorable Minister of State for Health and Family Welfare of Government of India, Dr. Bharati Pawar. Dr. Swadeep Srivatsa and Mr. Anurag Batra. And most importantly, today's hero of the event, all the Padma awardees. It's a great honor and my heartfelt reverence to all of you. I just want to take a couple of minutes just to share what kind of a time on which we are living in India, what kind of an opportunity with all the healthcare professionals, all the hard work they did last 75 years, and the current government initiatives to really transform healthcare for the highest level. From Tata's side, we made a commitment about 5-6 years before with the guidance from the Government of India to really experiment various different thinking of how do we really bridge the gap of healthcare. In this experiment, our journey started like every healthcare learning happens in India from All India Institute of Medical Science. From there, we developed a model called a Bridgetal model. And we could come up with a model to really take care of every individual patient by connecting them with the technology and reinventing the process. And we could serve about 1.5 million cancer patients within a span of about 24 months. At the same time, the biggest gap on our public health system, which we looked at it on the primary and secondary care, which is at the district level. We experimented the public health system in Himachal Pradesh, Telangana, and also one of the districts in Karnataka and Kolar, and close to about 40 lakh citizens. And even today, we continue to improve this model and part of various principles in Digital India Health Mission and the National Health Authorities model. We have been experimenting and several learnings we have done, which is a great honor and a privilege Government of India and all the state government provided to our organization to experiment all of this. Based on all of this experiment, our chairman wrote a book called Bridgetal Nation. Essentially, in healthcare in the Bridgetal Nation, if you look at it, the current healthcare system, one side, it is episodic in nature. And second, when I say episodic, one event to another event. And it's extremely disjointed in care. Over a period of last 30-40 years, we developed care only in the hospitals. Everybody rushed to a general hospital. And we looked at this model and added 4 components to this. One is the network and the process. We reimagined all the healthcare processes, as well as we developed a very unique platform. And with this, the Bridgetal model to bridge the gap, today available for the nation. And in this occasion, from the Tata Group, we would like to offer to all the government institutions this model, how to nationally replicate it. With that, this model, I quickly wanted to say about 5 tenets. It is a connected care, continuous care, proactive care, close to patient care, but highly patient-centric care. This model is available in India. It is indigenously developed in India. It is for all of us to use. From Tata MD, on this occasion, I would like to make a pledge and an announcement that every Padma awardees today is available here in this hall. On their name, we will plant a tree in whatever the location they choose. If they wanted to plant it in their village, in their house, or any other place of choice, we would like to plant and nourish and harness that plant for rest of our life and continuous this to mark this great event. Thank you.
Thank you so much, sir. Moving on for our next address, please join me in welcoming the chairman and editor-in-chief of PW Business World and founder, Exchange for Media, Dr. Anurag Batra.
Good evening. It's my honor and privilege to welcome all of you to this inaugural and an historic occasion of the Padma Doctors congregation. First of all, my sincerest gratitude to the Honorable Cabinet Minister, Shri Mansukh Mandavia ji, to the Honorable Minister State for Healthcare, Dr. Bharti Pawar, my friend Swadeep. When I started the healthcare community 5+ years back, I think he was the first or second person I met. First being my friend and my lawyer who introduced, I think he was the second person. And we discussed building a healthcare community. Girish, thank you for keeping your address short. I'm very conscious of the fact that every Padma doctor, awardee, and stalwarts of the healthcare service domain are here to listen to the minister and the state minister. So I will keep it short. I just want to say that this government is known for being corruption-free. This government is known for being progressive. This government is known for being inclusive. This government is known for bringing in GST. This government is known for building highways. But I must promise, with the kind of dynamic ministers we have, who are building their own reputations, and they've been brought in after the pandemic, there's such a big responsibility. And I'm sure that this government, because of the work of the ministry and the policymakers that work with the ministers, this government will be known for healthcare delivery over the next few years. I am in the know of the policy of the government. I won't talk about them. I'm sure the minister and his cabinet colleague will talk about it. But the only thing I want to say, I told myself and Sudeep, and me and my wife and Sudeep were talking, if me having access to all of you and your advice, if I can't be healthier and live longer, I really don't deserve to do the job I do. So that's my only takeaway. I'm going for a full health checkup in the morning tomorrow, thanks to this. And I may say it lightly, but I really mean that we take our health for granted till there is an episode, as Girish talked about. So clearly, I don't want to stand between you and the ministers. I want to congratulate all of you for what you've done. I know a couple of doctors who've personally been helpful to my family. Dr. Maipal Sachdev, who was here in the morning, did the both the surgeries of my parents, and my parents are doing well. They're well in their 80s, and there are other doctors. So I know the value doctors. I went to Dr. Mittal as a patient maybe 18-20 months back. I haven't followed your advice fully, but seeing you today is a reinforcement. I want to end by saying technology is very important. Technology is making an impact in every domain. In measuring what you can monitor and measure, you can improve. So AliveCore is our sponsor, and it is a partner. Clearly, they brought devices, and there are other companies. But healthcare is essentially about human touch. I want to say, when a doctor, my mother had a stroke 3.5 years back, and I took her to, Fortis. Dr. Sachdev is here. Sorry, thank you. I didn't spot you earlier. And I must tell you, we were in Fortis, and for various reasons, I landed up in Fortis, Gurgaon. My parents live in Gurgaon, so I rushed from Delhi. I live in Delhi, and I called a couple of friends. I called Sudeep that day, and for whatever reasons, we landed in Fortis. And I can tell you that while technology is there, it's the extra time the doctor puts in with the patient, just that 60 seconds of reassurance that you'll be fine, asking and listening to the patient. I think that cures the patient. Of course, placebos have shown that medicines do cure, but it's the placebos that also come into play. So healthcare will continue to remain a human-centric, a human touch, a human intervention-based service and healing. Technology cannot replace that. That's not, technology will, like everything else, will be an aid. It is making rapid strides. And I'm sure when you hear the minister, you will hear what his plans are to leverage technology to be able to deliver inclusive healthcare to Indians. That is what the Prime Minister's vision is. And I'm sure the healthcare minister and the healthcare ministry are working towards bringing in something that will be revolutionary. And I let the minister say that. My congratulations to all of you. Some of you have got all the Padma Awards. You graduated. Some of you possibly still aspire or deserve more Padma accolade, but you know, I'm much younger than some of you, but I'd say kudos to you. दुआ दे सकता हूं तो मैं आप लोगों को दुआ देता हूं कि आप, मैं छोटा जरूर हूं बट दुआ तो कोई भी दे सकता है, उसमें उम्र का कोई तकाजा नहीं है. So I bless you. As a younger person, I'm not older. I may look older to some of you, but I am a hairless, toothless infant. So I just want to congratulate you. And I would say, please give all of them a standing ovation. I think they deserve it. Swadeep outline. Please give them a bigger, you know, taxing is good for your heart muscles. And Mr. Mandevia, by your being here, you really honored them by your presence, by giving your time, by looking at their AVs and their achievements. I think that's what people look at, being applauded, being recognized, and being appreciated. So by doing that, you've done your duty apart from policy making. Thank you. I'll go and sit there, and it's time to listen to both the ministers. Thank you. Good evening. I also want to take this opportunity to thank, really, you know, we are a team, and really healthcare is led by Mr. Harbinder Narula and his team, and business world is led by Mr. Hoshi Kaswala and team. These two, and a numerous number of my colleagues, Tanvi, I can see Smriddhi, Prashant, Uday. Mine is a people's business. There's nothing else in what I do. So really, Harbinder and his team have put this together. So please also give them, along with Swadeep. It was Swadeep's idea, and Swadeep came to us, and we are always happy to collaborate with Swadeep. So thank you so much to my team, because it is a people-centric domain. There's nothing else in this. It's ideas and people. So thank you, Harbinder, for putting this together and collaborating with Swadeep to put this together. It's a historic evening, and hopefully we'll build on the discussions, deliberations, and ideas that have come out today. Thank you.
Thank you so much, Dr. Batra. और इसी के साथ वक्त हो चला है अब हमारे गेस्ट ऑफ ऑनर के एड्रेस का. Ladies and gentlemen, please join me in welcoming to the podium Dr. Bharati Pawar, Minister of State for Health and Family Welfare, Government of India.
नमस्कार. आज के इस कार्यक्रम में उपस्थित आदरणीय स्वास्थ्य मंत्री श्री डॉक्टर मनसुख भाई मांडविया जी, डॉक्टर अनुराग बत्रा जी, डॉक्टर स्वदीप श्रीवास्तव जी, डॉक्टर गिरीश कृष्णमूर्ति, सभी सम्मानित पद्म पुरस्कार विजेता डॉक्टरगण और सभी यहाँ उपस्थित अतिथिगण. हौसलों के आगे कोई पर्दा नहीं होता, कड़े परिश्रम का कोई विकल्प नहीं होता, दिल में हो जज्बा कुछ कर दिखाने का तो जलते दिए को भी आंधियों का डर नहीं होता. इसी तरह अनेक तूफान और आंधियों को पार करते हुए आज मेरे सामने यहाँ सब ये प्रतिभाशाली व्यक्तिगण उपस्थित है. इस कार्यक्रम के आयोजक बिजनेस वर्ल्ड तथा हील फाउंडेशन को मैं विशेष रूप से धन्यवाद देना चाहती हूँ कि जिन्होंने हमारे इस चिकित्सा क्षेत्र में ऐसे प्रतिभाशाली व्यक्तियों को एक साथ इस कार्यक्रम में आने का और उस कार्यक्रम में हमें उपस्थित होने का अवसर प्रदान किया है. मैं फिर एक बार, friends, I am delighted to participate in India's first Padma Doctors gathering in the Bharat Swasth Mahotsav to facilitate the healthcare change makers, Padma Doctors, for your outstanding contribution to healthcare landscape in India. Padma Vibhushan, Padma Bhushan, Padma Shri, ये भारत के सर्वोच्च नागरिक सम्मानों में से एक है. जिंदगी में आते हैं तो कुछ कर दिखाने का सपना हर एक को होता है, लेकिन ये लाइफ की जर्नी में, ये अचीव करने में समय कैसे चला जाता है ये पता नहीं चलता। लेकिन जब पद्मा अवार्ड आपके हाथों में आया हुआ होगा तो ये जिंदगी में आपने इतना बड़ा मुकाम हासिल किया है। इस खुशी में आज फिर एक बार हम सब सम्मिलित हो रहे हैं और आप बहुत बहुत तरक्की करते हुए आपके साथ, समाज के साथ हमारी भारत की प्रतिमा को, हमारे इस भारत के गौरवशाली इतिहास को और आगे ले जा रहे हैं। इस सार्वजनिक सेवा के तत्व में आपके इस कंट्रीब्यूशन को हम फिर एक बार मैं नमन करती हूँ। ये जो महोत्सव है आज का, यह आपकी प्रतिभाशाली योगदान का है। पिछले 7 दशक में स्वास्थ्य सेवाओं में बदलाव के लिए जो योगदान आपके माध्यम से दिए, आपकी प्रतिभा, आपकी कड़ी मेहनत के कारण आज इस भारत में हम जब आजादी का अमृत महोत्सव मना रहे हैं, तब हमारा देश विश्व स्वास्थ्य के क्षेत्र में इतनी बड़ी प्रतिष्ठा हासिल करने के लिए सक्षम हो रहा है, जिसमें आपका बड़ा योगदान है। मैं आदरणीय प्रधानमंत्री जी के नेतृत्व के सरकार में जो पद्मा पुरस्कार विजेता की जो चयन प्रक्रिया है, इसमें भी काफी बदलाव आया है। और आदरणीय प्रधानमंत्री जी ने कहा है कि जो नामांकन प्रक्रिया है, उस नामित व्यक्ति के नहीं, उस व्यक्ति के कार्य पर, उस व्यक्ति के कार्य पर उसे साबित करने की ऊपर खरी उतरे। और आपने बहुत अभी देखा होगा कि ऐसे विजेता हमने देखे कि हमें गर्व होता है कि इस तरह के लोग समाज में रहते हैं, कि हम महसूस करते हैं कि किसी सिफारिश के बिना ये पुरस्कार दे रहे हैं और जो कि ग्रामीण गांव तक ये पुरस्कार पहुंच रहे हैं। ये एक बड़ा बदलाव जो हम लोगों में से देख रहे हैं, उसका भी मैं स्वागत करती हूँ। आपके सभी का इस योगदान राष्ट्र के लिए अमूल्य है। आपके इस कोविड काल में जिस कठिन दौर में से हम गुजरे हैं, और मेरे उन सभी लोगों के साथ संवेदना है जिन्होंने अपने प्रियजनों को इस कोविड की महामारी में खो दिया है। और विशेष रूप से चिकित्सा क्षेत्र के लोगों के लिए ये एक चुनौतीपूर्ण समय रहा है कि जब हम अपने परिवार को छोड़ के अपनी ड्यूटी निभा रहे थे और पूरा देश आज इस चिकित्सा, हमारी डॉक्टर्स के फील्ड को एक महामारी के इस युद्ध में लड़ने के लिए हमारी प्रयासों की सराहना करते हैं, हमारी योगदान को याद भी करते हैं। इस कोविड महामारी ने दुनिया को चुनौती दी, और आर्थिक भी और सामाजिक भी। इस ताकत में हमने ये भी परीक्षण किया कि ऐसी चुनौती में एक दृढ़ साहस भी होना जरूरी होता है, एक संकल्प के साथ भी उसे निभाना होता है। और निसंदेह आप सभी ने ये साबित किया और हमारी स्वास्थ्य सेवा की प्रणाली की नींव को मजबूत करने के लिए काम भी किया। मैं फिर एक बार आप सभी को धन्यवाद भी देती हूँ। और आपके इस लड़ाई की जीत में हमारे देशवासियों का आप लोगों ने विश्वास बढ़ाया है। और आपने देखा होगा कि कोविड टीकाकरण, जो कि हमारी दुनिया का सबसे बड़ा टीकाकरण, जो आज इसकी सराहना ग्लोबल लेवल पे होती है। शायद हम भारत में उसका महत्व नहीं समझेंगे, लेकिन जब हम ग्लोबल फोरम पे जाते हैं, ग्लोबल लेवल के हेल्थ कंसर्न पे जाते हैं, तब भारत ने ये टीकाकरण कैसे किया उसकी बहुत तारीफ होती है। और आज हम गर्व के साथ कह रहे हैं कि आज हमारा 210 करोड़ टीकाकरण वैक्सीनेशन ड्राइव, जो कि एक सक्सेसफुल ड्राइव हमने दुनिया को दिखाया है। कोविन पोर्टल के बारे में लोगों ने जाना है, बहुत सारे फॉरेन डेलीगेशंस आए, कोविन पोर्टल का स्टडी किया, उन्होंने वो अडॉप्ट किया कुछ कंट्रीज ने। मुझे लगता है ये और एक कदम हमारी आगे जाने के लिए, भारत को और आगे जाने के लिए मोटिवेट कर रहा है। महामारी के खिलाफ बहुत सारी, जैसा सर आपने कहा, टेक्नोलॉजी का उपयोग, और इस महामारी में हमने ज्यादा से ज्यादा इस टेक्नोलॉजी को अडॉप्ट किया। वो भी सराहनीय कदम रहा है। आज टेली कंसल्टेशन, टेली मेडिसिन, उसके आधार पर, आर्टिफिशियल इंटेलिजेंस के आधार पर और नई जगह पे हम काम कर रहे हैं। और इस सेवा के आधार पे हम दिल्ली में भी डॉक्टर्स है तो वो गांव के किसी दूर सुदूर गांव के भी पेशेंट को देख पा रहे हैं, क्योंकि ये टेक्नोलॉजी से आज हम जुड़ पा रहे हैं। मुझे लगता है कि ये टेक्नोलॉजी और विविध हमारे स्टार्टअप्स का जो प्रसार है इन इनोवेशंस को और मजबूती देगा, और भारत सरकार आरोग्य मंत्रालय इस दिशा में काम कर रहा है। ऐसी अनेक योजनाएं हैं कि आज कोविड के कारण हम और कुछ स्ट्रॉन्ग हेल्थ स्ट्रक्चर, हेल्थ स्ट्रेंथनिंग के लिए काम कर रहे हैं, जिसमें प्रधानमंत्री आयुष्मान भारत हेल्थ इंफ्रास्ट्रक्चर मिशन भी है, आयुष्मान भारत डिजिटल मिशन भी है, जिसके तहत हम अनेक स्वास्थ्य सुविधाओं का लाभ जन जन तक पहुंचाने के लिए काम कर रहे हैं। आज हमारी सरकार आदरणीय प्रधानमंत्री जी के नेतृत्व में और आदरणीय मनसुख भाई मांडविया जी के मार्गदर्शन में ऐसी अनेक स्वास्थ्य सेवाएं लोगों तक पहुंचाने में मिशन मोड पे आज हम काम कर रहे हैं, ताकि आसानी से लोगों तक ये सेवाएं पहुंचे। और पिछले 8 वर्षों में जब हम इस चुनौतियों से निपटने के लिए काम कर रहे थे, तब बहुत सारे स्टेट्स में कुछ प्रॉब्लम्स थे, जैसे कुछ मानव संसाधन उपलब्धि हो, अनेकों गांवों में प्राइमरी लेवल से लेके सेकेंडरी टर्शरी लेवल से लेके हमारी हेल्थ सिस्टम जुड़े, उस आधार प्राइमरी लेवल से लेके आज टर्शरी केयर तक हमारे एम्स की संख्या बढ़ी है, उस दिशा में काम चल रहा है। हमारे नए मेडिकल कॉलेजेस, स्टूडेंट को भी अच्छी शिक्षा मिले और पेशेंट को भी मदद मिले, इस संकल्पना से नए मेडिकल कॉलेज हो, चाहे यूजी हो, पीजी हो, ये सीट्स बढ़ाने के भी काम चल रहे हैं। अनेक क्षेत्र में ये काम माननीय प्रधानमंत्री जी के नेतृत्व में चल रहे हैं, और इस सभी के सहयोग से मैं कहूंगी कि इस हमारी राष्ट्र के निर्माण में और खास करके हमारे स्वास्थ्य डिपार्टमेंट के लेके हम हमारी जिम्मेदारी और प्राथमिकताओं को समझ के भविष्य में हमें और ये स्ट्रेंथन करने के लिए हमें एकजुट होके एक साथ मिलके काम करना है। मैं सभी को अभिनंदन करते हुए ये कहूंगी कि जब अवसर कम थे तब भी आप सब काम करते हुए आगे बढ़े हैं। आपने उन चुनौतियों का सामना करके आपने कामयाबी हासिल की है, और भारत सरकार चिकित्सा क्षेत्र को हर संभव प्रयास करके इस सुविधा देने के लिए हम प्रतिबद्ध है। और आगे आने वाले पीढ़ियों को मैं कहूंगी कि आपकी प्रेरणा मिले और आपके जो योगदान है, आपकी क्षमता है, आपकी ताकत है, उससे बढ़ाने का मैं आपको अनुरोध करती हूँ कि आपके इस जर्नी को आप और आगे लेके आने वाली पीढ़ी को प्रेरणा दे, आने वाले युवकों को प्रेरणा दे, और हम सभी के सामूहिक प्रयास से हम इस सदी के भारत को विश्व गुरु और वैश्विक स्वास्थ्य सेवा का प्रतीक बना सकते हैं, ये मुझे विश्वास है। और मैं यही कहूंगी कि पंख ही काफी नहीं है आसमानों के लिए, हौसला भी चाहिए ऊंची उड़ानों के लिए। आपकी ऐसी ऊंची उड़ान हमेशा प्रेरित करती रहे, और आप सभी की ऊंची उड़ान को मैं फिर एक बार नमन करती हूँ। बहुत बहुत धन्यवाद। जय हिंद, जय भारत।
आपका बहुत बहुत धन्यवाद मैम। और इसी के साथ लेडीज एंड जेंटलमैन, प्लीज जॉइन मी in welcoming our chief guest for his address, Dr. Mansukh Mandavia, Honorable Union Minister for Health and Family Welfare and Chemicals and Fertilizers, Government of India.
मंच पर उपस्थित मेरी साथी मंत्री डॉक्टर भारतीबेन, भत्रा जी, श्रीवास्तव जी, गिरीश जी, सभी पद्मा सम्मान से सम्मानित डॉक्टर्स, उपस्थित भाइयों एवं बहनों, यहाँ लिखा गया है पद्मा अवॉर्डी डॉक्टर। मैं मानता हूं कि पद्म सम्मान अवॉर्ड उसको मिलता है जो विजेता होते हैं, कंपटीशन में आगे निकलते हैं। जब इस अवॉर्ड की विभावना को मैंने देखा और जिस टाइम से अवॉर्ड देने के लिए निश्चित किया गया और उसके पीछे की विभावना ये थी कि देश में देश के लिए कुछ विशेष करे, विशेष कौशल्य हो, एक कौशल्य के आधार पर अपना कुछ विशेष कंट्रीब्यूशन दे, ऐसे लोगों को पद्मश्री, पद्म विभूषण से सम्मानित किया जाएगा। अवॉर्ड विजेता को मिलता है, सम्मान देश के लिए जीने वाले लोगों को मिलता है। दोस्तों, आप सब ऐसे लोग हैं जो अपने स्वयं को संकल्पबद्ध करके सिद्धि की ओर एक सन्निष्ठ प्रयास किया है। मुझे एक बात याद आती है, जब हम टेम्पल में जाते हैं तो टेम्पल में सीढ़ी होती है, पत्थर से बनी हुई भी सीढ़ी होती है। एक बार ये सीढ़ी के एक पत्थर और टेम्पल में रही मूर्ति, स्टेचू, मूर्ति, भगवान, ये दोनों बात कर रहे थे। उन्होंने कहा कि हम दोनों एक ही खदान से निकले हुए हैं। आप सीढ़ी हो, मैं सीढ़ी हूं, और आप ईश्वर हो। आपको पूजते हैं, मेरे ऊपर हर दिन कोई पैर रख के ऊपर चले जाते हैं। हर दिन मैं किसी के पैर में होती हूं और आप हमेशा पूजनीय रहते हैं। हम तो एक ही पत्थर से बने हुए, एक ही खदान से निकले हुए हैं। तब जो मूर्ति है, उन्होंने पत्थर को कहा कि जब खदान में खदान हो रही थी, तब आप पत्थर के रूप में तो मेरे तरह ही निकले थे, लेकिन जब कढ़ाई चालू हुई, पत्थर को बनाने की प्रोसेस चालू हुई, मूर्ति बनाने की प्रोसेस चालू हुई, तब आप टूट गए थे। और मैंने कई ऐसे हथौड़े खा 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 के एक मूर्ति का आकार ले लिया। मैंने बहुत कुछ सहा है ताकि मेरी पूजा होती है। तो टूट गए थे, इसलिए तो सीढ़ी बन गए हैं। आप टूटे नहीं थे, इसलिए आप इस सम्मान के पात्र, सम्मान के अधिकारी बने। जब आप इस सम्मान के अधिकारी बने हैं, तब दोस्तों मेरी तो अपेक्षा है हम पद्म सम्मान से सम्मानित हुए हैं, लेकिन मैं चाहता हूं, मुझे पता नहीं है, देश में कभी ब्रेन पावर और मैन पावर की कमी नहीं है, नहीं थी, नहीं है। ये देश में अखूट शक्तियां पड़ी हुई है। सवाल ये है कि इस शक्तियों को हम कैसे चैनलाइज करके उसको आउटपुट में कन्वर्ट करें। यही देश है जो चैलेंज को स्वीकारते भी है और दुनिया को आश्चर्यचकित भी कर सकते हैं। एक समय था जब हम विश्वगुरु थे, यानी कि हमसे दुनिया प्रेरणा लेती थी। हम ही इतना सभ्य थे। जब आप 5000 साल पहले चले जाओ, जब इंडस सिविलाइजेशन फूली फाली थी, उस वक्त का कई पुरावा हमारे सामने है। आप गुजरात में लोथल और धोलावीरा है, लोथल जाके चले जाओ, 5000 साल पुराना एक डॉक वहां आज भी है। आप धोलावीरा में चले जाओ, तब आपको पता चलेंगे कि देश की सभ्यता कितनी विकसित थी। हम वाटर हार्वेस्टिंग की बात आज करते हैं। 5000 साल पहले एक टाउन के लिए वाटर हार्वेस्टिंग कैसे किया गया था, आज भी वहां मौजूद है। हम सिटी प्लानिंग की आज बात करते हैं। 5000 साल पहले सिटी प्लानिंग, ट्रॉमा वाटर की कैसी सिस्टम बनाई थी लोगों ने, आज भी बेस्ट एग्जाम्पल है। इतना ही नहीं, हम लाइमस्टोन को 600 सेंटीग्रेड हीट ट्रीटमेंट करके उसको ग्राइंडिंग करते हैं, थोड़ी सी फ्लाई ऐश ऐड कर देते हैं, तो हम कहते हैं कि सीमेंट बन गई। और इस सीमेंट को, सीमेंट से बना हुआ स्ट्रक्चर, कंस्ट्रक्शन, उसकी आयुष्य हम कहते हैं 100 साल की है। दोस्तों, 5000 साल पहले धोलावीरा की बाउंड्री पर फोर्ट है और फोर्ट को मड से प्लास्टर किया है। 5000 साल के बाद आज वैसा ही वैसा प्रेजेंट है। ये नॉलेज, ये ज्ञान, ये साइंस, ये टेक्नोलॉजी ये देश में आज से नहीं 5000 साल पहले विद्यमान थी। सवाल इतना ही है कि हम हमारी शक्ति को पहचाने। जब मोदी जी ने एक बार थोड़ा सा प्रयास किया, भरोसा किया, क्या मेरे साइंटिस्ट रिसर्च करके वैक्सीन बना सकते हैं? इतिहास तो ये रहा है कि दुनिया में वैक्सीन का रिसर्च होने के बाद 10-15 साल के बाद इंडिया में आता था। तो ये पेंडेमिक की स्थिति में हम कैसे निपट पाएंगे? तो हमारे ही साइंटिस्ट ने रिसर्च भी कर लिया, वैक्सीन हमारी कंपनियों ने बना भी दिया और दुनिया ने दिसंबर में वैक्सीनेशन स्टार्ट किया। हमने जनवरी में वैक्सीनेशन स्टार्ट किया, जिसको दुनिया थर्ड वर्ल्ड कंट्री कहती है। दोस्तों, समय बदल रहा है और बदलते समय के साथ हमें हमारी स्वयं की शक्ति को पहचान के आगे बढ़ना है। मोदी जी ने अच्छी बात कही, गुलाम मानसिकता को त्याग देना है। कारण भी यही है कि ये देश 2000 साल तक परतंत्र रहा है। कभी हुणों ने शासन किया, कभी शकों ने शासन किया। 1000 साल तक इस देश में आक्रांताओं ने शासन किया, 240 साल तक अंग्रेजों ने शासन किया। 2000 साल की हमारी परतंत्रता ने हमारी शक्तियों को सीमित किया है, खत्म नहीं किया है। दोस्तों, यही शक्तियां के आधार पर आप पद्मश्री, पद्म विभूषण से सम्मानित है। मैं चाहता हूं कि ये देश में हम नोबेल प्राइज नहीं ला सकते, ये हमारे इंडिया के लिए वेटिंग में है। दोस्तों, ये आने वाले दिनों में एक नहीं, हर साल हमारे देश में कोई ना कोई नोबेल आए, कोई ना कोई क्षेत्र में नोबेल आए, ये क्षमता हमारे में है। और मैं चाहता हूं कि आप सब लोग जब हेल्थ सेक्टर में है, मैं यहां आपका परिचय देख रहा था, कई विशेषताएं आप में है, कई आउटपुट आपके नाम पर है। देश को आपकी सलाह और मार्गदर्शन की आवश्यकता है। आपका एक्सपीरियंस है, आपने तपश्चर्या करके जो कुछ पाया है उसमें बहुत कुछ शक्तियां है। और जब कोई व्यक्ति शारीरिक एक्सरसाइज करता है, शारीरिक श्रम करता है, मेंटल श्रम करता है, तब उसकी कई इंफॉर्मेशन का कलेक्शन होता है और इंफॉर्मेशन नॉलेज में कन्वर्ट होती है और ये नॉलेज एक संपुट के रूप में रहता है। उसका उपयोग देश के हेल्थ सेक्टर में हम कैसे करें? हमने आज कई उसमें से प्रोफेसर भी है, हमने आज नंबर ऑफ मेडिकल कॉलेज तो बना दिया, हम डॉक्टर बनाने लगेंगे। इस साल से 1 लाख सीट नीट यूजी की हो जाएगी। हम मास में तो आगे बढ़ रहे हैं, साथों साथ हमें क्लास में भी आगे बढ़ना है, मास में भी, क्लास में भी। पद्मा भी, नोबेल भी। दोस्तों, ये दिशा में हमें आगे बढ़ने की आवश्यकता है। उसके लिए कई लोग अभी काम में होंगे, कई लोग रिटायरमेंट की स्थिति में होंगे, लेकिन शायद अब रिटायर्ड अवश्य हुए होंगे, लेकिन मेरा विश्वास है कि इस कैटेगरी के लोग कभी टायर्ड नहीं होंगे। जब तक मेरे में शक्ति है तब तक मैं मेरे देश के लिए कुछ न कुछ कंट्रीब्यूशन करता रहूंगा। कंट्रीब्यूशन करने का अनेक रास्ता हो सकता है, उसमें से आपके पास जो नॉलेज है उसके आधार पर आप हेल्थ सेक्टर को दिशा दे सकते हैं क्या? तो आज आप बोलेंगे क्योंकि आपको सरकार ने पद्मश्री, पद्म भूषण से सम्मानित किया है, तो लोग उसको सुनेंगे। आप बोलेंगे, जनता सुनेगी। आप में से कई डॉक्टर्स जिसको मैं व्यक्तिगत पहचानता भी हूं, कई लोगों को मैं व्यक्तिगत मिला नहीं हूं, लेकिन मैं नाम से भली भांति परिचित हूं। हमारे पास कोई आते हैं एज ए मिनिस्टर, तो मैं आपका नाम बोल लेता हूं कि वहां जाओ, ये करेंगे। आपका नाम देश में पहुंचा हुआ है। आपका सम्मान ने, आपका श्रम ने, आपको, आपकी मेहनत ने आपको सम्मान दिया है। आपका सम्मान ने देश को पहचाना है। इसलिए आप कुछ लिखेंगे, लोग पढ़ेंगे। आप कहेंगे, लोग सुनेंगे। आप नॉलेज शेयरिंग करेंगे, लोग उसके ऊपर विश्वास करेंगे। तप के बिना जब तपश्चर्या नहीं होती ना, कुछ मिल जाता है, उसकी इफेक्ट नहीं होती है। कई बार कई व्यक्ति को पद तो मिल जाता है, लेकिन पद शोभता नहीं है। पद तब शोभता है जब ये व्यक्ति उसके लायक होती है। आपने जो श्रम किया था, मेहनत किए थे, उसको लायकात के रूप में आपको सम्मान मिला है। और इसलिए इस सम्मान का बदला हम देश के लिए क्या करके दे सके, मैं मानता हूं कि हम सब लोगों को हर संभव, हर समय और अभी पूरा कॉन्फिडेंस के साथ, आज तक दुनिया को हमने बहुत पढ़ा, दुनिया की जर्नल में हमने बहुत आर्टिकल पढ़े, उसका बहुत रिसर्च का जिक्र हमने देश में किया, उसका कई डेटा का आधार हमने इंडिया में लिया। मेरी अपेक्षा है कि डेटा हमारा होना चाहिए, दुनिया उसको पढ़नी चाहिए, एनालिसिस हमारा होना चाहिए, जिक्र हो लोग करे, ऐसा ताकतवर होना चाहिए। मैंने बदलती हुई स्थिति को देखा है। मैं पिछले 3 साल से वर्ल्ड इकोनॉमिक फोरम में भारत का प्रतिनिधित्व कर रहा हूं। इस बार मैं वर्ल्ड हेल्थ असेंबली में गया था। दोस्तों, हिंदुस्तान की ताकत बढ़ रही है। हमें अंदाज नहीं है लोग हमें किस दृष्टि से देख रहा है। कई बार हम अपने को, स्वयं को कम एस्टिमेट में देखते हैं। दोस्तों, हमारा एस्टिमेट को हमें बदलना होगा। कॉन्फिडेंस के साथ बिहेवियर करके हमने किसी को झुकाना नहीं है, हमें किसी से झुकना नहीं है, लेकिन हमें आंख में आंख मिला के बात करना है। ताकत तो आज इंडिया की हो गई है। आंख झुकाने का समय नहीं है, आंख ऊंची करने का तो हमारा नेचर नहीं है, देश का नेचर नहीं है। हमारे पास कुछ होते हैं ना, तो हम विनम्रता से व्यवहार करते हैं। मैं कोविड क्राइसिस का साक्षी हूं। हम सब लोगों ने देखा है, जब इंडिया में और दुनिया में लॉकडाउन चल रहा था, दुनिया भी लॉकडाउन में थी, इंडिया भी लॉकडाउन में था, और डेवलप्ड कंट्री की क्या हालत हुई थी, मैंने प्रत्यक्ष, मैं इस घटना का साक्षी हूं। कोई कंट्री के पास, मैं कंट्री का नाम नहीं लूंगा, लेकिन 19 डेज तक उसके पास एजिथ्रोमाइसिन नहीं थी। कई कंट्री ने मुझे कॉल करके कहा कि हम आपको वेंटिलेटर देंगे, प्लीज आप हमें हाइड्रोक्सीक्लोरोक्विन दो। और उस वक्त मैंने कहा था कि ये इंडिया है, मेडिसिन हेल्थ केयर हमारे लिए बिजनेस नहीं है, कॉमर्स बाद में है, पहले सेवा है। हम तो वसुधैव कुटुंबकम की धारणा में मानने वाले लोग हैं। और मोदी जी ने उस वक्त मुझे कहा था कि लॉकडाउन के समय में सभी फार्मा इंडस्ट्री से बात करो, उसको लॉकडाउन पास दो, मैन्युफैक्चरिंग बढ़ाओ, देश की रिक्वायरमेंट पूरी करो, दुनिया को मदद करनी चाहिए। दोस्तों, इस स्थिति में हमने किसी की मजबूरी का लाभ नहीं लिया, हमने किसी को झुकाने की बात नहीं की। 150 कंट्री में हिंदुस्तान ने मेडिसिन उपलब्ध कराई। केवल मेडिसिन उपलब्ध कराई ऐसा नहीं, यहां कई लोग बैठे हैं, एक घटना का साक्षी है। हमने पीपीई किट इंपोर्ट की थी, हमें वापस भेजनी पड़ी, क्वालिटी नहीं थी। हमने दुनिया को ज्यादा पैसा भी नहीं लिया और क्वालिटी के साथ बार्गेनिंग भी नहीं किया, और 150 देशों को हम सपोर्ट करके रहे। ये हेल्थ सेक्टर में हमारी रीति नीति है, ये हमारी जीवन शैली है, हमारा देश का विचार रहा है। और इसलिए हमारी ताकत दुनिया में जल्दी निखरेगी। हमारा कोई साइंटिस्ट जाएगा, उसका व्यवहार हमारे नेचर के अनुरूप होगा। हमारी कोई उपलब्धि इस स्वार्थ के लिए नहीं, केवल देश के लिए नहीं, विश्व के कल्याण के लिए होगी। ये भावना के साथ ये देश चलता है। और इसलिए आपका बहुमूल्य सुझाव इस व्यवस्था में हमें कैसे मिले जो देश के लिए और दुनिया के लिए उपयोगी हो, जो भविष्य में हम हेल्थ को एक्सेसिबल और एफोर्डेबल बनाने में सरकार का जो प्रयास है उसमें हमें सहयोग मिले। देश दोस्तों बदल रहा है, देश आगे बढ़ रहा है, नया भारत का निर्माण हो रहा है, और हम इस इतिहास का साक्ष्य बने जब हमारे न्यू जनरेशन इंडिया का, हिंदुस्तान का मोदी युग को पढ़ता हो, इस संक्रांति काल का इतिहास को पढ़े, तब हमारे पूर्वजों ने भी ये बदलते हुए देश में कुछ कंट्रीब्यूशन किया था। ऐसा सम्मान न्यू जनरेशन हमें दे, ऐसा देश के लिए कुछ करके जाए, ऐसी ही आप सबसे मेरी अपेक्षा है। सभी सम्मानित पद्मश्री, पद्म विभूषण से सम्मानित सभी को मैं हार्दिक शुभकामनाएं देता हूं। उपस्थित सभी भाइयों और बहनों को मेरी ओर से हार्दिक शुभकामनाएं। धन्यवाद।
आपका बहुत बहुत धन्यवाद सर। और इसी के साथ वक्त हो चला है ग्रुप पिक्चर का। आई बीन प्रिविलेज्ड इनफ to be given a list of all our Padma Awardee doctors, and we would welcome you, invite you on stage one by one to join us for a group picture हमारे chief guest और guest of honor के साथ. I would also request Mr. Harbindan Ural to join us on stage, please, for this. And once the group picture has been taken, you would request you to please stay back for the national anthem. Okay. Dr. Dinesh K. Bhargava, Senior Consultant, Gastroenterologist at Indraprastha Polio Hospital, New Delhi, and Medical Academic Writer. Dr. Kamal Kumar Sethi, Chairman and HOD Cardiology, Delhi Heart and Lungs Institute, New Delhi. Dr. K.M. Chirayan, heart surgeon, founder, Frontier Lifeline Hospital. Dr. Arvind Lal, managing director, Dr. Lal Path Labs. Dr. Arunoday Mondal, founder of Sundarban Sujan Medical Center. Dr. Mohsin Wali, cardiologist and physician, Sir Gangaram Hospital. Yes, sir. Ji, sir. Dr. Digambar Behra, President, India Study for the Study of Lung Cancer. Dr. Talochan Sinclair, Chairman, Fortis Heart and Vascular Institute at Fortis Memorial Research Institute, Gurugram, and Fortis Hospital, Vasant Kunj, New Delhi. Dr. A. K. Grover, Director, Department of Ophthalmology, Sir Gangaram Hospital, New Delhi. Dr. Chandrakant Sambhaji Pandav, former HOD, Department of Community Medicine, AIIMS, New Delhi, and President, ICC IDD, Iodine Man of India. Dr. Purushottam Lal, cardiologist, Chairman and Director of Interventional Cardiology, Metro Group of Hospitals. Dr. G.K. Mani, Chairman, Cardiothoracic Vascular Surgery, Max Healthcare. Dr. Rajesh Kumar Grover, former Director and CEO, Delhi State Cancer Institute. Dr. Jitendra Mohan Hans, Chairman and Director, Dr. Hans Center for ENT and Coachella Implant. Dr. M. Khalilullah, former Director, Director Professor, Head of Cardiology, G.B. Pant Hospital. Dr. Jagat Ram, ठीक है सर जी सर ये आधा ही ये लिस्ट आधी ही है ओके सर ये आधी लिस्ट है तो पहले जी मैम Thank you. Let's give them a nice warm round of applause, ladies and gentlemen. Our next group, Dr. Jagat Ram, an ophthalmologist, former director of PGIMER Chandigarh. Dr. Shiv Narayan Kuriel, head of pediatric surgery, King's George Medical University, Lucknow, Uttar Pradesh. Dr. Raman Kapoor, head of department, acupuncture, Sir Gangaram Hospital, New Delhi. Dr. Anil Kumar Bhalla, chairman and HOD, Department of Nephrology, Sir Gangaram Hospital. Dr. Ambrish Mithal, head of endocrinology and diabetes, Max Healthcare, PanMax, Saket, New Delhi. Dr. Randeep Guleria, director, AIIMS, New Delhi. Dr. Shadab Muhammad, professor and head, Department of Oral and Maxillofacial Surgery, King George Medical College, Lucknow. Dr. Balbir Singh, chairman and head, cardiology, Max Healthcare. And we'll wait. Should we continue? Yes. Sir, do we have space for more? No? Okay. We'll have some on the next one. आगे Dr. Balbir Singh, Chairman and Head Cardiology, Max Healthcare. Dr. Balram Bhargava, Professor and Head Cardiology, Chief CT Center. Shri Vedya Rajesh Kotecha, Secretary, Ministry of Ayush, Government of India. Dr. M.V. Padma Srivastav, Professor, Medical Academic and Writer, Department of Neurology, AIIMS, New Delhi. Dr. Sumitra Rawat, Head, Surgical, Gastroenterology and Liver Transplant, Sir Gangaram Hospital, New Delhi. Dr. Harsh Mahajan, Chief Radiologist and Founder of Mahajan Imaging, New Delhi. Dr. Upendra Kaul, Chairman, Badra Heart Center. Dr. Anil Kohli, former President, Dental Council of India. Dr. Yash Gulati, Orthopedic Surgeon, Apollo Hospital. Dr. Mahipal S. Sachdev, Chairman of Center for Sight. And we have 4 more, I think there's space. Dr. Anup Misra, Chairman, Fortis Center for Diabetes, Obesity and Cholesterol. Thank you. And the last group, Dr. Neelam Clare. I also have to inform everybody that Dr. Neelam Clare and her husband, they're the only doctor couple of the country to receive the Padma Award. I think that deserves a big round of applause. Dr. Nitish Nayak, cardiologist, professor, All India Institute of Medical Sciences, AIIMS, and Dr. Mahesh Verma, director and principal, Maulana Azad Institute of Dental Sciences. And thank you so much. And I would request all our audience members to kindly stand for the national anthem. Okay, ladies and gentlemen, please, let's welcome on stage Dr. Yash with your warm applause. I'm very sorry, my My list doesn't matter, but the list doesn't really matter. बहुत छोटी है मेरी लिस्ट आप सबके एक्सपीरियंस के सामने. Can we please play the national anthem? Thank you. और अब हमारे चीफ गेस्ट का, हमारे गेस्ट ऑफ ऑनर का, हमारे सारे पद्मा डॉक्टर्स को और सारे ऑडियंस मेंबर्स का धन्यवाद करने के लिए मैं एक बार पोडियम पर आमंत्रित करना चाहूँगा मिस्टर हरबिंदर नरूला जी को, CEO BW हेल्थ केयर वर्ल्ड एंड BW वेलबींग वर्ल्ड.
मैंने किसी का नाम नहीं डाला. आपको लेके आए ना 2 लाइन में नाम बताओ. मेरा तो WhatsApp लास्ट में करके राधा कृष्णन बोलेगा और सिंपल इंस्ट्रक्शन दे दो.
मैं दे रहा हूँ. आप पहले वोट ऑफ थैंक्स. आप बोलिए.
लास्ट के लिए नेशनल एंथम नंबर होता है. Respected Honorable Minister for Health, Family Welfare, Chemical and Fertilizers of India, Shri Mansukh Mandavia ji, Minister of State for Health and Family Welfare, Dr. Bharati Pawar ji, all the Padma doctors present, special dignitaries and guests, Dr. Anurag Batra, Dr. Sudeep Srivastav. As a citizen of India, today I feel proud of what we have achieved. As a country known globally for information technology, is now also known for its development in healthcare. Thanks to each one of you sitting in the august audience today, we are now a go-to nation for affordable and quality healthcare. On behalf of Business World Healthcare, Heal Foundation, I'd like to thank each one of you who have made it today. I would not like to come between you and the dinner, and would like all of you to join us for dinner with folded hands. I also want to thank Shri Mukund Purohit ji for his contribution to making this event a reality. Thank you.
Thank you so much, Mr. Narula. Ladies and gentlemen, it's now time for dinner. And we have two buffets. Both are on your left. That's the hall left. One is for all our audience members who are sitting in the theater style seating. And one's for all our Padma doctors and their spouses. My name is Aditya Malik. It was a pleasure to host for all of you. Thank you so much. And once again, thank you for your contribution and your dedication. Thank you.